गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः. गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरुः साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः.
Good evening, everyone.
Good evening, all. Team Ayurveda present Sampuraka National Seminar with paper and poster presentation. After successfully completing one session, we came up to the second day, and I hope the same enthusiasm will show from all of you. And we are pleased to be able to welcome you all once again. So before starting the presentation, I would like to honor our faculties so that we can start the session with their blessings. We welcome you all. And before start, as we commence our seminar, kindly adhere to the following rules for a productive session. The presentation will be live on YouTube channel and the copy will be saved. So please don't unmute yourself unnecessarily. And most importantly, you have a maximum of 8 minutes to present your topic. So please follow the same. And with any further add-on, let me call upon the stage our first presenter, Dr. Megha Sawle. I invite Dr. Megha Sawle for the presentation. Dr. Megha. So next I invite Dr. Abhilasha Singh. I invite Dr. Abhilasha.
Yes, ma'am. Hello.
Yes, doctor, you're audible.
Yes,
Please
ma'am.
share your screen.
Okay. Hello.
Yes, doctor.
Okay, ma'am. Is my screen visible?
Your screen is visible, doctor. Please start the session.
Yes, it's visible.
Okay. Good evening, everyone. Myself, Dr. Abhilasha Singh, and I'm going to present my paper on management of Shukrakshaya or Oligozoospermia by Ayurvedic intervention. So, as you all know, that infertility is a very increasing clinical issue these days because of the lifestyle and whatever modifications we are dealing today in today's era. So here we will deal with the Shukrakshaya. We have taken a case of oligozoospermia, and we will be treating him by Deepan Pajan, Shodhan, and Shaman and Vajikaran Chikitsa. This is the basic introduction of my paper. So the case study is of a 35-year-old male patient who came to the OPD of Kayachikitsa on 8th April, and he was a known case of oligozoospermia without any comorbidities. And he had been married for 5 years, but he had no child. And after which he went on to a doctor, and that doctor suggested him to do semen analysis, and his reports came, and with a 8 million per milliliter of sperm count, he was diagnosed with oligozoospermia. Then he came to the he came to our Ayurvedic Kayachikitsa OPD for its treatment. So the assessment criteria was this only, the semen analysis report. And this course of whole Ayurvedic intervention was for about 3 months post Shodhan and Shaman therapy. So the chief complaints of the patient was basically that he was a known case of oligozoospermia, and he had general debility, weakness, and no any comorbidities were present. So as you can see that he had no past illness history, and no any surgical history. And also this onset, we assume that it is gradual, because he had no such general debility or weakness beforehand, and he had not done the test before. Then Rugna Pariksha, his BP was normal, about 130/70, and the weight was 78. So the rest, all the systemic and general examinations were normal. Then when we come to the Ashtavida Pariksha, all his Ashtavida Pariksha criterias were normal, and the Jiva was Sam. So we concluded that he had Sam dosh in his body. Then we come to the management part. So the patient was administered with, first of all, when he came to the OPD in February, then his Deepan, Pachan and Branghan was initiated in the OPD itself. And at that time he had a known case, but he did not produce us with a semen analysis report. Then what we said to him that you continue these medications. So Ampachak Vati, Chitrakardi Vati, Arogya Vardhini, Vrish capsule and Ashwagandha Grit was administered to him. Then the for 7 days, about 7 days, then the patient unfortunately discontinued the medications for the treatment for about 1.5 months due to some personal reasons. Then he later again came to the OPD back on 8th April, and then we reinitiated the Deepan Pachan and Bringhad regimen. Then the same medications were repeated. Then after that, we had planned for his Virechan. Because as you know that Virechan is very much required before administering the Vajikaran Dravyas. So Abhyantar Snehpan was started with Ashwagandha Grit, and as you can see that he had a Madhyam Koshta, so we initiated with a 25, 50, 75, 100 and 150 milliliter of Ashwagandha Grit every day. And then he was admitted in the IPD for Virechan, and on 2nd March, and he was administered with 3 tablespoons of Trivit Avle for Virechan. The total Veg we got was 16 Vegas, and we concluded that it is Madhyam Shuddhi. And later on, we gave him a discharge and asked him to do the Sansarjan Kram. And then later on, when we had his first follow up, when we had his second follow up post this Virechan therapy, we asked him, we gave him Vajikaran and Bringan Aushadhis, which was Makardhwaj, tablet Shila Prabham, Ashwagandha Arisht, and Ashwagandha Ghanvati. So this was mainly for the Vajikaran and Branghan of the patient. So these 4 medications were continued later on till about 3 months. So later on we see the results. So this was the observation before the treatment was started in February. When he came, we asked him to get his semen analysis report, and this was the presentation. In that, the sperm count, as you can see, was 8 million per milliliter, and the sperm motility was 15%. So the comment in that report was Oligozoospermia. And then later on, after when the initial treatment was started, the Deepan Pachan, then again it was the same. About 10, even after that, one week of taking Deepan Pachan medications, his count had a bit increased. We can say that it was 10 million milliliter per milliliter, and the sperm motility was also increased by 25%. Oligozoospermia was still the case. And then on the second follow-up, this was on 16th June, which was after the Vajikaran was done, and about 1 week of Vajikaran medications were taken. So this was after Shodhan and a bit of shaman therapy and Vajikaran therapy was initiated. So you can see that the sperm count here was 32.6 million milliliter, and the sperm motility also increased to 50% later on. And this here we have that the whole semen analysis was within normal limits. And on the third follow up later on, when he had taken the medications for about 2 months, then again the semen analysis was repeated, and you can see that 50 million per milliliter was the sperm count has reached to 51 million per milliliter, and the sperm motility has also increased to 62%. Here are the his general reports, the pictures of his reports. The first one is from before the treatment, and later on you can see that within normal limits it is showing 32.6. So we had achieved this after Shodhan and a bit of a Vajikaran treatment and Vajikaran and Rangan treatment. So hence the result is that the patient showed significant improvement in many of his variables of semen analysis, and the analysis report was changed from oligozoospermia to uh, normal form in the course of these 3 to 4 months of treatment Ayurvedic intervention. So finally, we conclude that Ayurvedic intervention has a noteworthy improvement in cases like oligozoospermia. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you for the presentation. Next, I invite Dr. Nigesh Kejanan for the paper presentation.
Sir, I have a doubt because I also have
You
a
have
post
a poster, right, doctor? We will call you next, doctor. I know you have a poster presentation on the topic single drug management of Vyenga by Jadipala Churna, a case study. I know, doctor. We will call you next. Okay.
Thank you, sir.
Dr. Nigesh Kejanan, are you there?
Yes. Yes, sir. Yes.
Okay, doctor.
Hello.
Please share the screen, doctor.
Yes, yes.
Yeah.
Can you see the slide?
Yes, doctor. Your screen
Hello.
is visible.
Yes.
Please start the session, doctor.
Okay. Good evening. Myself, Dr. Nikesh Gajanan Mante. I'm PG scholar from Swastrata department from Sumati Vaishya Ayurveda Mahavidyalaya, Pune. Today's topic for presentation is Pathya Pratyaya in Rajakshma. So let's start the topic. What's the history about that? This King Chandra married 28 daughters of Daksh Prajapati, but was unable to satisfy all except Rohini, as he was more interested in her. So the remaining complained to their father, and Daksh Prajapati became furious, and his anger came out of his mouth through expiration, and King Chandra suffered by Rajakshma. This is an historical story which is given in Samhitas. Synonyms for Rajakshma is that is Rajakshma, that is because King Chandra suffered that this is first time, so it is called as Rajakshma, as well as Kshay. It diminishes the strength and activities that causes the Kshay or Shosh, because it dries up the Rasadi Dhatus, and Rogarat, as it is powerful disease and it is very difficult to treat, and it was called as Rogarat. What are the hetus that are according to Charak? There are 4 etiological factors that can cause Rajakshma, that is Sahas, Sandaran, Kshay, and Vishamashan. According to Shushrut, there are 4, that is Kshay, Vega Pratighat, Aghat, and Vishamashan. Then these hetus are compared as Charak, Shushrut, Vagbhat, and Madhokar. So most of them are same. Charak says Sahas, Sandaran, Kshay, and Vishamashan. According to Shushrut, Aghat, Veg Pratighat, Kshay, and Vishamashan. Vagbhat according to Akbar, Sahas, Veg Sandrot, Kshay, and Vishamashan, and Madhavkar, Vegorot, Kshay, Sahas, and Vishamashan. Most of them are same, not as more different than anyone. That Pura Rupa of Rajakshmar Pratikshay, that is Koraiza or Daurbalya, that is weakness. Dosha Darshanam, that is finding fault with right things. Vivitsa Darshanam, appearance of ugly signs and symptoms in the body. Feeling disgust towards the food. Then Bala Maunsakshay, Stri Madhya Maunsa Priyata, and Anana Abhilasha. Samanya Samprapti, according to Charak, as Charak explained as Samanya Samprapti of Rajakshma. That is Nidan Sevan, that is Sanyakrishta Nidan Sevan, Upasarga and Rajakshma. But Viprakrishta Nidan Sevan, that is Sahas, Dhatukshay, Sandharan or Vishamashan. Then Sahas causes Vata Prakop, Dhatukshay in Pratilom Karma, and Sarva Dhatukshay, Shosh, and causes Rajakshma. Like that, only Dhatukshay also causes Shukrakshaya, then Vata Prakop, Dhatakshay, and Sanrut Sarva Dhatukshay, and Shosh, that is Rajakshma. Sandharan and Vishamashan causes Kapha Pradhan Tridosh Prakop, Strota Avrud, Dhatukshay in Anulom Karma, Sarva Dhatukshay, Shosh, and Rajakshma. The types of Rajakshma, that is Sahas or Aghataj. When a person does the work which is out of his capacity is called as Sahas. Acharya Charak mentioned these different examples of like when a weak person fights with a stronger person, performs exercise with a big bow, or carries overweight. What is Samprapti of Rajakshma is that due to physical exertion like Sahas, battle, weightlifting, or traveling on foot, leaping or jumping, increases the inspiration expiration. Abnormal breathing injures tissues of the lung, that is Kshatta. Whited Vayu degenerates the Kapha and Pitta, dearrange the doshas along with the Vayu spread in all direction within the body, and that causes Rajakshma. Lakshanas are, that is Ramba Angamarda, for Urorog, or Arochak, Kanto Dvansa, Swarabhed, Swas, Pratisha, and Shirashul. Second is Vega Pratigadaj, that is due to separation of natural urges of Apan, Vat, Mutra, and Mala because of attending the king or master. Means in old in old time or previous era, there was a ritual that king has lots of his men who will attend that king or master, and they were not allowed to do anything without permission of the king. Attending the meetings of gentlemen, three madhya means sitting in between the ladies while traveling or uneven vehicle, bhaya, prasanga or during maithun, lajja or gruna. These are the causes which can cause vega Samprapti of Vega Pratigata, that is suppression of natural urges, that causes vitation of what? Disturbance of Agni, vitation of all three doshas, obstruction in the channel of the circulation, and the vited humors produces the disorder having symptoms of three prakopta three doshas that causes Rajakshma. The Lakshanas are Shula, Malabheda, pain in ribs or sides of the chest, irritation in chest and throat, headache, cough, dyspnea, fever, and hoarseness of voice. Kshay Hetu, that is Anulom Kshay Hetu, excessive shok, chinta, irsha, utkanta, bhay, krodha, or afflicts heart, rukshahar, alpahar, all above etiological factors leads to rasadhatu kshay, which leads to manifestation of shosh rog. Delay management causes Rajakshma. Shukrakshay, Lakshana, pain in the side of the chest and shoulders, irritation in throat, Angamarda, Aruchi, indigestion, Jvara, Kasa, Swarabhed, Pratisha, and excess cast leads to sputum along with the rakta, and due to rakta kshay, further dhatu formation stops and person becomes weakened and leads to Rajakshma. The Samprapti of Kshay Rajakshma, that excessive sexual indulgence, fasting, excessive bleeding, and eagerness, fever, and terror and anger, that causes loss of unctuousness, that is dhatu kshay, vitation of vata, aggravated to other doshas, obstructed of channel circulation, degradation of dhatus, and produce 11 symptoms, that is ekadash rupa of Rajakshma. Vishamashan, if the person adopts unhealthy dietic pattern, will lead to Rajakshma. Here, vitate vata leads to Shula, Angamarda, Kantvodvansa, Parshva, Sammarujan, Swarabhed, and Pratisha. Here, vitate pitta leads to Jvara, Atisara, and Antardaha. Vitate kapha leads to Pratisha, Aruchikas, and Sirasva Gurutvam, that is Guruta in Shira Guruta, heaviness in head. Samprapti of Vishamashanjana Rajakshma, that is a person who take food against the Ashtavidhi Visheshayatana and 10 Vidhi Vidhan, leads to vitation of Vat. Vat aggravates other two doshas, obstruction of channels of Rasa and other dhatus, dhatu not nourished properly, and produced 11 symptoms of Rajakshma due to the irregular diet. Three Rup Rajami, that is Swajwara, Kas and hemoptysis. Shadrup, according to Charak and Shushrut, that Parshvashvil is different here. In Shushrut, that is Shonit Darshana. Then Shwas is different here. That is this Charak Kas Jwara Parshvashvil Swarabhet Atisar and Aruchi. And in Shushrut, Kasa Jwara Swarabhet Aruchi Shwas and Shonita Darshan. These are Ekadash Rupa projects according to Charak, Shushrut and Vagbat. Sampraptiकडे that is kapha pradhan tridosh, vata, pitta and kapha. Dushar dhatus like rasa, raktadi and all dhatus. Upadhatus let sira and sandhi. Sharirik mala, that is mutra and purish. Dhatu mala like kapha, pitta, sveda, loma, kesh and nakha. Agni, that is jataragni, dhatu agni, bhutagni. That causes agni mandya. So agni dushti is mandata. Srotas annava rasava, shukrava, mainly rasava, that is anulom, and shukrava, that is pratilom. Later all the srotas get obstructed. स्रोतदृष्टी संग एंड विमार्ग गमन उद्भवस्थान अमाशय एंड पक्वाशय अधिष्ठान सर्व शरीर व्यक्तस्थान मुख एंड सर्व शरीर संचार स्थान रसवाहिनी एंड स्वभाव दैट इज चिरकारी. Then let's move to Patya and Rajakshma. In Shukadhanya Varga, we can give Gahu. It causes, it is Vatshamak, Bruhankar, vitamin B1 reached and vitamin A reached, which causes protein, which gives protein, more protein to fight against and to develop an immunity. Second is in Shukadhanya, that is Yava, that is barley. Balya, it causes it kapha, it causes treatment of prakupit kapha, and it slow downs it. So it is balya, and it is advised that 1 year old all dhanya should be taken every day. So it is light to light light for digestion, and it does not causes pitta prakup. In Shimbidhanya, that is Moog and Kulit, Lagu, Kapha Pittanashak, Loha, calcium, vitamin A, and vitamin B raised. In Kulit, they are Vatanashak, Kas, Shwas, Vati, and useful in Kas and Shwas. In Kanda Bhaja, that is Mula, Tridoshagna, in Mounds work, potassium, zinc proteins, and amino acid secretor. This in mouse worker, mouse is an amino acid secretor, which is useful for protein, more protein digestion. In mouse worker, most of jungle mouse, that is harin, sasa, lava, more. These are dhatu vardak and agni deepak. Bakra, that is dosh prakop. It doesn't cause dosh prakop, and it causes bruhan. In Dugdha Varga, milk of a goat, which is light for digestion, and it will diminish the dhatuksha and agni-mandya. In Far Varga, dalim, that is dadim. It is tridoshagna, aruchinashak, and it causes it enhances agni, that is jatar agni. Then coconut, draksha, that is grapes. This is the sarvattam phala according to Akbat. It is vatnashak, kasaswas, useful in kasaswas, jwara, swarabhet, urakshat, and shainashak. In amra, it is jataragni vardak, so it is advised. Orange, that is aruchinashak and rich in vitamin C. Shushka phal, that is badam, akrod, pista, manuka, charoli, and godambi. These 6 are advised. Pathakar Vihar, that is meditation, Abhyanga, Svedana, and Pranayam. In Yogasana, Tadasana, that is standing mountain pose. This straightforward pose requires standing tall to open up the chest. Paschimottanasana, that is seated forward bend. This poses help to strengthen the respiratory system. Parshvatadasana, this bend will help to strengthen the diaphragm while also improving the flexibility of ribcage. Anuvittasana, that is standing back bend. This pose also helps to open the muscle of the chest. Apatyahar, according to Yoga Ratnakar, Wangi, Karli, Bilwa fur, and Bilwa tail. These are This should be avoided. Refrigerated foods and drinks and junk food should be avoided. Apatya Vihar, that is Divaswap, Maithon, Krodh and Atisahas. Thank you.
Thank you, doctor.
Thank you,
So
Dr. Nikesh.
next,
Sir,
let me invite.
sir, I can go offline because I have duty.
Yes, doctor.
Okay, thank you.
Yeah, sure. Please. So next I invite Dr. Megha Sawle.
Hello, ma'am.
Dr. Megha.
Hello, ma'am.
Hello,
I'm
doctor.
audible?
Yes,
Yes,
Doctor. Audible,
doctor.
Doctor.
Okay. My screen is seen.
Yes, visible, Doctor. Please start the session.
Okay. 1 minute, sir. Good evening, all. Today I am presenting the paper of the topic of role of Ayurveda in the management of vishada, schizophrenia, a case study. Introduction. Nowadays, various psychological diseases such that manasvatis are formed due to the increased stress, chinta, krodha, and manas bhav, and changing lifestyle and eating habits, etc. In Ayurveda, schizophrenia can be correlated with the vishada. It means sadness or one of the fearful conditions in which manas doshas, such that rajas and tamasa are increases, which develops vishada. It is one of the vata jnanatmak vikar. According to the Acharya Charka, mentioned that vishada is one of the cause of for disease development because it is explained in the Agra Sangraha such that vishado raghava param sashrashtam. Schizophrenia is the most common psychotic disorders that are characterized by a loss of contact with reality. About 1% of population suffers from schizophrenia. The average age of onset of men is 18 and for women is 25 years. Symptoms of vishada has been classified into two positive and negative categories. Positive symptoms include hallucinations, delusions, disorganization speech. These symptoms appear to be related to the related dopaminergic activity in the mesolymphic region. In another side, negative symptoms include diminished social ability, restricted affect, poetry speech, and these symptoms appear to be related to the decreased D2 activity in mesocortex system. In this case study, schizophrenia was treated with the help of Ayurveda, which includes some shaman aushadhis, which helps to reduce the signs and symptoms of schizophrenia, such that vishada. Objective of the study: to study the role of Ayurvedic medicines in vishada. Materials and method: case study. A patient having age 37-year-old male complains Khandit Nidra alternate days since from 3 to 4 years. Asthir Man, Pischil Malapravruti, Alasya since from 4 months. Ashtavit Pariksha and general examinations are normal. Past history: known history of schizophrenia since from 12 years. Previous medicine history: tablet Sinozes 200 mg HS, tablets Sequis plus half HS, tablet Beta Cap TR 20 mg OD, tablet Akul 2.5 mg HS, tablet Vibracet CD OD. Personal history: no any personal history of pan chewing, tobacco chewing, and alcohol. No any drug history. Occupational history: computer operator. Management: in this case study, schizophrenia such that vishada managed by the Manas Vatakam, Saraswatarishta, capsule Nidrayog, Himsagartel, Purar Chandrodairas, and capsule Rasayan. Manas Vatakam, Matra 250 mg OD, Adho Bhakta for 30 days, Saraswatarishta, Matra 40 ml Nisha Kale with gel for 30 days. Capsule Nidrayog, two tablets, 250 mg HS, Nisha Kale with gel after for duration of 30 days. Himasagar Tel, local application for head massage, Nisha Kale for 30 days. Purana Chandrodaya Ras, half teaspoon OD, Adho Bhakta, Anupani is a Grutta plus Madhu for 13 days. Capsule Rasayan, 250 mg BD, Adho Bhakta, Anupan with gel for 30 days. Observation: the effect of treatment on signs and symptoms like Khandit Nidra, alternate days since from 3 to 4 years, Asthir Mana, Pichil Malapravruti, and Alesya since from 4 months as follows. Before treatment, all these are parameters with 4 plus. After treatment, it was reduced to O+1, which is a grade 0. Gradation of symptoms: mild, score 1 to 3, gradation is +1. Moderate 4 to 6 score gradation is +2. Severe 7 to 10 score, which is +3 gradation. Drug review. Manas Vatakam is a famous formulation mentioned in Sahasrayog, which is acting on Manas Manova Srotas, which leads to reduces the stress, tension, anxiety, promotes restful sleeps, helps to reduce the aggravated Vata dosh. Sarasvatarishta was used in the management of anidra, such that insomnia. This contains drugs like Brahmi, Shunti, Shatavari, Vidari, Ushil, etc. It has properties like Rasayana, Medovara, Nidrajanan, Pachana and Rudya, etc. External application on head with him sagar tel was used in this case study. It is a decreased anxiety and insomnia. Capsule Nidrayog is a herbal sedative which helps to provide the sleep well. Purana Chandrodaya Rasa is one of the herbal as well as mineral ingredients which is mentioned by the Sahasra Yoga and Rajnigantu. It is used for rejuvenation and anti-aging treatment. It helps to balances the Vata dosha, which helps to reduces the signs and symptoms of schizophrenia. Conclusion. In this case, all symptoms like Khandit Nidra, Ashtiramana, Malapravrutti, Alasya are marked diminished in 30 days of study. In the conclusion, Manasvatakam, Sarasvatarishta, Avipattikar Churna, Him Sagar Tela, and Purana Chandrodaya Rasa, Capsule Rasa and Capsule Tagar are significantly effective in the management of schizophrenia, followed by the proper Pratya and Apatya of Chikitsa. These are the references. Thank you. Thank you,
Thank you,
sir.
Dr. Megha.
Thank you, doctor.
Are you ready to present poster now, doctor?
Yes, sir.
Okay, please continue, doctor.
Okay, sir. 1 minute. My poster. 1 minute. Yeah. Poster. Shuddha Vati in the management of Gridhrasi. Gridhrasi is a disease mentioned by the Acharya Charak and Acharya Shushrut. Gridhrasi is a Grudavat Chalati. Yes. Sir, did you screen share? My screen is visible.
No, your screen is not visible, doctor.
No, doctor.
Okay, 1 minute, ma'am. Just. Is this visible?
It is on sharing now.
Is
It's
it
visible, doctor.
visible now?
Okay, ma'am. Should I start? Yeah.
Yes, please, doctor. Please start.
My topic is a Shuddha Vati in the management of Gridhrasi or Sciatica. Gridhrasi is a Grudavat Chalati Yasmina Rogaiti Gridhrasi. In this disease, the patient walks like the bird Gruda and his legs become tense and slightly curved. Hence, due to the resemblance with the gait of virtual, Gridhrasi is a term might have been given to this disease. Gridhrasi is a disease described by the Acharya Charaka and Shushruta. The introduction, the Gridhrasi is described by the Kayachikitsa Adhyay 28, Shlok number 56 and 57. Description of this introduction is Gridhrasi is characterized by the Stamba, Ruka, Toda, and Moha Sampadana. These symptoms initially affect the speaker as well as posterior aspect of Kati and then gradually radiates to the posterior aspect of Uru, Janu, Janga, and Pada. Additionally, in this, Kafavathanubandha, Tandra, Gaurav, and Arachaka are present. Samprapti Ghatak, Dosha, Vata and Vata Kapaj, Dusha, Asti, Majja, and Nadi Sansthan. Adhishtan, Spika, Kati, Uru, Janga, and Pada, Strotasa, Astivaha and Majjavaha with Nadi Sansthan. Strotodrushti Prakar is a Sangha, व्याधि स्वभाव आयुष्कारी और चीरकारी साध्य असाध्य पुरुष साध्य case presentation. A 30-year-old married hypertensive female which is a homemaker presented with a complaints of radiating pain lower back to the left leg along with the tingling sensation. Left leg is left pain is greater than right since 2 weeks. Numbness numbness is present in bilateral leg, lower back, difficulty in walking, aruchi and adman. Objective to study the role of Shuddha Vati in the management of Gridhrasi. Shuddha Vati is mentioned by the various acharyas, Sushruta Charaka and Rajnigantu also. Sushruta mentioned in the Sushrustan Shlok 4 and Acharya Charak mentioned in the Sutrastan 25 Shlok. Rajniguntu mentioned as 105 Shlok. Management of this Shuddha Guggulu Vati is made by the Samanya Shodhan afterwards. Management. Shuddha Guggulu Vati 250 gram was given in a 2 dose of 2 tablets twice in a day for a period of 14 days with the follow-up of 7 days. Latin name Combifera Mukul, Rasa, Katu and Tikta, Guna, Laghu Ruksha, Tikshna, Vishada and Sukshma, Virya Ushna, Vipaka Katu, Prabhava Rasayan, दोषघ्नता त्रिदोषक शामन रोगघ्नता वात व्याधि रुद्रसी कोष्ठशीर्य अम्लपित्त etc कर्म मेदोग्न बल्य रसायन वात कफर etc chemical composition of Shuddha Guggulu. Guggulusterone E and Z, it has properties like antioxidant, antiarrhythmic, anti-inflammatory and anti-rheumatic. Guggulosomes analgesic and anti-inflammatory. Anti-inflammatory it work as ibuprofen, anti-rheumatic. Bioactive terpenoids, anti-inflammatory, antioxidant, anti-cancerous, and antimicrobial properties. Last one is a myphenol A and myphenol A. It has properties like anti-inflammatory, anti-rheumatic, and anti-arrhythmic. Observations. These are the Ruka, the Stambha are the subjective parameters which is mentioned by the Charkacharya. The Ruka has afterwards Ruka has no specific characters in right and Ruka Toda Stambha Graha Spandana Gaurava in right or left leg significantly before treatment it is 2, after treatment it is 0. So the right leg, it has nothing, no, it is normal. In Stamba, left leg, before treatment it is 1, after it was a 0. Graha has no significantly role. Spandana, in the left leg, before treatment it was T, after it is a 0. Gaurava, in the right leg, before treatment and after treatment it seems to same. Left leg, before treatment 2, after treatment 1. Tandra and Aruchi. Tandra has no significance in this case. Aruchi, Aruchi before treatment and after treatment it is the same. SLRT is a objective parameters for the sciatica now. In the right leg, it is a SLRT positive in between 71 to 90 degree. In the left leg, afterwards it turns into greater than 90 degree. Left leg before treatment it was 51 to 70 degree. After treatment it is 71 to 90 degree. Visual analog VAS scale before treatment it is a 10, after treatment it is a 4. Thank you, sir.
Thank you, doctor. So next, I would like to invite Dr. Shivshankar Sambhaji Lokhande.
Yes, ma'am.
I invite Dr. Shivshankar. Good evening,
Good evening.
doctor. Please share your screen.
Yes, ma'am. I'm sharing it now. Am I visible?
Yes, Dr. Visible. Please start the session, Doctor.
Thank you, sir. My name is Dr. Shivshankar Sambhaji Lokhande, MD Scholar, Department of Kayachikitsa. My topic is Ayurveda for Public Health. Introduction. Ayurveda is an ancient medical science which has been a founding stone of our rich culture and educational heritage. According to WHO, health is a state of complete physical, mental, and social well-being, and not merely in an absence of disease or infirmity. The whole principle of Ayurveda are mainly based on exact the same. Swasthasya swastha rakshanam and aturasya vikar prashavanam. In today's modern world, the world being a place of constant stress, hurry, and all types of pollutions, also food being loaded with all kinds of pesticides, herbicides, and adulteration, this has caused an immense surge in various diseases in all over population. Various physical, psychological, and lifestyle disorders are now in abundance. Hence, there is now a dire need to embrace our Ayurvedic science for all society to maintain a complete and all-around state of well-being and to live a natural life. My first point is Dincharya. Our acharyas have concluded that the equilibrium of three dosha helps in maintaining the health. Dincharya helps to establish one's constitution of three dosha equilibrium. It also regularizes person's biological clock, aids in digestion, absorption, generates self-esteem, discipline, and longevity. Dincharya includes various tasks such as Brahma Muhurta Uttishtam, Dantadhavan, Nasya, Anjan, etc. Next point is Rutucharya. Rutucharya is a set of guidelines to follow during a specific season like winter or summer. It helps in maintaining the same equilibrium of three doshas over different Rutu. Different Rutucharya mentioned in Ayurveda are Hemant Rutucharya, Shishir Rutucharya, Grishma Rutucharya, etc. Next point is Ashtahar Vidhi Visheshayatan. Our acharyas have thought of every inch of detail in keeping the person's or society's well-being intact. Ashtahar Vidhi Visheshayatan are guidelines about which food you should consume and in what way it should be consumed to preserve and enhance its nutritional values. They are Prakriti Karan Sayog Rashi Desh Kala Upayog Samstha Upabhokta. My next point is Shaman. It is equally necessary to eliminate any state of disease, whether it may be physical or psychological, and to regain a state of complete well-being. To eliminate diseases, acharyas have described three methods. Shaman, which first is Shaman. It means to restore equilibrium of three dosha through certain measures like Dipan, Pachan, Shuddha Nigraha, Trishna Nigraha, Vyayam, Atap Sevan, Marut Sevan, etc. Next point is Shodhan. It means to eliminate the Vikrut dosha or mala by certain procedures through our body's natural orifices. Vaman is therapeutic emesis, Virechan is therapeutic purgation, Nirguvavasti is therapeutic enema, Rakta Mokshan, therapeutic bloodletting, and Nasya, giving medicines through nostrils. My next point is Nidana Parivarjana. It means to avoid doing some things or avoid eating some foods which either causes the disease or elevates the stage or symptoms of the disease. Example, Vidahi Bhojan and Madhya Sevan in Rakta Pitta, which elevates the disease or causes the disease. Next point is Rasayan and Vajikaran. First, Rasayan. Our acharyas have established a certain way of procedures which helps in rejuvenation of body and mind and keeping the state of youth for a prolonged period. It is called as Rasayana. Types are Kuti Praveshika and Gatatpik Rasayan. Second is Vajikaran. Ayurveda described four Ashana, out of which Kameshana means the necessity to reproduce. Vajikaran helps in keeping a good sexual life throughout the life. My next point is conclusion. This tiresome, polluted, and exhausting modern world has become home to many new generation lifestyle diseases. Pandemics like COVID-19 prove that all of our society needs to improve their way of life and work towards betterment of their complete physical, psychological, and social well-being. A ray of hope towards this goal is Ayurveda. Hence, Swasthasya Swastha Rakshanam and Aturasya Vikar Prachanam is the motto of Ayurveda, which should be learned by the whole world and it should be put to practice so that a state of complete well-being is achieved as a person and as a whole society. My topic is complete, sir.
Thank you, Dr. Shivashankar
Thank you,
Sambhaji.
doctor.
Thank you, sir. Thank you, ma'am. Can I leave, sir? I have
Sure,
duty
doctor.
to.
Yeah, sure,
Sure,
doctor.
sure, doctor. Please.
Thank you so much, sir. Thank you so much, ma'am.
So next, let me invite Dr. Abhilasha Singh for the poster presentation. I invite Dr. Abhilasha.
Yes, ma'am. I'm just sharing my screen. Is my screen visible, ma'am?
Yes, doctor, visible. Please chat, doctor.
Okay. So the topic of my poster is single drug management of Vyanga melasma by Jatifal Churna. So as you all must be aware that Vyanga is one of the Shudra Rogas explained by Shushrat Bhav Prakash Acharya, and the characteristic of the Vyanga is Nirujam Tanukam Shavam Mukhe Vyange Tamadishet. which explains that the Shyavavarna Tanuk, and it is painless, Nirujam and Mandal, round in shape. These are the patches found in skin. So if we correlate it with in modern science, then we can basically correlate it with hyperpigmentation with respect special reference to melasma. So as you know that melasma is brown patches that appear on face after sun exposure or due to hormonal imbalance during pregnancy. So we conclude that it is Vyanga and it can be correlated with melasma here in this case. So the objective of our case study was actually the use of Jartifal Churna Lep with Madhu in the management of Vyanga. Here we had a male patient of 42-year-old, 42-year-old male patient who had complaints of Mukh Pradeshi Krishna Vaivarnita and Kandu, along with Kandu and Daha on his face and nose. So the number of lesions he had on his face and nose were two of about 5 to 6 centimeter and 3 to 4 centimeter each. And the choice of drug we had was Jatifal. So when we go through the treatment protocol of Vyanga and Nelika as well, the Bhav Prakash has mentioned that Siraved, Pralep Tatha Abhyang. So Pralep is one of the Bahya Parimarjan Chikitsa for Vyanga, according to Bhav Prakash. And the reference of Jati Phal Churn Lep we had taken from Bhav Prakash Chakradat, both of them. As explained by Bhav Prakash, it is Jati Phalasya Lepastu Haret Vyang Cha Nilikam. So Jati Phal Churna Lep is used in the management of Vyang and Nilika as well. So this is the reference by Bhav Prakash. And again, when we go to Chakradat Samhita, Chakradat, and we go to his Shudra Rog Chikitsa, there we can see that Jati Phal Kalk Lep is used in the management of Nilika and Vyang as well. So we have taken the reference from Chakradat and Bhav Prakash. And then we have used
Hello, doctor. Hello, Dr. Abhilasha. Okay. Next, I invite Dr. Sayali Sahabrao Radod for the paper presentation.
Hello.
Hello,
am I
doctor.
audible? I think
Hello.
I
Yeah,
lost
you
my.
are audible, doctor.
Can you share my PPT?
Okay, just a moment, doctor. Doctor, please start the session, doctor.
Okay. Good evening, everyone. I am Dr. Saili Rathod. My topic of presentation is Murdha Tela. Murda Tela is a process in which Sneha is applied to the Sneha is applied to on the head, or it is a procedure of creating the head with oil. Uh, there are four types of Murda Tela: Shirobhyanga, Shiroseka, Shiropichu, and Shirobasti. These are superior in their successive order. Shiro Abhyanga, application of oil on head followed by massage, is popularly known as Shiro Abhyanga. It is performed as a part of Shiro Abhyanga. It acts as an important route of drug administration from persons suffering from Shiro Roga. It is one of among the Dinacharyas. According to Bhagvat, it is indicated in Rauksha, Kandu, and Mala, and contraindicated in Kaphagrasta and Ajirna persons. Procedure for it required medicated oil, vessel, towel, and Snehanartha Churna. In preoperative procedures, we do oil to the oil is taken should be Kharapaka or Madhyampaka and or lukewarm. Uh, uh, Operative procedure applied on anterior frontanel and then to whole scalp. Karnabhyanga to be done prior. It is totally indicated, included in 9th step. Smearing the oil. Uh, घर्षण हस्त मृद्वांगुली ताडन द्विहस्त ताडन then tarang hasta anguli kridan hasta mridu mushti tadan and then shabdanguli kridan and ghatika hasta. In post-operative, it is for about 15 minutes. Bath with lukewarm water and applying Snehanartha Churna applied on Rasnadi Churna over scalp. Shiroseka or Shirodhara, it is continuous pouring of medicated liquid in a systematic manner on a forehead or scalp using Dhara Yantra. It is also called as Dhara, Seka, Parisheka, or Avasheka, Sechan. Then, based on liquid used for Dhara, it has many types like Tela Dhara, Takra Dhara, Kashaya Dhara, Shir Dhara, and Jala Dhara. It is indicated in neurological disorders, psychiatric disorders, psoriasis, eczema, and hypertension-like disorders. It is contraindicated in Kapha Vikara, as Shirodhara further increases the Kapha. Then for procedure, patient should be told to pass the natural urges to made to lie a supine position. Eyes and ears should be covered with cotton to prevent the entry of oil. The dharapaka is placed over 4 anguls above the forehead. For selection of sneha, for vata and kapha dosha, we use tela. For pitta and rakta dosha, we use grita. For vat, pitta and rakta, we use grita and tela. And for vat, pitta, kapha and rakta, we use half part of grit and 1 part of tela, til tel. Now, then duration, for sake, we has to be poured for half an hour up to 21 days, as though it is believed that the therapeutic effect gets sarvangagat by 21 days according to Sahasrayog Dharakalpa. In Rakta and Pitta Yukta Vata, 2 prahar, and in Snigdha and Kapha Yukta Vata, 1 prahar. Period of changing the liquid. Milk should be changed every day, and dhanyamla or tela should be changed in every 3 days. In first 3 days, half of the oil, and then next 3 days, further half of the oil is used. And later on 7th day, both the oils are used together. For Paschat Karma, we use after the patient is wiped out and slight massage is done. Rasnadi Churna is applied and patient is asked to follow the Patya Apatya and Parihara has to be done. Dhara dosha, if dhara is done from too height, fast or slow, then it may produce murcha, shula, chandi or raktapitta or jara. For treating dhara doshas, gandusha, nasya or yushapana or basti should be given to the patient. Then Shiropichu. Shiropichu is a procedure in which piece of cloth or gauze is folded and dipped in specific oil and kept in anterior frontale. It is indicated in hair fall, itching, cracking of the skin, burning sensation, netra stamba, shiroroga, then ardita, cerebellar dysfunction or anidra, netra roga. Procedure: the patient is made to sit comfortably in a chair. Tie a band of cloth around the forehead above the ears. Place a ear of piece of cloth having length and breadth of 16 centimeter each over the vertex. Then keep the cloth of same size one over the other to make the height of 2 centimeter. Pour lukewarm water at the center of cloth till cloth get completely soaked. Keep and maintain it for around 30 to 90 minutes. Then remove the cloth and wipe the head. Apply Rasanadi Churnam. Then Shirobasti, the retention of oil over the scalp for prescribed time period is called as Shirobasti. It is indicated in, according to Vagbhat, it is indicated in Prasupta, Ardita, Insomnia, Shiroshula, Timira, then Nasa, Shosha, Purva Karma. The person may be subjected to Snehan and Swedan or else can be directly taken for Shirobasti procedure. The essential equipment must be collected. Pradhan Karma, the cloth strip smeared with Masha Kalka and then been tied on the head above ears. Then the leather straps applied with Masha Kalka is been tied over the cloth and then it is been again tied fasted with Masha Kalka to fix leather strap properly from inner side. Then slowly the lukewarm oil is been poured over the scalp till the height of 2 angul from scalp. Care must be taken that the oil must not be too hot. The temperature must be constant throughout the procedure and it should be retained till it attains Samyak Lakshan. For example, NASA नासोत्क्लेश, वक्तस्राव or karnastrava. The duration of Shirobasti is according to doshas. For Vata dosha, it is 100 matrakal, 10,000 matrakal. For Pitta, it is 8,000 matrakal. For Kafash, it is 6,000 matrakal. And in Swastha Rogi, it is 1,000 matrakal. According to Sharandar, for Vataj and Pitta, it is 1 yama. And Kafash, it is half yama. In Paschat Karma, after removing the Basti Yantra, Abhyanga is done overhead and Skandha, Parishek and Rasnadi Churna is applied over the scalp. Thank you.
Thank you, doctor. So next I invite Dr. Abhilasha Singh to continue her presentation.
Hello,
Hello, Dr.
Yes,
Abhilasha.
doctor, you are audible.
am I audible, ma'am, now?
Yes, doctor. Audible, doctor.
Yes, doctor.
Sorry for the interruption. I was unaware of it. I'll just reshare. Shall I start from the beginning, ma'am?
No, you
doctor,
can
just
continue the rest.
continue, doctor. Just continue your presentation. Okay.
From I don't know if, from where were you not able to hear from the drug where I was explaining the drug, I think.
Yes, doctor. Please continue from that part.
Okay, so here we have managed the case with the Jatifal Churna Lep, and as I told that the Jatifal Lep, the reference of it is in Bhav Prakash and Chakradat, both the texts. And as you can see that Jati Falasya Lepastu Hared Vyang and Nilika. So Jati Fal Jati Fal Lep is used in the management of Vyang and Nilika as well. This is the reference of Bhav Prakash, and again in Chakradatta is it is mentioned that Jati Fal Kalk Lepo Nilika Vyang Adi Nashna. So in Chakradatta also in Shudru Rogu Prakaran it is mentioned that Jati Fal Kalk Lep is used in the management of Nilika and Vyang. So the references are taken from these texts. And then we had asked the patient to take 3 to 10 gram of churna daily and apply it locally with madhu for about 20 to 30 minutes every day for a period of 14 days. And on 7 days, seventh day, there was a follow-up each. So as you can see that the Mukh Pradeshi Krishna Vaivarnita was the number of lesions were 2, including that of face and nose. So as you can see that the Vaivarnita had decreased from +3 before the treatment to +1 after the treatment, along with Daha and Kandu, which were significantly reduced to +1. And on Varnya scale, it is the color of the pigmentation was reduced from 16 to 7 significantly in this period of 14 days. And as you can see that the number of lesions were 2, and the size of both the lesions were 5 to 6 centimeter and 3 to 4 centimeter respectively. And the lesions, the size of the lesions had also reduced to about 3 to 4 centimeter and 1 to 2 centimeter significantly. The pictures are there too. You can see that the color of the Vaivarnita has reduced. So here we conclude that this Jati Phala Churna, the Ekal Dravya, can be used as a pralep for the treatment of Vyanga. And as you can see that Jati Phala, it is the exact drug is the with the Latin name Myristica fragrans with ras katu tiktan kashay. The veer is ushna and vipak katu. Gun is laghu snigdhan tikshna, and it is kaf vata shamak. So this was my poster presentation for the single drug management of young melasma by Jati Paljun. Thank you.
Thank you, Dr. Abhilasha Singh.
So next, I would like to invite Dr. Kundan Bharat Ladhe for the presentation.
Hello.
Hello, doctor.
Yes.
Hello.
please
Good
audible.
evening, all. Can I share my screen now?
Sure, doctor. Please share, doctor.
Okay.
Your presentation topic is Nadi Pariksha, right?
Yes.
Okay, doctor. Please share the screen, doctor.
Is my screen is visible now?
No, doctor.
Hello.
Not visible.
Hello.
Hello, your screen is visible, doctor. Please start the session.
Okay. Good evening, all. My name is Dr. Kundan Bharat Ladhe. I'm from PDACSC College, Nigri, Pune, and my topic is the Nadi Pariksha. So in Ayurveda, there is a description of a Nadi Pariksha. For examining the pulse, the arterial pulse can be examined at various sites around the body, like systemic examination normally involves palpating radial, brachial, carotid, femoral, and other distal pulses. Then the assessment of the pulse can be prepared by palpating the arterial wall with the tip of index and middle fingers. Do not press too hard for fear of obliterating the pulse. Establish whether the wall feels soft and palpable or hard and sclerotic. Identify the qualities and characteristics of the pulse by asking what is the pulse rate, what is the pulse rhythm, and what is the character of the pulse. So the pulse rate in the newborn is 100 to 150. In infants of 3 to 6 months of age, it is about 90 to 120. In infants of 6 to 12 months, it is 80 to 120. And in children, it is about 70 to 130. And children's over age of 10 years, and in adults, it is about 60 to 100. And in well-trained adults, it is about 40 to 60. In Ayurveda literature, there are various synonyms are given for the pulse, like Snayu, Nadi, Hansi, Dhamani, Dharani, Dhara, Tantuki, and Jivanyan. The history of Nadi Pariksha is Ayurvedic medicine has been using the pulse as the form of diagnosis since it was created about 2500 years ago. In the 17th century, Yoga Ratnakar Samhita mentions the Nadi Pariksha technique. Eightfold or Ashtavid Pariksha. In Rog Nidan, the Ashtavid Pariksha is given to identify or the 8 places should be examined. There are Nadi, Mutra, Mala, Jiva, Shabda, Sparsha, Druk, and Akruti. Shabda means the various body sounds such as crackling in case of arthritis, voice hoarseness, etc. Sparsha, examination of by touch to know body temperature, local raise of temperature, etc. Druk means external appearance of the person, examination by eyes. And Akruti means the shape and build of the person. Why Nadi Parikshan is needed? The root cause for all diseases is imbalance of three dosh, that is Vata, Pitta, and Kapha. Doctors should examine the pulse in the initial consultation to know about the extent of dosh imbalance. Like the strings of musical instruments generates all ragas or musical notes. Similarly, the pulse of the hand highlights nature of dosh variations. Then the site of Nadi Pariksha means pulse diagnosis. For the purpose of knowing the disease, the doctor with his right hand should examine the pulse of the right hand of the patient at the base of thumb, that is, over the flexure aspect of distal end of the radius bone. In a comfortably sitting patient before him, the doctor should feel pulse with his fingertips. The hand of the examined pulse. In female, probably the left hand gives accurate pulse reading, and in men, the right hand. Hence, pulse of the left hand should be examined for women and right hand for men. Method of starting pulse reading. The arm of the patient should be extended. Hand of the patient should be slightly bent at the elbow joint. The fingers should remain straight. The patient should not feel any pain or discomfort. The pulse examination should be done at the root of the fingers in the wrist part in the first 3 hours prahar of the morning. The pulse should be examined 3 times by feeling the pulse and giving gap in between them. The doctor should use his 3 fingers to know about the status of Vata, Pitta, and Kapha respectively. Then the gatis of pulse means gatis of nadis. There are 3 gatis, that is Manda Gati, Madhya Gati, and Tikshna Gati. Manda Gati means slow movement of the pulse. Madhya Gati means moderate movement of the pulse, and Tikshna Gati means sharp and swift movement of the pulse. There are 3 doshas pulses are given in a Ayurveda. In Vata variation, the pulse moves like a movement of snake, that is low volume or fast. In Kapha imbalance, like gait of swan, that is high in a volume and low in rate. In a Pitta imbalance, frog-like pulse, that is rate and volume both are high. And in case of Sannipat, imbalance of all the doshas together, then like a woodpecker, means cast kutta, the pulse will fade swiftly, sometimes with frequent gaps, variable volume, and a rate or irregular. Here 3 doshas are given, and according to the doshas, the Nadi Gati is given. In Vata, the Nadi Gati is like earthworm or snake. In Pitta, the Gati of the Nadi is like frog or crow. And in Kapha, the Gati of the Nadi is pigeon or like a pigeon or swan. Here the graph of the Kapha's Nadi, Pitta's Nadi, and Vata's Nadi is given. Then in Sannipata's Nadi, mixed pulse are given. Like in Sannipata's Nadi, we can there is a possibility of premature ventricular contractions, that is PVCs. Then the predictive Nadi diagnosis. 3 fingers are used for diagnosis of the Nadi: index finger, middle finger, and ring fingers. In index finger, Vata movement resembles snake. In middle finger, Pitta movement resembles frog, and in ring finger, movements resembles swan. Inappropriate time for pulse examination. When the patient has just taken bath, taken food, have just undergone sneon, means oil massage or fat intake, having thirst and hunger, or is asleep. Patient having fear, anger, etc. are also not fit for the pulse examination. Pulse reading indicating incurable diseases means asadhya nadi. The pulse which beats for 30 minutes speedily and then subsides abruptly, and then pulse which runs with a lot of interruptions. The pulse which is weak, mild, feeble, stops in between, very minute, which is sometimes feebly in shoulder and sometimes at wrist. Such nadi indicates an incurable disease. When the nadi is like damru, musical instrument of Lord Shiva, sometimes observable, sometimes not, it indicates incurable disease. The pulse which is too high, too frequent, fast, suggests death in future. The nadi which is stable but suddenly sparks up like lightning suggests incurable disease. The feeble and cold nadi suggests that is certain within a day or 2 days. Sudden change in dosha's status and nadi. If the feature of the nadi changes from vat to pitta or pitta to kapha, such a nadi reading indicates incurable disease. The nadi which is felt only near to the distal one third of the wrist often feels cold, associated with sweating, suggests death within a week. Incurability of disease status and nadi. Person with cold body who suffers from dyspnea, breathes forcefully with mouth and sweeps or nadi dies within 15 days. In the pulse place, if the distal part does not read any pulse, middle part is cold and proximal part is feeble, the person dies within 3 days. Gambhira nadi or high volume pulse feels hot indicates fever. Due to calm means sexual desire or anger, the pulse rate increases. Due to worries and fear, low digestion strength and depleted body tissues, Kshina dhatu, it decreases. When blood means Rakta dhatu is dominant and when arm is there, altered digestion and metabolism, then it will be sluggish and high volume. When the person is hungry, nadi will be feeble and fast. Science of pulse examination. Think of the pulse like a cardiograph, a computer readout graphically recording the physical or functional aspect of the heart. Like a graph being sketched across the screen of the computer, pulse has its own rate, crest, wave, amplitude, and cessation. These individuals' characteristics define the overall moment, quality, and rhythm of the pulse. In these broader categories, in doshas of Vata, Pitta, and Kapha can be distinguished based on the small movements sketched graphically by a cardiograph. In pulse diagnosis, our fingers become the receptors that transfer the informations of the heartbeat graphically into a more concrete image. In three doshas, their characteristics are in Vata, the nadi is fast, feeble, cold, light, thin, disappears on pressures. In Pitta, prominent, strong, high amplitude, hot, forceful, lips, palpating finger. In Kapha, it is deep, slow, broad, wavy, thick, cool, or warm, regular. The location is for Vat is index finger, for Pitta is middle finger, and for Kapha is ring finger. Gati. Uh, Gati for the Vat is Sarpa, for Pitta is Manduk, and Kapha for is Hans Gati. Veg means rate. Rate of the nadi is 80 to 95 for Vat, 70 to 80 for Pitta, and 50 to 60 for it is for Kapha. Tal means rhythm. It is irregular in Vat. In Pitta it is regular, and in Kapha it also regular. Pul means force. It is a low in a Vat, high in a Pitta, and a moderate in Kapha. Akruti means tension and volume of the in Vat it is low. In a Pitta it is high, and in Kapha it is moderate. Tapman means temperature. In Vat it is cold. In Pitta it is hot, and in Kapha it is warm to cold. Katina means vessel walls. It is in Vat it is rough and hard. In Pitta it is elastic and flexible, and in Kapha it is soft technique. Conclusion: pulse examination is one of the component of a dosh evaluation in Ayurveda under Ashtavid Pariksha. It evaluates the normal and abnormal state of doshas. While there is no reference to diagnosis of disease in Ayurveda purely on basis of Nadi Pariksha, but in later books like Kanat Samhita, Ravan Samhita have concluded that specific diseases can be diagnosed purely by pulse examination. Thank you.
Thank you, doctor. So next, I invite Dr. Arati Devkishan Gekar for the presentation. I invite Dr. Arati.
Hello, ma'am. Am I audible?
Yes, Doctor.
Yes,
Audible.
doctor.
Okay. I'll share my PPT. Is my PPT visible to everyone?
Yes, doctor, your screen is visible.
Okay.
Please chat, doctor.
Good
Please chat
evening,
the session.
everyone. Myself, Dr. Aarti. Yes. Good evening, everyone. Myself, Dr. Aarti Gaikar from DY Patil Ayurveda College, Pune, Maharashtra. And my topic for paper presentation is Efficacy of Guduchi Ghanavati in Vatrakta Gout. Introduction. The healthiness of every person totally depends on their dietary habits and lifestyle they follow. Vatrakta is one of such lifestyle disorder. It is caused by vitiation of both Vata as well as Rakta. In Vatrakta, pain is a predominant symptom which hampers the day-to-day activities of the patient. Other symptoms which are seen as swelling, stiffness of joint, burning sensation, etc. Vat Rakta can be correlated with gout. Gout is an inflammatory response to monosodium urate, monohydrate crystals deposition in joint. In India, the prevalence of gout is 2 to 6 per 1,000. So this is a case study depicting the management given in a case of Vatrakta gout. Objective of the study is to evaluate the efficacy of Guduchi Ghanavati in the management of Vatrakta. Case study, a 62-year-old married female patient visited to OPD with the complaints of joint pain and swelling. Joint pain and swelling was present on bilateral ankle joint and big toe, difficulty in movement, stiffness, and tenderness. All these symptoms were present from 3 to 4 months. There was no history of any major illness, no surgical history, no drug allergy known, or no history of any trauma to the patient. Ashtavit Pariksha, Nadi 80 per minute, Mal was satisfactory, Mutra Samyak, Jivha Sam, Akruti was Madhyam, Shabda was Spashta, Sparsha, Prakrut, Druka, Prakrut. Systemic examination, respiratory system, air entry was bilaterally equal, CVS S1 S2 normal, patient was conscious and well oriented. Samprapti Ghatak, in Vatrakta, the doshas involved are Vat and Kapha, and Dushas are Rakta, Tvak, and Mouse. There is in Vatrakta, there is Vat Prakop and Rakta Dishti due to n number of factors like Rukshahar Vihar, dietary habit like Dahi Sevan, seafood, etc., sedentary lifestyle, or triggering factor like trauma, etc. Adhishtan is Sandhi. Strotas, Raktavah Strotas, Strotas Dushti Prakar is Sanga and Vimarga Gaman. Utpatti sthan is Pakvashay, Vyadhi Swabhav is Chirkari, and Sadhya Sadhyatva, it is Krushya Sadhya. In Vatrakta, after the Nidan Sevan, because of Vat Sukshma and Saraguna and Rakta Drava and Sarguna, it travels throughout the body by blood vessels, Sira, which leads to the Strotorod being obstructed by in joint due to zigzag way, and there is Tan Sanshra in Sandhi and leading to the development of symptoms like Sandhi Shul, Sandhi Shot, Stamba, etc. So for this patient, Guduchi Ghanavati 250 mg 2 BD was given for 14 days with follow-up on 7th day. Properties of Guduchi, Latin name Tinospora cordifolia, family Menispermiaceae, Gun, Guru and Snigdha, Rasa, Tikta and Kashay, Vipak Madhur, Virya Ushna, Gana Vayasthapan, Daha Prashaman, Trushna Nigrahan, Truptigna, and Doshagnata, Tridosha Shaman. If you see the properties of Guduchi, collectively, Vatak Shaman happened due to the gunas like Ushna and Snigdha. Pitta Kshaman because of Tikta Ras Madhur Vipak, and Kapha Kshaman because of Kashay Rasa Extrata. So collectively it helped in reducing the symptoms of the patient Sandhi Shul, Sandhi Shot, etc. So on zeroth day, Sandhi Shul on the scale by measuring with the help of VAS scale was on 3, which on 14th day was 1, Sandhi Shot 2, and on 14th day it was 1. Stiffness on the scale on 0th day was 1 and 14th day 0. Sparsha Sahatva, tenderness, which was 1, and on 14th day it was 0. Serum uric acid was done before giving treatment to the patient, which was 7.7 mg per dl, and on 14th day it was 7.1 mg per dl. These are the reports of the patient. Result, in a course of these 14 days, patient showed significant improvement in various variables like reduction in pain, swelling, and stiffness. Conclusion, the collected data suggests a noteworthy improvement was seen by a single drug administration in management of Vata Rakta. However, a detailed study is needed in this regard. Thank you.
Thank you, doctor. So next I welcome Dr. Harjit Kaur for the poster presentation.
Good evening, everyone. Am I audible?
Yes, Doctor, audible.
Okay. I'm sharing my poster right now.
Okay.
Is it visible?
Yes, Doctor, your screen is visible. Please start the session, Doctor.
Okay. I'm Dr. Harjit Kaur, PG second year student from DY Patil College of Ayurveda. My topic of poster presentation is Garbha Sanskara. Garbha Sanskar is made up of two words, Garbha and Sanskar. Garbha means union of Shukra, Artava and Atma inside the Kukshi. Samskara hi gun antardham, which means it brings the changes in the properties and increases the potential or imparting good values. Now, what exactly is the purpose of Garbha Sanskar? It leads to the formation of high quality dhatus and increases quality and quantity of oja, which is essential for immunity. It also imparts good values, create healthy progeny, intelligent child, and maintain proper health of Garbhini. Guides couple to enable them to have healthy baby. How now it can be achieved? So there are basically four main things. One is food, second, yogasana, third, various Ayurvedic procedures, and fourth, listening to the good music. Now coming to the food, we all have already heard about Garbhini Paricharya. It clearly mentions Bringan and Valya Dravyas should be used by the Garbhini. Now coming to Yogasana, Yogasana calms mind and cure pregnancy edema. It reduces stress, potential natal depression, and increases the production of the milk. It improves blood circulation and oxygenation that eases stress. Now, the asana that can be done are Marijarasana, cat pose. It makes the delivery easy and relieves back pain. Konasana or the angle pose. It is mainly done in the first trimester and as it strengthens the uterus. Veerbhadra Asana, the warrior pose, it improves the blood circulation. Trikon Asana, the triangle pose, it improves digestive function of the Garbhini. Bhadrakon Asana, the butterfly pose, it improves the flexibility of the groin. Mantra Chikitsa causes the left and the right hemisphere of the brain to synchronize, which in further increases the oxygenation, decreases the heart rate and BP, and maintains the states of resonance. Now coming to the music. Good music shapes baby's personality. It calms, uplifts mood, reduces stress, fetus feel in the womb. According to the Panchmahabhut Siddhanta, Shabd is attribute of Akash Mahabhuta, which is used in the form of music given through the Srota Indriya, which is further interacts with Mana, gives message to the Atma, Indriya, and Mana, which in further influences the fetus. Now coming to the various procedures, these Shodhana or the Shaman procedures done to the Garbhini improves Jatragini, which in further helps in timely ovulation, increases the quality of the bija, balances the Agni dosha dhatus, and provides uterine strength. Now, what exactly the impact of the Garbha Sanskara? Everything that the mother feels or communicates or is communicated to the baby through four neurotransmitters, four neuropeptide hormones to the fetus. Neuropeptides are usually two types, happy and sad. Happy reaches the fetal brain and creates joy. And whenever the mother feels stressed, adrenaline or the cortisol are flooded in the baby's blood secretion, leading to the sad neuropeptide secretion. So, in short, Garbha Sanskar helps in well-being of the baby in the womb to make it healthy, virtuous, and knowledgeable. Thank you. Hello.
Thank you, Dr. Harjit. Thank
Thank
you for this
actually,
poster presentation.
I'm from Prasuti Tantra and Stri Roga department.
Okay, doctor.
Okay.
We will correct it.
Okay, you are already in the Prasuti department, doctor.
Okay, sir.
Okay, doctor.
Okay. Thank you.
Thank you, doctor.
Okay, so next I invite Dr. V. Krishnaveni for the presentation.
I would like to invite Dr. Krishnaveni for the presentation. Dr. Krishnaveni, are you there? Hello, Dr. Krishnaveni, are you there? Okay. Dr. Krishnaveni, please unmute, doctor. Hello, Dr. Krishnaveni, please unmute, doctor. Hello, Dr. Krishnaveni, we can't hear your voice, doctor. Please unmute, doctor. Hello, Dr. Krishnaveni, can you hear me? Hello, Dr. Krishnaveni, can you hear me?
Doctor, please unmute yourself and respond.
Hello, Dr. Krishnaveni, can you hear me, doctor?
Dr. Krishnaveni, please unmute and respond.
Okay, doctor. We will call you next, Dr. Krishnaveni. Next, I invite Dr. Komal Patru Khandalkar for the paper presentation. Dr. Komal, are you there?
Yes, sir. Yes, sir. I am going to share my slide. Wait, sir.
Okay.
Wait for a minute.
Okay, doctor. Please share.
Sir, can you please give me 5 minutes because it is not possible to share now. There is some network issue.
Doctor, you have any problem with screen sharing? I will share for you,
Yes,
doctor.
sir. Screen sharing.
Okay, doctor, I will share for you.
Okay, sir.
Doctor, please start the session, doctor.
Okay, sir. Good evening, everyone. Myself, Komal Khandalkar. My topic is role of Asana Pranayam and in management of tinnitus. I am from SVNST Ayurvedic College, Rahuri. Introduction. Tinnitus is the sensation of sound. Sir, I am audible?
Yes, doctor, audible. Please continue, doctor.
Okay, sir. Tinnitus. Introduction. Tinnitus is the sensation of sound in the absence of any external source. In today's stressful lifestyle, it is very common and annoying symptom. It may occur without deafness in physical condition like anemia, hypertension, impacted wisdom tooth, and mental condition like stress and anxiety. Here the answer of all physical and mental condition which cause tinnitus, that is yoga, asana, pranayam. Sir, next slide. Type of tinnitus. There are two types of tinnitus, subjective and objective tinnitus. Subjective tinnitus is like a ringing and whistling sound, and objective tinnitus, it is heard by patient as well as examiner. Next slide, sir. Characteristics of tinnitus. There are three types of characteristics: intermittent, continuous, and fluctuant. Intermittent, it is continuous. Continuous, it present all the time, and fluctuant, it may vary. So next slide. Causes of tinnitus. There are two causes: tinnitus with deafness and tinnitus without deafness. Tinnitus with deafness is caused due to certain diseases like a wax, fungus, polyp, rupture of eardrum. Tinnitus without deafness, it is caused by certain diseases like anemia, hypertension, hypotension, functional emotional factors like depression and anxiety. Investigation, we can do investigation like blood sugar, serum cholesterol, and neurological examination. Treatment, counseling, and reassurance. Mild sedative is given. Yoga is a success and alternative form of therapy in various diseases. According to medical scientists, yoga therapy is successful because of balance created by nervous and endocrine system. Yoga calms the body and soothes the nervous system. Sir, yoga asana for tinnitus is Simhar Garjanasana, the lion roaring pose. In here, we have to sit in Vajrasana, look up and fixed at one point. Bring your chest upward. Bring the palm of your hand to touch the floor and place them in middle of your knee. Spread your knees wider than hip width. Stretch your back by strengthening, and like a lion, we have to produce sound. Next slide. Benefits of pranayam benefits pranayam for tinnitus, that is Shitali pranayam. Shitali. Next, sir. Brahmari pranayam and Ujjayi pranayam. Third one is Ujjayi pranayam. So third, in Ujjayi pranayam, we have to exhale through nose and inhale. Beneficial of inhale through both nostrils. Beneficial of Dhyan. In meditation, mind and matter are fused. This fusion burns all the distracting thoughts. The sadhaka become dynamic, creative, superiorly attentive. In meditation, the mind traces its origin and comes to rest there, as same as child rests on the lap of the mother. The yogi, having found his own resting place and spiritual, sees the underlying reality around him. So we can say that yoga may be much beneficial in tinnitus. Dhyan control and slow down certain automatic physical function which normally stimulate the brain, such as intestinal contraction, breathing, and heartbeat. So one can get control of ringing in the ear. Conclusion: after the conceptual study on yoga and tinnitus, we can conclude that yoga can give better result and according to Ayurveda and modern therapy. Thank you, everyone.
Thank you, doctor. So now I would like to invite Dr. Junaid Aslam Kotali for the presentation.
Hello, ma'am. Can you share my presentation, please?
Wait a moment, doctor.
Good evening, doctor. Please start the session, doctor.
Hello, am I audible?
Yes, doctor, you are audible. Please start the session, doctor.
Okay. Hello, everyone. My name is Dr. Junaid Aslam Kotali from Yeshwanth Ayurveda College, Kodoli, Kolhapur. My topic for presentation is clinical case study of otomycosis of Ayurvedic approach. Next slide. Next slide. Next slide, please. Karnastrava. Due to agantuj or doshaj nidana, there will be the formation of pus due to the vitiation of the kapha dosha. Due to pitta doshatmata, the pus will be the liquefied, and by the chalaguna of vata dosha, it will flow out. Karnastrava is one of the clinical feature of many diseases such as otitis externa, otomycosis, chronic suppurative otitis media, furunculosis in the external ear, diffuse otitis externa, etc. The treatment principle of the Karnastrava is same like Krimi Karna and Puti Karna, which mainly includes Karna Prakshalana, Karna Dhupana, Karna Pramarjana, Karna Pichu, Shiro Virechana, Snehana, Svedana, Gandusha, etc. Next slide, please. Otomycosis. Based on the Lakshana in the present case, Karnastrava is correlated to the otomycosis, which is having the similar symptoms. Otomycosis is fungal infection of the ear canal with the symptoms of pain, itching, discharge, and ear block. Any element connected with the ear should be treated by as early as possible due to the importance of organ of hearing and also due to its delicacy and inaccessibility. Next slide. Otomycosis is the fungal infection of the ear canal that often occurs due to the Aspergillus niger, Aspergillus fumigatus, or Candida albicans. The clinical features of otomycosis includes intense itching, discomfort, or pain in the ear, watery discharge with a musty odor, and ear blockage. The fungal mass may appear white, brown, or black. On the examination with the otoscope, Aspergillus niger appears as black-headed filamentous growth, Aspergillus fumigatus pale blue or green, and Candida as white or creamy deposits. Treatment consists the ear toileting, which remove all the discharge and epithelial debris which are conductive to the growth of the fungus. It can be done by syringing, suction, or mopping. Specific antifungal agents can be applied. Antifungal elements should be continued for a week even after cure of the disease. Ear must keep dry. Next slide. The case scenario: a 24-year male patient approached to the Shalakyatantra OPD presented with the complaints of pain and itching sensation in the right ear for 3 days. When he woke up from the sleep, he noticed slight pain in the right ear, and as the day advanced, it started aggravating. He neglected as that was not disturbing his routine activities. Later since morning, the pain got aggravated, and he approached to us, and he had the same episode of ear discharge before 2 months. On the examination, external auditory canal of the right ear was filled with the purulent discharge, and after pramarjan of fungus modules were found, which was added to the tympanic membrane. The left ear canal was clear with visible normal tympanic membrane. Next slide. Treatment given: the purulent discharge was removed by wiping karna pramarjana, followed by oral syringing, means karna prakshalana using Trifala Kashaya. Karna prakshalan was continued for 4 more days with Gomutra Arka Pichu to control the discharge and to cleanse the entire canal. Karna Dhupan with Haridradi Vati is done for next 3 days. Internally, Trifala Guggulu was given 2 BD for 5 days. Tablet Nircosil was given 1 BD for 10 days. Tablet Septic was given 1 BD for 5 days. Specific advice for patient: patient was advised not to take head bath, not to consume refrigerated food items, not to be exposed to cold wine. Ear canal should be kept dry. Next slide. Karna prakshalan. The patient was made to sit on the comfortable chair. Lukewarm Trifala Kashaya is taken in the 10 ml syringe, and with the help of the syringe, the Karna prakshalan was done. Next slide. Karna Pichu. Karna Pramajan was done to remove the moisture from the ear canal. Gomutra Arka was taken in the cotton wig and placed over the affected side for 3 hours. After 3 hours, wig should be removed and fresh cotton plug was kept. Next slide. Karna Dhupana. Haridradi Dhupana. The fumes coming out from the burn Haridradi Varti were directed to both the ear and cotton plug was kept after Dhupana. Next slide. Observations: mucopurulent discharge in the ear was done due to the fungus infection. Ear pain was reduced after 3 days of Karna prakshalana. Ear itching reduced by the 5th day. Discharge was reduced markedly by the 6th day of the Karna Prakshalan, Pramajan and Pichudhavana. For the next 3 days, Karna Dhupana was done, after which there was a complete reduction in all the symptoms. Follow-up was done on the 15th day and 30th day, and there is complete absence of all the symptoms. Next slide. The next slide. Next slide, please. In the present case, carefully the fungal mass is removed with the help of the Sthanik Chikitsa Karma, and the canal was cleared. Unskilled attempt at removal of the adhered fungal mass by lacerate the meatal lining, damage the tympanic membrane on the ear ossicles. Precautionary measures have to be taken while attending such cases. The main aim is treating this condition is to control the vitiated kapha and vata dosha. Selection of appropriate sthanika chikitsokarma along with the internal medicines has helped to treat a case of Karnastrava successfully through the Ayurvedic management. Next. Thank you.
Thank you,
Thank you,
doctor.
doctor.
So next I invite Dr. P. Geeta Maunika. I invite
Hello.
Dr. P. Geeta.
Yes, ma'am. Ma'am, am I audible?
Yes, doctor.
Thank you, ma'am.
Your screen is also visible, doctor. Please start the session.
Yes, sir. Good evening, everyone. Today, my topic of presentation was conceptual review of Ashrudhara. Women undergo several changes in life from adolescence to menopause. Among this, menarche marks the beginning of an important stage in women's reproductive life. It denotes beginning of menstruation. Once menstruation starts, it continues cyclically at an interval of 21 to 35 days, a mean of 28 days. Ultimately, it ceases between the age of 45 to 50 years. Duration of menstruation is about 4 to 5 days, and amount of blood loss is estimated to be 20 to 80 ml with an average of 35 ml. This is normal. But nowadays, if a woman get disturbed due to altered lifestyle, food habits, and stress, leading to various menstrual abnormalities. It is also having great impact on the reproductive health of a woman. Artava is a functional unit of Artavaha Shrotas. It is a Upadhatu of Rasadhatu, where Dhatu helps the nourishing body, whereas Upadhatu supports the body in various ways. Artava is Agnaya in nature and has characteristics of Rakta, and it is responsible for the formation of Garbha. It has the Lakshanas of Rakta, hence Acharya Dalhana says that Artava has Karma Jivanam, which is similar to Rakta and has predominance of the Tejo Mahabhuta. Normal function of Ardhava can maintain the balance in female reproductive system. The same balance can be disturbed when there is a dosha prakopa, and it can manifest conditions like Ashtarthava Dushti, Arthavakshaya, and Ashrudhara. Here my topic is Ashrudhara. Ashrudhara is a condition characterized by excessive, prolonged menstrual or intermenstrual bleeding. Acharya Charaka also describes Ashrudhara as a separate disease along with its management in Yonivapa Chikitsa Adhyaya. Charaka also describes it as one of Rakta Pradoshaja Vikara and also in Pittavrita Apana Vayu Vikaras. Characteristics of Ashrudhara is having close resemblance with abnormal uterine bleeding, that is AUB. It is affecting about 10 to 30% of a woman in reproductive age over 35 years old. And Nidana, due to excessive consumption of the salt, sour, heavy and hot substance which have produced burning sensation, anxious diet, eating meat of domestic and aquatic animals and fatty animals, vishada, payasa, curd, sukta, mastu, all these consuming leads to the Ashrudhara. This is a Nidana of Ashrudhara. And here Samprapti is, because of Nidana, there is a vitiation of Vata. Because of that, Rakta Vriddhi in Garbhashaya Gata Sira will be there. So Rajovaha Srota Vikriti will be happen, that leads to the Rajo Vriddhi and leads to the Ashrudhara. And Samprapti Ghataka are dosha, that is Pitta Pradhana Tridosha. Jushas are Rasa, Rakta, Arthava. Agni is Jatara, Agni Mandya. Srotas, Rasavaha, Raktavaha and Arthavaha Srotas will be affected.
It is Ati Pravritti, Srota Drishti will be there. And Adhisthana is Garbhashaya and Rogamarga and Abhyantara Rogamarga. There is a classification. It is 4 types according to all acharyas. Vataja, Pittaja, Kafaja and Sannipataja. And here Vataja Ashtadhara, it is having pain, frothy bleeding like flower of Palasha. Due to presence of severe pain and bleeding due to hyperemia of pelvic organ, it can be correlated to pelvic congestion syndrome or pelvic sympathetic syndrome. Pittaja Ashtadhara, the bleeding will be blackish red form and it will be associated with fever. Because of fever and other symptoms, Pittaja Ashtadhara can be closely correlated to menometrorrhagia. It is due to the pelvic congestion caused by infection or any inflammation. And Kafaja Ashtadhara, the bleeding will be pallor, slimy, thick and stable. This can be correlated to early stage of tubercular endometritis or chronic endometritis due to other causes. And Sannipataja Ashtadhara, syncope and fever will be there and mixed symptoms of all three doshas will be present and it is very difficult to treat. Because of presence of multicolored foul-smelling discharge and incurability of Sannipataja Ashtadhara, it can be correlated to uterine or cervical malignancy. And Sadhya Sadhyata prognosis, Sannipataja Ashtadhara is incurable according to all acharyas. Madhav Nidhana, Bhava Prakasha and Yogaratnakara, they mention like features which are considered to be incurable are continuous bleeding per vaginum associated with thirst, burning and fever, loss of blood and debility. If these symptoms are present and that should be curable. And complications, Charakacharya mentioned edema as a complication. Due to excessive flow, there is a weakness, dizziness, unconsciousness, blurring of vision, thirst, burning sensation, and drowsiness and diseases of Vata origin will be there as Upadravas. Coming to Chikitsa, for this condition, first line of treatment should be Stambhana, that is to arrest the bleeding. Acharya Charaka said that treatment prescribed for Raktatisara, Raktapitta, Raktarshas and Garbhasrava can also be adopted in this condition. The main reason behind this principle is Pitta Shamana and Stambhana. Doshapachana has specific role in its management. Charkacharya explains the role of Tikta Rasa in Sangrahana and Doshapachana while treating Raktapitta. Pitta Rasa and Kashaya Rasa is used for Pachana, particularly Dosha Pachana of Pitta and Agnidipana. Hence, Pachana followed by Stambhana have great effect in treating Rakta-Pradara. And single drugs useful in Rakta-Pradara are Draksha, Padma Kesara, that is stem of lotus, Chandana, Shariva, Udicya, Gokshura, Pala, Durva, Lajjalu, and Daruharidra, Mocharasa, Lodra, Kutaja, Dataki, Nagakeshara, Shetavari. These drugs not only having the property to stop bleeding, but also helpful in balancing the Pitta dosha and detoxifying the Rakta Dhatu. Shodhana with Virechana karma is also beneficial. Once Shodhana is done, there is less chance of recurrence of the disease. As Visheshana of Pitta dosha is there is a there in Rakta Pradara. So Virechana karma was advocated according to the general condition of the patient. Kashyapacharya quoted that purgation cures menstrual bleedings. Drugs for internal use are Rasaushadhis, Pradhara Bolaparpati, Pradharantakaras, Chandrakalaras. These can be internally administered. And Vati, Gokshuradi, Guggulu, Chandraprabha Vati can be given. And Dravyadi Kashaya, Negrodadi Kashaya, Eladi Kvata. All these can be given under the Kvatas. Asava and Aristas like Rodra Asava, Ashoka Arista. Avaleha, Kandakushma and Avaleha, Jiraka, Avaleha, Kutajadi Rasakriya can be given. Milk boiled with decoction of Ashoka bark and that is cool and should be given. Medications such as Shetavari Guda, Baladi Kashaya, Talyadi Kashaya, Oshi Rasava, they strengthen the body immunity and balances Pitta. These are administered throughout the menstrual cycle. Medicines which having specific properties for stopping bleeding such as Bolaparpati, Rakta Pittantaka Loha. This can be used from 20th day of the cycle onwards so as to have controlled bleeding once menstruation sets in. In the case of intermenstrual bleeding or a shortened menstrual cycle, medicines like Shetavari Guda, Kushanaka Churna, Ashoka Arista, these can be administered throughout the cycle. Apart from reducing the menstrual flow, they also contribute to establishing the hormonal balance. Here, Goduma, Sastikashali, Jangala, Mamsarasa, Kushmanda, Patola, Draksha, Dadima, Rita, Madhu, these are all patyas. And apatyas are Katu, Amla, Lavana, Hara, Matsya, Madhya, Vidahi, Masha, those who are having Ushnavirya, Taila, Kulatta, Lashuna, Dadi, all should be avoided. In conclusion, a woman should have nutritious food and a healthy lifestyle to maintain the balance of Rutu Chakra. Any disturbance in this leads to various diseases. Ashrudhara is one among those in the reproductive age of a woman. Prolonged menstrual cycle with heavy bleeding makes women weak and decreases their ability to do their daily activities. So it is necessary to treat this condition immediately to reduce the complications. Nidana Parivajana plays an important role in Ashrudhara. The treatment of Ashrudhara includes the use of Stambhana Dravyas and the formulations which have the property of Kashaya and Tikta Rasa. Raktavardhaka drugs help in improving the health of a woman. Thank you.
Thank you, Dr. Geeta. Thank you for the
So
presentation.
next I invite
Thank you.
Dr. Neha Vishwakarma.
It is an
I
paper
invite
and poster
Dr.
presentation.
Yes, I am just sharing the slide.
Okay, Dr. Neha.
Good day, everyone. I am from Late Kedari Redekar Ayurvedic College, Ganimlas, Kolhapur, PG student in Prasuti Striro. My poster presentation topic is Sutika Paricharya. Hello, am I audible, sir?
Yes, Dr.
Yes,
Audible.
doctor, you're
Hello.
on.
Yes, Sutika Paricharya, a review. Soon after expulsion of baby, followed by expulsion of placenta, woman is termed as Sutika. Duration is 1.5 months, such that 45 days. Anemia, joint pain, backache, body ache, and many other, including some infections, remain the major complaint of postnatal women. So the nowadays anxiety, stress, depression are also making their place in postnatal women, especially in early phase of postnatal care status. So in order to combat or to prevent such psychosomatic problems, a well-guided and logical references based Sutika Paricharya is described. According to Charak, in Charak Sahita Saristan 8, Parisechan, Snehapan, Abhyanga, Udar Pradeshi, Udar Western, Parisechan, Panchakol, Siddha Yavagu. It is described by
Dr. Neha, please unmute, doctor.
Yes, sir. Yes, sir. According to Shushruth, in Shushushari 10, Abhyang with Balatel, Panah, Parisechan with Vatahar, Aushadhi Siddhakvat, Dushta Shonit Shuddhi by Panchakol Churna with Ushna Udak, Vidari Ganadi Ganesh Siddha Yavagu, Shiradi Yavakol, Kulatha Siddh Gajangal Mounsaras plus Shali Dhanya. Sutika should avoid Krodh, Ayas, and Maithuna, according to Shushruth. And according to Vagbhat in Ashtang Hriday Sharir 1, Mardhan of Yoni and Anga with Tel, Sneha Pan, Dushta Shonit Shuddhi, Udar Veshtanam, Abhyanga, Udvartan, Parisek, Avgaha by Madhur, Jivaniya, Bruhaniya, and Vatahar Dravya. According to Kashyap Sahita, Swashan, आश्वासन, संवाहन, उदरमर्दन, उदरवेष्टन, योनिस्निहन, योनिस्वेदन, स्नान, धूपन with kushta, aguru and gugul mixed with grut. Vaginal sedation can be done by allowing Sutika to sit over a small chair covered with a bag of leather filled with hot balatel, tying an amulet of Trivrutta over the head of Sutika. Benefits of Sutika Paricharya. Sutika Paricharya helps her to regain her lost thing that reaches her pre-pregnant state. Sutika Paricharya is always beneficial to regain her strength as she experienced the tiredness and shunyata of Sharir during delivery. Abhyanga increases the blood focal area through vasodilation by these leukocytes and macrophage, which reach the damaged tissue in more quality and enhance the wound healing. By hot water bath, hygiene is maintained. It is necessary during Shuddhika Kal to prevent the infection of trauma of female genital organ and infection to newborn child. So the hot fermentation of urine relieves pain and inflammation of vaginal tear during labor or due to the episiotomy and is helpful for rapid healing. Fumigation with the drugs like Shuddha or Guru mixed with Krut produces the strong antiseptic and disinfectant properties. Decoction of Lagu Panchamul Dravya drugs like anti-inflammatory and antiseptic properties. It helps in tuning of bladder during perpural period and also for diuresis of accumulated fluid in the body during pregnancy. The rice gruel prepared with Vidari Adi Gand as a rasayan and helps to recover from Sutika Kal. The liquid diet like Yavagu is easy for digestion and assimilation, requires thrust, diuretic, helpful in Purpurium, the meat soup of wild animals, beside decoction of Jivaniya, Brahmaniya, and Madhu drugs, is an excellent source of iron, vitamin, essential amino and trace elements. Helps in galactogenesis and enhance the property of stanya. Panchakol churna with gruth or jaggery have antipyretic, appetizer, utrotonic, antibacterial, antifungal, and act as an analgesic effect. The gruth being univahi enhance the properties of panchakol by balancing its ruksha and tikshna guna. This is my poster presentation. I am just sharing the slide for paper presentation.
Okay, doctor.
So there is problem, it is not supporting. So you can share the paper presentation of my slide.
Okay, doctor. I will share for you just a moment, doctor. Please start the session, doctor.
My paper presentation topic is Garbhini Ayu Poshan, such that Ayurvedic diet regime in pregnancy. My guide is Dr. Suhas Thorat sir and my HOD Professor Dr. Prasad Lomte sir. Next slide, please, sir. Introduction. Garbhini is a pregnant woman within whom the girth drills. A pregnant woman undergoes many physical, physiological, and emotional changes for which an ideal dietary protocol is essential. The Ayurvedic diet regime in pregnancy is easy to follow as a routine in modern lifestyle and aims to attain optimum health of the progeny and the mother. Methodology. The Garbhini Ahar mentioned in Bruhatray include Madhu Snigdha Jivaniya Ahar, milk and milk products, meat soup, processed food with appetizing dravya to enhance the Agni, Dhatu Poshan and Garbha Poshan in pregnant women. Yog Ratnakar mentioned the condiments, fruits and legumes, while the Harit includes the sweet recipes. Routinely used herbs are described as rasayan and for prajasthapan to enhance overall fetal growth. The dietary contraindications like dry, stale or unhygienic food, wine, etc. are included in comprehensive while still fulfilling the dietary desire of the pregnant baby. So the valuing her Dauridya Avastha. Next slide, please, sir. Ayurvedic potion throughout the pregnancy by Yogratnakar. Ahar Dravya, Shushka Dhanya, that is Sashtik rice, wheat, red or brown rice, kolam rice. Shami Dhanya includes green gram, chickpeas. Dugdha Varga includes milk, sweetened curds, butter, ghee, milk kheer. And Shaka Varga includes Tandulekam, that is chaurai, shiguru, pumpkin, and jackfruit. Jala Varga includes the lukewarm water, Phal Varga, gooseberry, banana, date, grapes, mahua, and pomegranate. Ahar Upyogi Varga and others, that is honey, jaggery, sugar, sattu, laja, carrot, beetroot, and yasti madhu. Next slide, please, sir. This is which included in the Ayur portion, that is Ayurvedic portion throughout the pregnancy. Next slide, sir. It is monthly advice by different Sahitas, that is Charak, Shushrut, Ashtang Sangrah, and Harit Sahita. First, by Charak Sahita in first month, it is advised to use non-medicated milk. In second month, milk medicated with Madhur Ras Dravya. In third month, milk with honey and growth. Fourth month, milk with butter. And fifth month, growth prepared with butter extracted from milk. Sixth month, the Charak advises growth prepared from milk medicated with Madhur Dravya. In 7 months, same as that of 6th month, that is growth prepared from milk medicated with Madhur Dravya. 8th month, Shira, Yavagu mixed with growth, and 9 month is Anuvasan. The same as that of Charak, Ashtang Sangrah describes the same 9-month protocol, but in first month changes is medicated milk, and in third month milk with honey and growth. In fourth, milk with 1 tool of butter. Rest of all, fifth, second, sixth, seventh, and ninth is same as that of Charak. 8th month it includes the Shiguru Shir Yavagu mixed with growth is that of the Ashtang Sangrah. In Shushrut, which is mainly used by all in Ayurvedic colleges, most for the pregnancy, Shushrut Sahita includes first 3 months is common, that is Madhu, Sheet and liquid diet, that is Drava diet. Fourth month is cooked the Shashti rice with curd, lagu, supachya food mixed with milk and butter and jungle mounds. Fifth month, cooked Shashtik rice with milk, jungle mounds along with food mixed with milk and growth. 6th month, Shushut advises grit or rice gruel medicated with Gokshur. Gokshur is mainly advised by Shushut in 6th month. In 7th month, growth medicated with Prothaparani are the group of drugs which is specially mentioned in the 7th month. In 8th month, Asthapan Upak Basti followed by Anuvasan Basti. Sthapan Basti which is followed by Anuvasan Basti in 8th month. In 9th month, it is advised repairs, rules and jungle mounds runs up to the period of delivery. And Harit Sahita. In Harit Sahita, in first month, it is advised Madhu Yashti, Madhu Pushpa with butter, honey and sweetened milk. In second month, sweetened milk treated with Kakoli. Third month, Krushara, that is Khichdi. In fourth month, medicated cooked rice. In fifth month, described by Harit is Payasa. Sixth month, sweetened curd. Seventh month, Grut Khanda. 8th month, Grut Pur. And 9th month, different variety of cereal. This is the different Sahita mention of all of this. Ayur portion in first and second month. Initially, the diet should be palatable, which is easily taken, more liquid in nature. Madhur, Jivaniya, Bruhaniya, Balya, Deepaniya, and Snigdha. Madhur Dravya is Sashtik rice, wheat, red or brown rice, kalam rice, sweet potato, pumpkin, and carrots. Deepaniya Dravya is Sunti, Marich, Hinga, and Ajmoda. Dravadravya, that is lukewarm water, pouncerous, milk, ghee, payasa, sweet milk, madhur dravya, upasanskrut milk twice daily, coconut water, fruit juice, peya, buttermilk, and goat's milk. Snigdha dravya include navneet, madhu, dry fruits like piyal, that is chironji, and kharjur. Other is yashti madhu, sharkara, madhu, black cement, plaza, honey, lukewarm water, boiled with gold, silver, and bale fruit. Next slide, sir. This is the diet which is followed in the first and second month of pregnancy. Next slide, sir. Ayur portion in third month, milk plus rice plus butter, that is ghee, honey plus milk, milk plus fruit juice, krushra, sugar, Shashti Shali plus curd. Ayur portion in fourth month is butter, curd, rice, fruit juice, coconut water, and with the fruits like mango, watermelon, white and yellow pumpkin, snake yod, berry, pomegranate, amla, and yashti madhu. For thrust, shunti, shunti siddha jal or milk, yush, ounce rush, shali, Gomuk, jungle mouse, milk formula of butter in 4th month. Next slide, please, sir. Ayu portion in 5th month is rice plus milk, butter, ghee, Maunsavardak, that is Mounsaras, Mugdharas, Yush, Raktavardak, pomegranate, chiku, apple, spinach, beetroot, amlaki, guava, lotus stem, and pumpkin. Yavagu, which is mentioned by Bhel, Payasa, which is mentioned by Harith, rice plus ghee plus milk plus meat. In Ayu portion in 6 months is ghee plus rice, Yavagu, lotus stem, Yasti Madhu, and sweetened curd. Next slide, please, sir. Ayu portion in 7 months, same diet as in 6 months. Growth khanda as described by Harith, honey, water chestnut, grapes, sugar, yasti madhu, lotus stem, and avoid the excess of salt in 7 months. In 8th month, advise Yavagu in milk, honey plus milk, kapitta fal, snakewood, and sugarcane. In 9th and 10th month, sunti, yasti madhu, sunti, siddha, dugdha. Next slide, sir. There is a source which is property mentioned in Ayurveda, which is beneficial for the nutritional benefit. Milk, which is sweet taste, cold in potency, vitally enhance tissue growth, promoting and alleviates the vata and pitta. Nutritional benefits: complete food source of sugar, protein, fat, calcium, sulfur, magnesium, manganese, iron, iodine, zinc, riboflavin, and vitamin B12, A, K, lactose, helps in growth and development. Protein, serine, lactoglobulin, lactalbumin, and lactoferrin provides the immunological benefits, which is the property of milk. The properties of ghee sources, which includes the property like promoting and improving the digestion, promotes the strength, cold in potency, and increases the vata and pitta. Ghee is a complex lipid of glycerides, free fatty acid, phospholipids, sterol esters, fat-soluble vitamins, carbonyl, hydrocarbons, and carotenoids, plus vitamin D for the development of skeleton of young ones. Butter, which elevates the vata and pitta, promote the digestion, promotes intellect, and not producing the gastric irritation, improve the taste sensation, promote the strength and nourishment, which improve the vitality. Nutritional benefit includes the high calorie food, as 100 grams of butter provides almost 700 kilocalorie, rich in minerals such as calcium, phosphorus, and potassium, the good amount of sodium and small amount of fluoride, selenium, zinc, magnesium, rich in vitamin A and E, riboflavin, niacin, and
Hello, doctor. Hello, Dr. Neha.
Doctor, you're not audible.
hello.
Hello, Dr. Neha. Can you hear me?
Hello. Yes, sir. Yes, sir. Am I audible, sir?
Yes, doctor. You are audible.
Hello. Oh, yes, sir. Due to network issue, it disconnected the slide.
Okay, please continue, doctor.
Contraindication during pregnancy, गर्भोपघातकर भाव, excessive, heavy to digest, hot and pungent substance, which is mentioned by Charak Samhita, intoxicating substance like wine, excessive use of meat, dried up, stale and putrefied and wet food, those that which obstruct the body channels, polluted and incompatible food, pulses, vidahi anna, heavy or sour substance, suran and garlic, which is contraindicated by sahitas in pregnancy. Next slide, sir. Dauridya Avastha, these are the desires of the fetus which are expressed through mother and must be fulfilled by considering all above beneficial and harmful food factors. Fulfillment of this desire lead to birth of a child, posing the high qualities and longevity. Recipes mentioned in this book, the traditional book recipe by Ministry of Ayush, which are beneficial in pregnancy, include the Amle ki Panak, Khajuradi Mantha, Yush, Rasla, Laza Adrak, Gulkand, beet juice halwa, and Kharjur Ladu. References of this of all is Bruhatra and Lagutra. Next slides. Result, the Garbhini Ayu portion leads to appropriate growth and longevity of baby with uneventful delivery and is feasible for pregnant women of all strata of society, promoting the Ayurveda at domestic level due to its household availability. Conclusion is Garbhini Ayu portion is an holistic approach from conception to delivery in assess longevity and globally acceptable concept. Thank you, sir.
Thank you, doctor. Thank you for the presentation.
Next I invite Dr. Divya K.
Hello. Hello.
Hello, Dr. Divya.
Hello. Am I audible?
Audible, doctor.
Okay. Okay, sir. 1 second. Let me share this slide.
Your screen is visible, Dr. Divya.
Okay. Okay, sir. Okay. Hello. Am I audible?
Yes, doctor. Please start
Good
your
evening.
session.
Good evening. I'm Divya, doing my PG from Department of Kayachikitsa. My topic of presentation is concept of Kriya Kala in Ayurveda. These are my contents. Moving to the topic, Kriya means action and Kala means time. Kriya Kala describes the stages of development of the disease or the pathological process so that a physician can intervene as early as possible to prevent the further progression of the disease. Hence, it is also known as Chikitsa Avasara Kala. It is essential for early diagnosis, prognosis, and curative measures.
Hello, doctor. Your screen is not moving, doctor. It is on the first slide.
Okay, 1 second.
Okay, now visible,
Now
doctor.
is it
Please
visible?
change. Please
Okay.
change the slide, doctor. Okay, it is moving, doctor. Please continue.
Classification. Kriya Kala is classified as Vyadhi Kriya Kala and Ritu Kriya Kala. Moving to the Vyadhi Kriya Kala, Susruta Acharya in Sutrasthana 21st chapter has elaborated beautifully the 6 stages of Kriya Kala. Sanjayam cha pragobam cha prasaram sthana samsrayam vyakti bedam chayo veti doshanam sa bhavet bishak. So the first stage is Sanjaya. Samhadi Rupa Vriddhischaya means accumulation of doshas in its own site. In this, the doshas have not started to move or doshas are not in Vilayana state. It is in Samhadi Rupa, that is in compact stage. It is the Prathama Kriya Kala, and if Nidana Parivarjana is adopted, the further progression of diseases can be arrested. Next stage is moving to the Lakshanas. Vadachaya Lakshanas are Stabda Koshta, Purna Koshta, Stabda Purna Koshta. Pittachaya Lakshanas are Pidavabhasa and Mandoshmada. And Kabachaya Lakshanas are Anganam Gauravam and Alasyam. Moving to the second stage, that is pragoba. Vilayana rupa vriddhihi pragobaha. The accumulated doshas that have been undergone in chaya stage have started to liquefy. And it is the stage of aggravation of dosha, dvidiya kriya kala, and the second stage for preventive measures. Here, there is quantitative increase of doshas rather than qualitative. If Shodhana or Shamana is adopted, then further progression of disease can be arrested. Now, this pragoba can take place in two stages, either chaya pragoba and achaya pragoba. In chaya pragoba avastha, what happened means the doshas have undergone already chaya state, and then it leads to pragoba if nidana is continued. In Achaya Pragobhavastha, what happened means the Chaya stage have not undergone. Directly, the doshas have reached to Pragobhavastha. For example, in Achaya Avastha, we can say that a sudden abhigadajam or trauma if happened, there will be sudden increase of Vada dosha. Vada Pragoba takes place without undergoing Chaya state. In Achaya Pragobhavastha, in Chaya Pragobhavastha, what happened means, like in Ritukala, Vada Pragoba in Marshakala, Pitta Pragoba in Sharat Ritu, and Kaba Pragoba in Vasanta Ritu, like this all occurs after proper Chaya state. Moving to the Lakshanas. Vada Pragoba Lakshanas are Koshta Toda Vada Sanjananam. Pitta Pragoba Lakshanas are Amlika Pibasa Paridaha. And Kaba Pragoba Lakshanas are Annadvesham and Hrudayotklesham. Third stage is prasada. Here the excited doshas start moving from its own side. It is nothing but spreading of doshas. Just like fermented materials overflow, and movement is always carried out by vayu. The chalaguna of vayu propagates the movement of these doshas. And prasada can be prasada may occur in 15 types, hedu, and here the hedu linga chigilsa is adopted. Vada prasara lakshanas are Vayu Vimarga Gamanam Adobam, and Pitta prasara lakshanam are Osha Chosha Paridaha Dhumayanam, and Kaba prasarna lakshanas are Arojaga Avibhaga Angasada Chardi. Hello, am I audible? Hello?
Yes,
Doctor, audible doctor, please continue.
Okay. And the fourth stage is Stana Samsraya. Prasrudana Punardoshanam Srodu Vaigunya Atra Sangaha Sa Stana Samsrayam. Means the agitated doshas gets localized in the site where Srodo Vaigunya have occurred. Srodo Vaigunya in the sense if there is any defect in the functional or anatomical aspect of Srodas, that this doshas gets lodged and starts to show certain symptoms. Here in this condition, Purvarubas are manifested. When doshas are favorable, the diseases occur. Treatment must be given to both dosha, dusha. If here in this stage, dosha samurshana if occur in udara, we can say gulma, vidradi, adisara. If dosha samurshana takes place in vasti, we can see prameha, ashmadi symptoms. And Guda, Bagandhara, Arshas, Medogada means Grandhi, Arbudam, and if in Padagada, Vada Kandagam. So based on the site, symptoms will be manifested. And the fifth stage is Vyakti. Vyadihi Pravyaktam Rubam Vyaktihi means clear-cut symptoms will be manifested in this stage. For example, Sandaba Lakshano Jwaraha or Sarana Lakshano Adisara. In here, the Vyadi Pratinega Chigilsa must be adopted. And the last stage is Beda. Specific signs and symptoms of the diseases will be seen. Example like Vidradi, burst and becomes Vrana. Here, in this condition, the disease becomes subacute and chronic. Complications or Ubadravas will be seen in this stage. Now, moving to the second Kriya Kala is Ritu Kriya Kala. In the Ritu Kriya Kala, what happened means there will be seasonal variations that causes variations in the doshas like Chaya, Pragoba, Prashamana. Vakbadacharya has mentioned these three stages of Kriya Kala in Sutrasthana. First stage is Chaya. Chayo Vriddhi Swadamneva Pradveshu means increase. Here is also same accumulated doshas increase in its own side. And another one symptom mentioned by Acharya Vakbada is that there will be aversion towards the things that increase doshas and desire towards the opposite quality. Chaya usually takes place in Chaya of the Vada takes place in Grishma Ritu, and Pitta takes place in Varsha, and Kaba takes place in Shishira Ritu. Moving to the second stage is pragoba. Kobastun marga gamita means spreading of dosha starts to move to different places. Here the symptoms manifest symptoms of aggravated doshas. If not taken care, it manifests premonitory signs and symptoms. Sushrudacharya has mentioned that Purvarupa will be manifested in Sthana Samsarya stage. Vakpadacharya has mentioned that if pragopa avastha is not been noticed, then it may lead to premonitory signs and symptoms. Pragoba of Vada takes place in Varsha Ritu, Pitta in Sharat, and Kaba in Vasanta Ritu. Third stage is Prashama. Here, Swasthanastasya Samata Vigara Sambhavaha Shamaha means the doshas attain normalcy in their respective seats. Prashama of Vada takes place in Sharat Ritu. Prashama of Pitta takes place in Hemanta Ritu, and Prashama of Kaba takes place in Grishma Ritu. These are the stages. That is, Chaya of Vada takes place in Grishma, Pitta takes place in Varsha, and Kaba takes place in Shishira Ritu, and Pragoba Avastha, Vada Pragoba takes place in Varsha Ritu, Pitta Pragoba in Sharat Ritu, and Kaba Pragoba in Vasanta Ritu. And in Prashama stage, that is, Vada Prashama occurs in Sharat Ritu, Pitta Prashama occurs in Hemanta Ritu, and Kaba Prashama occurs in Grishma Ritu. Here is an article published in IAMG, International Ayurvedic Medical Journal, where the importance of Kriyakala Vivejana in the management of Prameha conceptual study. Here, the Kriyakala Vivejana is done in the case of Prameha. Like Navarnam, Sanjaya, how the Sanjaya stage occurs, like Navarnam, Pishtana, Payasa, Ikshu Vikara, Diva Swapnam, or if there is lack of exercise, what happens means there will be Sanchayam of Kaba and Medas, which leads to Gauravam and Alasyam. So, if Nidana Parivarjana is adopted, we can check Prameha at an early stage. Further, the person indulges in same Nidana, then Kabadosha further aggravates, produces Maduradara Rasa, and results in symptoms like Annadvesham, Hridayotklesham. Same person, if indulges in same Nidana, Kabadosha with Maduradara Rasa circulates all over the body through Rasayanis. And what happened? The result is Adimedo Jananam, Avibhagam, and Angasada. Here, the Prasarita dosha should be bring back to Koshta. Sthana Samsarya stage, what happened means there will be Dadu further indulge in same Nidana. What happened? There will be Dushti and Dadu Parinama Prakriya. So what happened means Meda Aparipakwam and Sharira Kleda increases. So the further formation of the Dadus from the Medas won't occur. Dosha Samurchana takes place. Sharira Kleda gets vitiated and will be increased, and it transforms into Mutra and lodges in Vasti. Will be getting symptoms like Madhurasyada, Alasyam. Hello?
Doctor, speed up your presentation. You are exceeding the time limit.
Okay. Then Apadarpana Chikitsa must be adopted. And in Vyakta Avastha, we can see disease will be manifested completely. Samanya Lakshanas like Prabhuda Avila Mutra will be seen. In such cases, Vamana or Virejana with Pramehara Aushadas can be adopted. The last stage is Beda Avastha, where chronicity is seen. Ubadravas like Prameha Pedagas starts manifesting. And in that cases, Vrana Prakriya and Shastra Prindana Kriya must be adopted. Discussion how Pragoba and Prasara varies. Dalhana in the commentary has mentioned clearly that if ghee is melted, if ghee is heated, it starts melting, and this stage is Pragoba stage, and further heating, it starts overflowing from the vessel, and this suggests the Prasara stage. Shadkriya Kala versus prevention. We all know that prevention is better than cure. And this prevention can be adopted if following Ridhucharya or Dinacharya, or if there is early diagnosis is adopted. And this Shadkriya Kala helps in early diagnosis, and so that further progression of the disease can be arrested. I conclude by saying that Shadkriya Kala is stages of development of pathological process. It recognizes the stage of disease progression, and it helps to arrest disease at early stage so that further complications can be avoided. These are my reference. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you.
Thank you for the presentation. Next, I invite Dr. Krishnaveni for the presentation. Hello, Dr. Krishnaveni, are you there?
Yes, sir.
Okay, doctor.
Sir, am I audible?
Yes, doctor, audible. Please start the session, doctor. And your screen is also visible, doctor.
Thank you, doctor. Good evening to all. I am Dr. V. Krishnaveni, third year PG scholar from Department of Prasuti Tantra and Stree Roga, Dr. NRS Ayurvedic College, Vijayawada. Today, my topic of presentation on Ayurvedic approach to menopause. Introduction. The menopause marks the permanent cessation of menstruation resulting from irreversible changes in the hormonal and reproductive functions of the ovaries, and it is associated with a large number of symptoms ranging from physical, psychological, and genitourinary. In the present scenario, the menopausal health demands priority due to increase in the life expectancy and growing population of the menopausal women. In Ayurvedic, the menopause correlated with Rajo Nivritti. It is formed from two words. Rajas means menses and Nivritti means cessation or pause. Synonyms Rajokshaya and Rajonasha. According to Bhava Mishra, Rajonasha is one among the 80 types of Vadhaja Rogas. Raja Sanya Pravartate Yati Panchashata Kshayam. Jara Pakva Shariranam Yati Panchashataha Kshayam. According to Shushruta, Shushruta Sharira, 3rd chapter and 11th. And the age of menarche is 50 years. All acharyas also say said same. And according to Kashyapa, the age of menarche or menopause depends upon the nutrition and health status of the individual. Nidana, there is no specific Nidana according to Ayurvedic text. The probable reasons are Swabhava, Jara Pakva Sharira due to Kala, Dhatu Kshaya, effect of Dosha, Vayu and Abhigata. Types of Rajonivritti are Kalaja and Akalaja. Lakshanas of Rajonivritti, Dhatu Kshayaja Lakshanas along with the vitiated doshas. Vadaja Lakshanas, Sirasula, Rutspandana, Hastapada Shukti, Shabda Asahishnata, Balakshaya, Admana, Vibanda, Anidra, Brahma, Anvastita Chitatvam, that is Vaichitya, Vishada, Chinta, Smritimanya, Krichra Vyavayata, Maitun Asahishta, Vaksanga, Vali, Astivedana, Katishula, Sandhivedana, Vamanatva, Angamadda, Yoni Vedana, Yoni Shushkata, Prabhuta Mutrata, and Mutra Kuchata. Pittaja Lakshanas are Osha, Atishveda, Amarsha, Yoni Daha, Yoni Daugyanda, Mutra Daha. Kafaja Lakshanas are Atistaulya, Yoni Khandu, and Yoni Shrava. Samprapti is during Vruddhavastha, there is an increased Vata dosha is present that affects the manogunas like Rajas and Tamas. It leads to psychological disturbances which causes the Dhatu Kshaya. There is a depletion of Rasadhatu. Meanwhile, there is a depletion of Upadhatu, that is Artava Kshaya is also there, leads to Rajo Nivritti. Management. In Ayurveda, there is a drugs having a Rashayana, Balya, Vayastapana, Vata Shamana, and Kapvardhana drugs, which helps in management of the Rajo Nivritti. According to Dosha Visheshan, the drugs advised are in Vataja, Kumari, Ashwagandha, Saffron, Arjuna, Jiraka, Ela, Guggulu, Lasuna, and Madhuka is advised. In Pittaja, Arjuna, Kumari, Brahmi, Shatavari, Madhyeshti, Chandana. In Kafaja, Trikatu, Haridra, Tvak, Guggulu are advised. In Panchakarma, that is in Snehana, for external application, Bala Thaila and Mahanarayana Thaila is advised, which is because of for Vata Shamana, and in degenerative conditions, it will be helpful. In Shvedana, that is Dashmulak Vata and Portali Pinda Shveda, whereas in arthritic conditions or in any stiffness or degenerative conditions, it will be helpful. In Shirodhara, it is found to be effective in the disturbed psychological symptoms, which is managed with the Shatavari Taila, Takradhara, and Dashmulak Vata. Panchendriya Vardhan Taila, which is strengthening for all the Panchendriyas, and Anutaila is advised. Uttarvasti, Eshtimadu Taila, the phytoestrogens present in the Eshtimadu, which helps in the premenopausal symptoms. Pishu, Shatavari Thaila, and Shaddhatu, which helps in the dryness of the vagina, and there is all menopausal symptoms. Vasti, especially Anuvasana Vasti is advised. Patya, soya, nuts, dadima, garlic, shatapushpa, milk, egg, fish, pulses, whole grains, weight-bearing exercises, yoga therapy like Bhujangashana, Baddha Konashana, Matsyashana, Pranayama, Dhyana, Ralpal, which are soothing to the mind and body, and it calms the mind and helpful in combat the menopausal symptoms. According to modern, menopause literally means the end of monthly cycles. It derived from the Greek word pausis, that is cessation, and the root mens. It signals the end of the fertile phase in the woman's life. Permanent cessation of menstruation at the end of reproductive life due to loss of ovarian follicular activity. That is the definition of menopause. Pre-menopause is the period prior to menopause, and after menopause is the post-menopause. Perimenopause is the period around the menopause, that is 40 to 55 years. Climacteric is the transition period between the woman passes from reproductive to non-reproductive. It covers the 5 to 10 years either side. Pathophysiology: during climacteric, ovarian activity declines. Initially, ovulation fails, no corpus luteum formation, and no progesterone from the ovary. Later, graphene follicle fails to develop, and estrogen activity decreases that leads to amenorrhea. Increases secretion of FSH and LH due to negative feedback mechanism. Symptoms with vasomotor like hot flashes and excessive sweating and sleep disturbances. In genital, there is atrophic changes mostly. Dryness, stenosis, vaginal infections, rectocele, and laxity of pelvic cellular tissues and loss of tone of the ligaments. In sexual symptoms like dyspareunia and decreased libido. Urinary symptoms like urgent incontinence and mostly in urethral syndrome. Psychological symptoms are mood swings, emotional instabilities, dysphoria, and difficulty in concentrating, and palpitations and attack of panic. Mostly there is a pseudocyesis, means that the patient feels the signs and symptoms of pregnancy, but there is no confirmation of the fetus. Gastrointestinal symptoms like constipation, flatulence associated with the colic spasms, intestinal distension are mostly present. Locomotor like fibrocitosis, osteoarthritis, myalgia, etc. In skin and hair, persisting wrinkles around the mouth and crowfeet appearance of wrinkles around the eye are the characteristic symptoms. In others, development of warts and navi, tinnitus, and toothache and cataract, etc. Symptoms with prolonged are cerebrovascular diseases and osteoporosis. Diagnosis: the cessation of menstruation for consecutive 12 months, appearance of menopause in hot flush and night sweats, serum estrogen less than 20, and FSH and LH greater than 40. Vaginal cytology shows a 10, 85, and 5. Management: non-hormonal and hormonal. Non-hormonal lifestyle modifications, nutrition diets, etc. Hormone replacement therapy when in climacteric condition. Estrogen only when had a hysterectomy patients. And with intact uterus, estrogen and progesterone. Estrogen and androgens are helpful with the symptomatic relief with vasomotor symptoms. Utility of Ayurvedic support. Mostly the symptoms are vasomotor. In Ayurveda, Pitta Shamana drugs are given. Vangabhasma, Gudichi Shatva, or Kamaduga Ras. In hormone replacement therapy and adjuvant medicines are alpha agonist clonidine and venlafaxine. These side effects are high blood pressure, sleep disorders, low sodium, serotonin syndrome, and sexual dysfunction. Cardiovascular symptoms: hypertension, palpitations, and heart disease. In Ayurveda, Hrudyam, Arjuna, and Prabhakar Vati is advised. Antihypertensive drugs and statins are advised in adjuvant medicine, and side effects are intestinal and long-term disease, kidney dysfunction is there. Psychological symptoms like depression, anxiety, and loss of libido and Alzheimer's are there. And Medhya Aushadas like Brahmi, Jatamamsi, Eshtimadu also advised. Adjuvant medicines, selective serotonin reuptake inhibitors are advised. Because of this, side effects are mostly dry mouth, nausea, diarrhea, headache, insomnia, etc. General symptoms: insomnia, fatigue, headache, vertigo, breast tenderness, and skin pigmentation. The drugs with Deepana Pashana are advised: Raktashodaka and Jiraka and Jyotishmati. Antidepressant medicines and serotonin reuptake inhibitors are indicated. Gastrointestinal symptoms are increase and decrease in appetite, weight loss or gain, indigestion, and constipation. Physical changes: reduction in collagen tissue and bone, osteoporosis, skin atrophy of breast and genitourinary system, vaginal dryness. Pravala Basma, any Herbal phytoestrogens is advised in pitta aggravated conditions. Arjuna Jatamamsi Kukudanatwak Bhasma ineffective in osteoporosis, which helps in calcium supplementation. Bala Aswagandha as a rasayana. Shatavari Guduchi Ashoka Gokshara Musta helps in the vaginal dryness. Adjoint medicines are biphosphonates. The side effects are bone, joint, and muscle pain. Gastrointestinal symptoms are there. Why advocate Ayurveda for menopause? It's a natural physiological and can't be passed, as well as reproductive can't be extended. Ayurveda only ages and support this natural process, neutralizing hormonal imbalance as well as supporting the side effects. Symptomatic relief without the side effects. Phytoestrogens doesn't overdose the body due to its selective receptor therapy. Why hormone replacement is not the right thing for menopause? It's a colossal side effects, not a permanent solution, can't be taken long term, mostly maximum 3 to 5 years. It's a risk of carcinoma of endometrium and breast, and against a natural physiology. Additional medication for the addressing associated symptoms with tremendous sides. Symptoms caused on the withdrawal of hormonal replacement therapy is worse than the normal menopausal transition itself. Conclusion: each phase of women's life is beautiful, and it should be considered as a gracious. According to Ayurveda, Swasthasya Swastharakshana, Atarasya Vikara Prashmana is the basic line of treatment. So Dhatukshaya is due to Dhatukshaya is responsible for Vata Vruddhi, and vitiated Vata dosha affects the various systems in the woman's body. From the above theory, we concluded that Ayurvedic drugs having the Rasayana, Vata Shamana, and Kapha Pardhana, along with Panchakarma, Shadvrutta, balanced diet, yoga, meditation, can help in for the management of menopausal syndrome. Thank you.
Thank you, doctor. So before going to the next presentation, we strictly reminds you all, your maximum time limit for your presentation is 8 minutes to follow the rule. So next I would like to invite Dr. Jayashree Totaram Bakmade. I
Hello,
invite
Dr.
Dr. Jayashree.
Hello, Dr. Jayashree, are you there? Hello, Dr. Jayashree, are you there? Next, I invite Dr. C.T. Rishi for the paper presentation. Dr. C.T. Rishi, are you there? Dr. C.T. Rishi, are you there? Okay, next I invite for the poster presentation, Dr. Priyanshi, are you there? Hello, Dr. Priyanshi, are you there? Hello, Dr. Priyanshi, are you there? Okay, next I invite Dr. Vidya Ramchandra for the paper presentation. Dr. Vidya, are you there? Hello, Dr. Vidya Ramchandra, are you there? Hello, Dr. Vidya, are you there? Okay. Next, I invite Dr. Nanda Mahadev for the paper presentation on the topic role of Garbha Sambhava Samagri and its clinical application in infertility. Dr. Nanda Mahadev Satre, are you there? Hello, Dr. Nanda. Can you please unmute, doctor?
Yes, sir.
Okay. Please share the screen, doctor.
PPT. Sir, it is shared?
Yes, doctor. Your screen is visible. Please share the session, doctor.
Okay, sir. Good evening, all. Myself, Dr. Nanda Satre, PG Scholar, Rachanachari Department, BSDT Ayurved Mahavidyalay, Wagholi, Pune. My guide name is Dr. Dhawle Suvarna, HOD Rachanachari. My topic name is Role of Garbha Sambhav Samagri and its clinical application in infertility. Second. Abstract. Ayurveda is the traditional ancient Indian health science. Ayurveda described regimen and rituals before pregnancy to take care of fetus and suprajajanan. Ayurveda described essential factors for pregnancy as a Garbha Sambhav Samagri. That is, Rutu indicates a fertile period, Kshetra uterus, Ambu, Ahar Rasa nutrition, and Bija, that is Shukra and Shoni. The combination of all these factors lead to the formation of fetus. Acharya Charaka has also told about the importance of progeny, as the couple with progeny have many benefits, like he is a Bahumurtitva, Bahumukha, Bahukriya, Bahuchakshu, Bahugyan, Bahushakha. So the study of all these factors of Garbha Sambhav Samagri will help the society and nation. Keywords: Garbha Sambhav Samagri, Rutu Kshetra, Ambu, Bij, infertility, clinical importance. Now introduction. We all know the shloka that Dhruvam Chaturnam Sanidhyat Garbha Sad Vidipurvakam Rutu Kshetrambu Bijanam Samagrad Ankuro Yatha. Dandana says Rutu means Rutu means Rutukal, that is fertile period, Rajas Samay. Kshetra means Garbhashaya, Ambu meaning the Rasadhatu which forms after the digestion of Ahara, Bija meaning the Stri Bija, Arthav, and Purush Bij, that is Shukra. This diagram represents how the sprout or plant needs favorable climate, favorable land, and quality of seed to grow. Like that, only fetus also grows in uterus with the help of the Rutu, Kshetra, Ambu, and Bij. In Ayurveda science, the matter related to Garbha and Garbhotpadak Bhav is described systematically and in detail. When there is a combination of Shukra, Shonita, Atma, Prakriti, and Vikar in Kukshi, Garbha forms. Acharya have explained detailed study of each bhava as a Garbha Sambhav Samagri, that is Rutu, Kshetra, Ambu, Bij. These factors are very essential for conception. Infertility may occur if there is any abnormality in Garbha Sambhav Samagri. Infertility is defined as not being able to get pregnant after 1 year or longer of unprotected sex. This diagram shows all four factors, means all four limbs of Garbha Sambhav Samagri, that is menstrual cycle, healthy uterus, healthy sperm and ovum, and the endocrine hormones and the nutrition that the fetus gets from the mother's uterus. Now, first one is Rutu. Rutu means a period suitable for conception of Garbha. For Garbhadhan, intercourse should be done in the Rutukal only. In Ayurveda, it is explained in two ways. One is from the 12 years from 50 years, it is considered as a fertile period. And second opinion is from the first day to the 16th day of the period as a Rutukal. The woman in Rutukal looks healthy, bright, happy, excited, and sexually interested due to the estrogen influence. In modern science, it is considered as proliferative phase or a pre-ovulatory phase. At the end of this phase, mature follicle develops and ruptures and excrete oocyte, which is now ready to get fertilized with the sperm. Disease like polycystic ovarian syndrome, anovulation, hormonal imbalance, etc. affect the regular menstrual cycle. Rutukala. Rutastu Dvadasha Nisha. It is of 12 days. According to the other acharyas, it can be of 16 days also. If Yoni, Garbhashaya and Arthav are healthy, it may be of entire month also. Dallana says, Dvadasha Ratramiti Shodasha Dineshu Madhya Adhyam Dina Trayamintam Cha Shodasham Yoni Sankocha Dinam Na Gananiyam. Out of 16 days, first 3 days and last 1 day of Yoni is constricted. So in between 12 days are counted as a Rutukal and most suitable period for conception. This is the menstrual cycle. In these 4 phases are there. First phase is menstruation, second phase is proliferative, third one is ovulatory, and fourth we can say secretory phase or the luteal phase. Now, second factor is Kshetra. It represents the Garbhashaya, which refers to the reproductive system of the mother, especially uterus. Healthy and good condition is necessary for the fetus development. Abnormalities include diseases like endometriosis, fibroid, polycystic ovarian disease, congenital anomalies of uterus like unicornate, bicornate, septate uterus, salpingitis, obstruction of fallopian tube, cervical polyp, cysts, vaginal septum, imperforate hymen, septate hymen, etc. So the healthy condition. So the healthy condition of all these parts is very much necessary for fertility. This shows all the factors of uterus, all the parts of uterus, that is fallopian, ovary, fallopian tube, fundus, endometrium, cervix, vagina. All these parts of uterus should be healthy for the fetus to grow. Third one is ambu. Ambu means the water and nourishment received by the garbha from the ovum and sperm and the uterus through the umbilical cord from the placenta of mother. The fetus is linked with the placenta of mother by umbilical cord. Fetus floats within the fluid and nourished by the mother. Stages like fertilization, implantation, fetal organogenesis, placenta formation are affected by the nutrition received. Ambu means rasa dhatu, that is derived after complete digestion of ahara. The Pachak Agni digests the ahar and sar is formed as a rasa. Rasa does the tarpan and portion of the garbha. Abnormalities in ambu. Abnormalities in ambu. Oligohydramnios, that is reduced amniotic fluid, and polyhydramnios, that is excess amniotic fluid. Bija. Here Artava and Shukra both are included in Bija. Artava in Ayurveda, both Stri Bija and Rajasrav are explained as Artava. Shuddha Artava symptoms also explained in Ayurveda. It is read as a Laksharasa or a blood of rabbit or like a Gunja Phala. In modern science, it is considered as a Bija abnormality, can be considered as abnormalities of chromosome, genes, DNA, etc. Shukra. Acharya have described qualities of Shuddha Shukra as a Spatikabha, that is crystalline, Kshaudra Tailaneba, that is the color of honey and oil, Madhugandhi, that smells like honey, Drava, that is liquid, Pichila means slimy, Bahu means abundant, Bahal thick, Shukla white, Madhura sweet, Snigdha anxious, Sara mobile, Sandra dense. These are the qualities required for the fertilization. Spatikabham, Dravam, Snigdham, Madhuram, Madhugandhi, Shukram, Ichanti, Kechitu, तैल क्षौद्र निबम तथा शुक्लम शुक्रम गुरुम स्निग्धम मधुरम बहुल बहु घृतम आक्षिक तैलाभम सदगर्भार. This is the parts of sperm and ovum and the morphology of the sperm and ovum. For the fertilization, the morphology of sperm and ovum should be in the healthy condition. Any abnormalities in the morphology can lead to the unhealthy fetus and infertility. Abnormalities in menstruation. Amenorrhea, condition which involves the absence in menstruation during reproductive period. Menorrhagia, it is a condition which involves excessive bleeding during menstruation. Oligomenorrhea, polymenorrhea, and dysmenorrhea. Semen, seminal fluid, volume 2.5 to 5 ml per ejaculation, normal sperm count 50 to 150 million per ml. Oligospermia means less than 20 million sperms are present per ml. pH of semen should be 7.2 to 7.6. Appearance of semen is milky due to the prostatic secretion and mucus due to the bulbourethral secretion. Abnormalities like asthenozoospermia, azoospermia, oligospermia, teratospermia can affect the fertility. Now, clinical importance and conclusion. Living in the modern era, fertility has become key issue. Fertility rates have been decreasing. Infertility has become challenge to the medical science. But it seems that Ayurvedic science has clearly documented the key ingredients of conception, like Rutukshetra Ambu Bij. Ayurveda help us to understand the areas we should be focused upon when fertility and infertility related issues is being discussed. Garbha Sambhav Samagri, that is Rutukshetra Ambu Bij, are referring to the ovulatory phase, healthy uterus, proper nourishment, and unvitiated semen and ovum respectively. These are very essential for conception and best offspring. Thank you.
Thank you, doctor. So next I invite Dr.
Ma'am, my
Priyanshi Saxena.
poster presentation is also there.
Doctor, you can present it next.
Okay, thank you.
Please be there.
Hello.
Dr. Priyanshi?
Yes, hello, ma'am.
Hello,
Hello.
Dr.
Yes, you're audible.
Priyanshi. You're audible, doctor.
Please start.
Okay, sir. I'm sharing my screen. Just a second.
Okay, doctor.
Hello, everyone. I am going to present the poster presentation on the topic management of Shaya Mutra. I am also having the ongoing thesis on this topic. So, as we all know that Shaya Mutra is the wetting of bed during the sleeping. It can be during the day or the night time. Basically, it happens mainly during the night time. That's why it's also called as nocturnal enuresis. It's one of the most commonly occurring pediatric problem. There is no pathology which is described in any of the Brihatrayis. Only Bhaishaji Ratnavali and Vaidya Manorma written by Acharya Kashyap have the mention of this disease with their chikitsa. The origin of the disease, according to modern science, is psychosomatic origin and behavioral disorder. But if we connect it to the Ayurvedic perspective, then we don't have any mentioned pathophysiology of the disease. But depending on the behavior of the disease, we estimate that it is due to the Mutravaha and Manovaha Srotas vitiation. Vangsena and Sharangda Samhita have given the description of Shayyamut. Admal, Bhaishaji Ratnavali, and Vaidya Manorma have also have also mentioned it in their Samhitas. If we go to the Chikitsa point of view, there are 3 points we take in perspective. That is Dairvyapasha, Yukti Vyapasha, and Satvaja Chikitsa. Okay. If we look at the Samprapti Ghatak, then Kaph and Vat are mainly the Sharik dosh, and Mansik dosh can be Tam. Strotas, Manova and Mutrava Strotas. Strota Dushti Sang due to the Sangs. Vyakt Sthan is Basti. Rog Marg is Marmasti Sandigat. Vyadhi Sabhav is Chirkari. Asadhyatva contains it as a Kashta Sadhya. If we go to the Devapasha Chikitsa Manjari has advised to give the Vishnu Padak after washing the statue of Balkrishna. Yukti Vapasha Chikitsa contains the Bimbimol and Ahifane, which is described in Bhaishaji Ratnavali. But due to the pediatric age group, nowadays we can't use Ahifane as it is poisonous. Kashyap has given the use of Champak root Kashaya. As it has Kaph Avruta Vat condition, using of Kaph Har and Vatanuloma treatments may help. If we look at the Srotasat, Mutrava Srotas Vikruti focuses on the treatment should remain on drugs acting mainly on Mutrava Srotas. Man and neurological developmental delay plays a role in pathology, thus Medhya drugs. For Krumijanya Shayamutra, Krumigna drugs can be used. Satvaja Chikitsa also plays an important role. Emotional factor that precipitates Shayamutra, that is bedwetting or consequences of Shayamutra, can be managed with Satvaja Chikitsa. I have mentioned the ganas, Balegan, Medhigan, Promigna, Mutu Sangrani, and the Sayan Gan. And the drugs which are mentioned in the Charak Samhita are mentioned below it. As in Balya contains Endri, Shatavari, Ashwagandha, Mashparni, Sthira, Katuk Rohini, Bala, and Atibala. Medhya contains Manduk Parni, Yashti Madhu, Shank, Pushpi, Jyotishmati, Jata Mansi, Vacha, and Pushmand. Promigna contains Shigru, Marich, Kebuk, Vidang, Nirgundi, Apamarg, and Pokshur. Mutra Sangrahaniya contains Jambu, Udumbar, Ashwath, Ambu, Plaksh, Vat, Shirish, and Ashmantha. Rasayan contains Amalki, Haritki, Vividki, Ashwagandha, Suvarna, Shilajit, Bhalatak, and Guruchi. Shayamut, as being the most common behavioral problem, causes low self-esteem and embarrassment among the children. As the etiopathogenesis is not yet confirmed, multifactorial approach should be considered. Along with the drugs, the counseling and the bladder training should also be given. Drugs which are Mutra Sangrahaniya, Krumigna, Medho, Balya, and Rasayan should be used or can be used in a comprehensive way, and we should form some kind of management protocol for the Shayamutra. So yeah, that's it. Thank you.
Thank you, doctor. Thank you for the presentation.
Can I leave the meeting as I have duty?
Sure, doctor, sure. Next, I invite Dr. K. Sai Sruthi for the presentation. Dr. Sai Sruthi, are you there?
Sir, yes, sir.
Okay, doctor. Please share the screen, doctor.
Okay, sir.
Your screen is visible, doctor. Please start the session.
1 minute. Good evening to everyone. I am Dr. K. Shruti, presently pursuing PG final year in the Department of Prasuti Tantra and Sriroga in Dr. NRS Government Ayurvedic College under the guidance of the Dr. Kola Vijay Kumari ma'am. Today my topic of presentation is role of Panchamahabhutas in the formation of Garbha. So first, definition of Garbha. So various acharyas mention the various definitions regarding the Garbha. First, Kukshistasya Praninaha Garbha iti. According to the Amarakosha, the living organism present in the womb is considered as Garbha. According to the Charaka, Shukra Shonita Jiva Samyoge tu Kalu Kukshigate Garbha Sangha Bhavati. The union of Shukra and Shonita along with Jiva inside the Kukshi is termed as Garbha. But besides this Atma, Sushruta mentioned Prakriti and Vikara are also essential for the Garbha formation. That is, Shukra Shonitam Garbhasyastam Atma Prakriti Vikara Sammurchitam Garbham Ityuchyate. So according to the Charaka, Shaddhatvatmakata of Garbha. So in this Shaddhatvatmaka, there is the role of the Pancha Mahabhutas. The sloka only told as Garbhastu Kalu Antariksha, Vayu, Agni, Toya, Bhumi, Vikaras, Chetana, Adhisthana Bhutaha, Eva Manaya, Yutya, Pancha Mahabhuta Vikara Samudayatmako, Garbhas, Chetana, Adhisthana Bhutaha, Sahasya, Shashto, Dhatruptaha. So along with the Pancha Mahabhutas, that is sixth one is the Chetana. So that is considered as Shaddhatvatmakata of Garbha. As all we know that Sarvam Dravyam Panchabhautikam Asmin Arde. So whatever Dravya present in the universe is made up of the Panchamahabhutas. So in Charaka also, Edbinde Tad Brahmande, whatever present, this is the microcosm versus macrocosm theory. Whatever present in the Pinde, that is present in the universe. Whatever present in the universe, present in our body also. That is the importance of the Panchamahabhutas. Panchamahabhutas which are similar in our body. Asti Dhatu is the predominant of the Prithvi Mahabhuta, whereas Drava Dravyas like Rakta, Mutra are predominant of the Jala Mahabhuta. The color and complexion are predominance of the Agni Mahabhuta, and also the Jataragni also due to the Agni Mahabhuta. The essential functions of our body, those are Uchvasa, Niswasa, are mainly due to the Vayu predominance, and the spaces within the major tract like GIT and auditory faculty are all these are spaces are of Akasha Mahabhuta. So Shariraka Bhavas which are having the Mahabhuta predominance are Dhatus like Rasa, Majja, Shukra and Malas like Mutra and Upadatus like Stanya. These are all predominance of the Rasa Mahabhuta, whereas Jala Mahabhuta, whereas Jala along with the Teja are predominant in the Rakta Dhatu. Along Agni Mahabhuta is the predominant of the Artava, that is Artavam Agneyam, whereas Prithvi is the predominant in Mamsa Dhatu. Prithvi along with the Vayu is predominant in Asti Dhatu. So these are some Shariraka Bhavas which are having the predominant Mahabhuta. According to the Harita, Panchabhutamayam Deham Akasham Shunyamevacha Shunyad Vayuhu Samutpanno Vayuhu Prana Prajayate. So body is Panchabhautika, among which Akasha is pervading comes into play. From Akasha comes the Vayu, and from Vayu all the Prana. That is all organs of the body will be formed. So Harita mentioned the sequence of the Panchamahabhutas, that is Akasha Jalam, Jalam Utpannam, Jalajat Vasundara, Tasyas Tejas Tada Jatam, Tejaso Jayate Tamaha. So this is the order of the sequence of the Panchamahabhutas. From the Akasha Jala Mahabhuta, from there Prithvi, Prithvi to Tejas, Tejas to the Tamas. This is according to the Harita. Whereas individual functions of the Panchamahabhutas are in the formation of the Garbha, Tam Chetana Avasthitam, Vayu Vibhajati, Tejo Yena Pachati, Apaha Kledayati, Prithvi Samhanti, Akasham Vivardhati. These are the individual functions of the Panchamahabhutas. So Coming to individual Mahabhuta, Vata, Vayu. During the Garbha Utpatti, it acts by Vibhajana. So, from the union of the Shukra Shonita, all the division of the Dosha, Dhatu, Mala, Anga, Pratyanga is done by the Vayu. This is causes the organogenesis, tissue formation, and systemic maturation in the developmental process of embryo. The Vayu Mahabhuta to divide the fertilized cell into the two daughter cells. This multiplicity is possible by the Vayu Mahabhuta, thus it acts in the multiplicative growth process. Thus the word growth implies mass and size, which results by the cleavage. Cleavage is the division process. So from the first single cell to the formation of the 96, there is up to the morula stage, all this cleavage is formed because of the predominance of the Vayu Mahabhuta. Next, coming to the Agni, Tejo Mahabhuta restores the metabolic activities and supplements as the converter of the mass into the energy. It provides general appearances like human structure along with color and complexion by performing the metabolic functions, which maintains the life of fetus. So Tejo Mahabhuta predominant of the giving color and complexion to the fetus. Bhava Mishra explains Tejo Mahabhuta stays in the body in the form of 5 types of pitta along with the specific dhatus. So Tejo Mahabhuta is a predominant in the formation of the color and complexion. Along with other Mahabhutas, it gives the Gaura and Krishna like Varnas. Next, coming to the Jala Mahabhuta. Jala renders the moistening quality to the Garbha. It causes the rehumidification of dryness created by the Vayu and in the process of division, thus maintain the life of fetus. This Jala nourishes the Ojas. Our Jala Mahabhuta play role in accretionary growth. That is after the division, that is the accretionary growth in the growth of fetus. Thus the word accretion means growth by the accumulation of water and process of the protoplasmic synthesis and water uptake. Next, coming to the Prithvi. Prithvi does consolidation and it solidified or gives shape to the embryo already moistened by the Jala. It is responsible for all hard substances and integrity of the body. Prithvi Mahabhuta brings the inner changes which occur the differentiation. Apparently, this compounds to the changes in shape. Next, coming to Akasha Mahabhuta, it provides Akasha Vivardhayati. It provides the Vivardhana. That is the action of multidimensional development and increase in the size by providing vacuum with Atmapana is done by the Akasha. It brings the changes in the size of growing fetus. Akasha Mahabhuta play a role in auxiliary growth. This property of auxiliary involves the increase in the size of organism, especially due to the growth of size of its individual cells rather than increase in the number. Next, according to the Harita, stepwise development in the normal development of the Garbha. From the Stribija and Pumbija, by the union, by the action of the Agni situated in the Panchamahabhutas, it becomes the shape of the Kalala. Next, because of the Vata predominance, it comes to the shape of Budbuda. By Panchamahabhuta Agni becomes Kalala and it gets solidified and it becomes in the shape of the Pinda Peshi Arbuda. It differentiates the gender, again becomes the Kalala. And next, further metabolism occurs and it gives a solid appearance. By the Vyana Vayu Panchatattvas, all body organs will be formed. This sequence according to the Harita. Next, by the action of the Budana Vayu, Gala, Hridaya, Mukadwara, all will be found. By the action of Apana Vayu, it clarifies the Apana Dwara. Similarly, inside the body situation, Vayu comes out of the body and according to in different orifices. Next, various Panchamahabhutas which are predominant in the stages of the embryogenesis. First, Vata Mahabhuta, Vayu Mahabhuta. It is the helpful in the karyokinesis and descent of the zygote from the fallopian tube into the uterine cavity. Next, after that, this is according to modern differentiation of the trophoblast into the cytotrophoblast and syncytiotropoblast. Next, after that, differentiation of the embryologist into the hypoblast and epiblast. Formation of the trilaminar disc and formation of yolk sac and amni. All these are under the influence of the Vayu Mahabhuta. Next, coming to the Tejo Mahabhuta, proteolytic action of the trophoblast for embedding. So, after the disappearance of the zona pellucida, that embryo will be hatches into the endometrium. That is disappearance of zona pellucida assisted by the trypsin-like enzyme. This is under the influence of the Tejo Mahabhuta. Next, coming to the Jala Mahabhuta, nourishment and production of the inner cell mass are embryoblast by the trophoblast. and uteroplacental circulation, which is established the 13th day of post-fertilization. In this process, the nutrition comes from the uterus to the placenta. Next, fetal-placental circulation, which is develops in the 21st day after the post-fertilization. In this process, the nutrition goes from the placenta to the fetus through the umbilical cord. All these under the Jalamahabhuta predominance, and also the amniotic fluid all under the influence of the Apmahabhuta. Next, coming to the Prithvi Mahabhuta, maintains the grouping and compactness of the cells under division. It gives shapes to all the structures formed during the time of growth and development. Next, Akasha Mahabhuta. Already previously discussed spaces like GIT, auditory, all these are under the influence of the Akasha Mahabhuta. During the embryogenesis, blastocyst formation and amniotic cavity formation and yolk sac formation, extra embryonic coelom, and the trophoblastic lacunae, which will later come to the intervillar space, formation of foregut, midgut, hindgut, all are under the influence of the.
Hello, Dr. Sai.
Ma'am, yes, ma'am.
Doctor, speed up. It's time up.
Okay, ma'am. Coming to the conclusion, Panchamahabhutas plays important role in the Garbha Utpatti. Sarvam Dravyam Panchabhautikam Asmin Arthe. So every Dravya is made up of the Panchamahabhuta. It is difficult to say that one particular Mahabhuta plays a role in the formation of the one particular body component. And this is a bibliography. Thank you, Vananda.
Thank you, doctor.
Thank you, sir. Okay,
so next I invite Dr. Nanda Mahadev for the poster presentation. I invite Dr. Nanda for the poster presentation.
Yeah, thank you. Good evening, all. This is my poster. This is my poster presentation. I'm describing this in this poster that Kala Sharir in modern accept. In this, I have shown all the 7 kalas that in the modern perspective, what we can show the anatomical structure and correlate it with the kala. That in Mausudhara Kala, I have correlated it with the deep fascia and the intermuscular septum. In Raktadhara Kala, I have correlated with the endothelial lining of blood vessel. Medodhara Kala, I have correlated with the omentum. Shleshmadhara Kala, I have correlated it with the synovial membrane. Purishdhara Kala, I have correlated with the mucous membrane of the large intestine. Pittadhara Kala, correlated with the mucosal lining of the small intestine, especially duodenum. And Shukradhara Kala with the mucosal lining of the vas deferens, testis, and next. Now I am explain one by one. Kala Khalvapi Sapta Bhavanti Dhatva Shayantar Maryadaha. Kala Sharir is explained in Sushri Sharir Sthan Adhyay 4 Garbha Vyakaran Sharir. Kala means it is the lining that separates the Dhatu and Ashaya. Kala forms partition between the tissue, that is Dhatu, and organ cavity, that is Ashaya. Kala are 7 in number. यतहि सारा काष्ठेषु छिद्यमानेषु दृश्यते तथाहि धातुर्मांसेषु छिद्यमानेषु दृश्यते स्नायुभिश्च प्रतिच्छन्नान् सन्तताश्च जरायुना श्लेष्मना वेष्टिताश्चापि कलाभागास्तु तान् विदु. As on cutting the wood, its pith is observed. Like that only dhatu is dissecting the musculature. The kalas are those which are covered by ligaments spread as a membranous structure like amniotic membrane with shleshma, that is mucus. Here 7 kalas are shown. Mamsadhara kala, Raktadhara kala, Medodhara kala, Shleshmadhara kala, Purishdhara kala, Pittadhara kala, and Shukradhara kala. Now first one is Mamsadhara kala. This is the first kala explained by Acharya Sushruta. Mamsadhara kala is the structure that covers and separates the sira, that is veins, snayu, muscles, tendons, dhamani, arteries, and strotas, that is cavity in the body. In modern science, we can correlate it with the deep fascia and intermuscular septa that separates the muscle from the underlying structure. Second one is Raktadhara Kala. This is the second Kala in our body. It is the Mansa Abhyantarataha, that is inside or embedded in the muscle. It has Shonita, that is blood. It is found mainly in blood vessels, liver, and spleen. Anatomically, we can correlate it with the endothelial lining of the blood vessel. वृक्षात् यथा अभिप्रहतात् क्षीरिणः क्षीरिमाः वहेत् मांसात् एवं क्षतात् क्षिप्रम शोणितं सम प्रसिच्यते. This is called in relation with the Raktadhara Kala. As we have seen that latex comes after the cutting of wool, but we cannot see it from where it is coming. Like that only when we cut the muscle or any injury happens to the muscle, first the blood comes. This is the example of the blood, that is, it is Raktadhara Kala, that is, it is the Mansa Abhyantarataha. Third one is the Medodhara Kala. It is found mainly in the abdomen and small and large bones. In modern science, we can correlate it with omentum. That is, all the fat is accumulated in at the site of omentum. There is a fat with blood, sarakta meda in small bones, and yellow marrow. In Ayurveda, it is called as a vasa in large bones, which is also Medodhara Kala. The fourth one is Shleshmadhara Kala. It is the fourth Kala. According to Sushruta, Shleshmadhara Kala is present in all joints of the living beings. Anatomically, it can be correlated with the synovial membrane that lines the joint cavity. Synovial fluid secreted by the synovial membrane can be correlated with the Shleshma. It is fifth one is Purishdhara Kala. It is the fifth Kala in our body. It is located in the Pakvashaya and it separates the Mala Bhag and water in Kosta. It is also known as the Maladhara Kala. It separates the waste product in the form of urine and feces. In modern science, we can correlate it with the mucosal and submucosal layer lining of the large intestine. Sixth Kala is the Pittadhara Kala. This Kala receives the food from the Amashaya and digests it and absorbs it with the help of the Pitta Agni in proper time. Grahani, that is the first part of the duodenum, is generally used for small intestine. Bile and pancreatic enzymes in the duodenum holds and digests the fluid received from the stomach. Anatomically, the mucosal and submucosal lining of the small intestine, that is especially the duodenum, can be taken as a Pittadhara Kala. Seventh one is the Shukradhara Kala. Seventh and the last Kala is the Shukradhara Kala. According to Ayurveda, it is located throughout the body. That is, it is also called as Sarva Sharir Vyapini. We cannot, in Ayurveda, the actual site of Shukradhara Kala is not described. It is Shukradhara Kala is described as a Sarva Sharir Vyapini. In Ayurveda, it is said that as like we could not see the presence of ghee in milk and sugar in the sugar cane with naked eye. Similarly, we could not see the Shukradhara Kala with naked eye, but it is there in all over. It is spread all over in all our body. Anatomically, we can correlate it with the Shukradhara Kala with the mucous membrane of the seminal vesicle, vas deferens, testis, etc. in male. Conclusion. This observation and correlation may help us to compare Kala Sharir with the anatomical structures to make the description of Ayurveda useful for modern application, and thus we could practice the knowledge in various fields of Ayurveda and modern also. Thank you.
Thank you, Doctor. So next I invite Dr. Mrinal Padatkar.
Yes, ma'am.
Dr. Mrinal. Hello, Dr. Mrinal.
Yes, ma'am. I'm shared. Yes, ma'am. My PPT is visible.
Your screen is visible, doctor, but your PPT is not visible. Can you open your PPT, doctor?
Yes, sir.
When you open your PPT, then share the screen, doctor. Hello, Dr. Mrinal. Hello, doctor. Hello, Dr. Mrinal Vartkar. Hello, Dr. Mrinal. Can you hear me? Hello, Dr. Mrinal. Can you hear me? Hello, Dr. Mrinal. Can you hear me? Okay, next I invite Dr. Umesh Aravind Maleva for the paper presentation. Dr. Umesh, are you there?
Yes, sir, I will.
Okay, doctor,
I
please
will
share the
share my
screen.
screen.
Sure, doctor. Please share the screen, doctor.
Sir, my screen is visible.
Your screen is sharing, doctor, but not visible.
1 minute.
Dr. Umesh, you have any problem with screen sharing, doctor?
Yes, sir.
Doctor, I will share for you, doctor.
Yes, sir. Please.
Please start the session, doctor.
Hello, sir. You share my screen. My
Okay,
topic
doctor.
is effect of Triphala Quad Dhawan in Jatyadil application along with lifestyle modification in the management of Dushtabran. Abstract. Next, diabetic wound, a significant complication of diabetes mellitus, represent a complex and challenging aspect of healthcare.
Hello, Dr. Umesh. Your screen is visible, doctor? Hello, Dr. Umesh. Can you hear me?
Yes, sir.
The screen is visible, doctor. Please continue this presentation, doctor.
Next slide. A case of 56 years male presented with complaint of non-healing ulcer in right lower limb near ankle joint with known case of type 2 diabetes mellitus. With slough discharge, false smell, discoloration of surrounding skin has been presented here. There was complete healing of the ulcer of 150 days of treatment. In this case, Zatari Tel and Triphala Kashaya shows its Shodhan, Ropan and Rakta Prasadan property. Keyword Zatari Tel, Dushtabran, Triphala Quat, diabetic wound. Made worse by the presence of current, which can have grave consequences. Local wound variables such as slough, infection, and foreign bodies interfere with the normal healing process. In comparison, the contaminated wound, a healthy wound in a normal body, heals more quickly and leaves fewer scars. Since ancient times, managing wounds has been utmost importance. Successful wound care includes use of the right drugs, wound dressing, and dietary guidelines. Next slide, sir. Of wound healing. One of the 60 treatments methods that is called Shashti Upkram of Sushrutas of run is Ahar. One of the 60 Upkram of run is Ahar to keep dosh in Samya Avastha, thereby keep the run Shuddha Avastha. Proper diet is advised. Also Parishek means washing of run with liquid kwath, and Abhyanga, a massage by oils, also mentioned in the 60 treatment of Sushrutas. Next slide. These are the properties of Zattari tel. These are the contents: Zati, Nimba, Patol, Naktamal, Pallav, Sikta, Madhu, Kushtha, Katurohini, Manjishtha, Padma, Klodra, Abhya, Utpalam, Tuttha, Sariva. And these are the properties of Zatetel in Nadi Vrane, Kachuro, Sadhya Shastra Prahareshu, Dagda Vidyeshu, Nakadantakshaye, Vrane, Dushte. Next slide. Property of Trifalakwat. These are the content. Pathya, Bhibitak, and Dhatri are the contents of Trifalakwat. These are the properties: Kafapittagni, Meha Kushtahara, Chakshushya, Dipani, Rucha, Vishamjwara, Nashini. Next slide, sir. Case presentation. A 56-year-old married male farmer presented to the OPD with non-healing ulcer on the right ankle joint. He has known case of type 2 diabetes mellitus for 1.5 months with slough discharge, foul smell, discoloration of surrounding skin. The patient had a history of ankle joint injury from riding a bike a year ago, which healed with proper medication. However, 1 month ago, which working in the farm, he sustained another ankle joint injury that came into contact with water, resulting in pus formation. Next slide, sir. Surgical incision and drainage were performed, and routine investigation revealed the diagnosis of type 2 diabetes mellitus. Despite regular dressing, the ulcer has not healed in the past month, and he advised skin grafting. Therefore, he came to OPD for further treatment. At that time, BSL fasting 280 and postprandial 340, and his HbA1c is 9.2. Next slide. Local examination. Site of wound near right ankle joint. Edges inflamed, less tender. Exfoliation seen near wound. Next slide. Case report. Age 56 years, sex male, occupation farmer, अष्टविध परीक्षा, नाडी वात प्रधान पित्तानुबंधी, मल असम्यक, मूत्र प्राकृत, जिव्हा ईशत साम, शब्द प्राकृत, स्पर्शानुष्णाशी, द्रुप प्राकृत, आकृती मध्यम. Next slide. Lifestyle modification of our patient had a history of regularly consuming curd 3 to 4 times a week and eating rice and wheat roti daily. Therefore, the patient is advised to avoid curd, fermented food, wheat, rice, and their derived product. Instead, it is recommended to include millets like sorghum, finger millet, and pearl millet in the daily diet. The patient had a habit of daytime sleep, so it is advised to discontinue daytime sleep and follow the Dincharya, Ritucharya. Next, medication. Asnadi Gan Kashaya 20 ml BD, Apane with Anupan with lukewarm water. Chandraprabha Vati 2 tablet BD, Apane. Sushma Trifala tablet 2 tablet BD, Apane. Guggulu Tikta Gruth 10 ml BD, Vanodane. Capsule Gandhak Tel 1 capsule BD, Vanodane. Anupan with lukewarm water. Patient was instructed to chemotherapy daily. We were washing and remove slough properly from right ankle wound with the help of Trifala Kwath in the lukewarm state, and then apply Zate Tel on wound with the help of gauze. This treatment scheduled for last 150 days with unbelievable changes in healing. Result. First day, fasting, BSL fasting 280, PP 340 and HbA1c 9.2. On 150th day, BSL fasting 151 0.7, postprandial 196.2, and HbA1c 8.2. The clinical signs and symptoms of Dushtavan were improved at the first week after the sensation of our wounded right ankle was also started to improve. After 1 month, visible changes were seen towards the healing. With continuation of Dhawan by Trifalaquat and application of Zatyatil on wound for 150 days with supportive internal medication and diet, right ankle got completely healed with minimum scar. Next slide. These are the images of before and after treatment. First image is first day treatment and last image 150-day treatment. Discussion. Trifalakat has Vranashuddhaka along with Vranropak properties of the 60 upamas of prana management describing Shushru Samhita. Multiple action attributes. Kashaya ras, Tikta ras, Ruksha in property that helps remove slough and give proper atmosphere to the start of regeneration of damaged tissue. This guna is effective on vitiated kapha and normalize it. It helps to eliminate the symptoms like srav, kandu, dorgandhya, while it is also helpful to provide relief in pain, enhance healing. Quat also has proved antimicrobial property in earlier research work. There was no, next slide, there was no any adverse event found throughout the management of and healing occurred uneventfully. The mode of treatment found cost effective, safe, and easy to implement. Neem, Haridra, Rodra, Abhya, Lodra have antimicrobial activity, prevent secondary infection, Manjishta, Sariva, Karanj, Vran, Rushudan properties. Karanj, Abhya have antioxidant, wood healing properties. Zati, Patul have Vran, Ropan properties. Pushta has anti-inflammatory action.
Doctor?
Summary and conclusion. These are all properties are making healing possible. Thus, Trifalaquat and Zatyadi Tel is effective in management of Dushtavan. These are the reference. Thank you.
Thank you, doctor. Thank you, doctor.
Hello, sir. I am ready with PPT.
Okay. Thank you, Dr. Umesh.
Welcome, sir.
We will call you next, Dr.
Now I invite Dr. Dhyamanagowda Patil for the presentation.
Good evening, madam.
Good evening, doctor.
Hello, sir.
Hello, doctor.
Sir, can you share my PPT, sir? Some problem is there, sir.
Okay, doctor. Please start the session, doctor.
Good evening, sir. Myself, Dr. Dhyamanagowda Patil from the Department of Shalyatantra. Today, I am going to deal with the concept of Shuddha Roga. Next slide, sir. Introduction. As far as Bharata is concerned, Shushra Samhita and Ashtanga Hridaya have described Shuddha Roga in separate chapters. Charaka Samhita, though the superior text in Kayachikitsa, does not mention Shuddha Roga separately. After Madhavanidhana, Bhava Prakasha Samhita, Sharangadhara Samhita, and Yoga Ratnakara also elaborate chapters on Shuddha Roga. Almost each and every Shuddha Roga explained by these acharyas is near about similar, except for few variations. There is some variation in the terminology of some Shuddha Roga varies in the other symptoms changes a little bit while in rest of them treatment parts vary same. This creates confusion to some extent. Next slide, sir. Coming to the definition of Kshuddra Roga, Kshuddra means small or less important. Roga means the diseases. Kshuddra means Alpa. Alpavyadi is said to be Kshuddra Roga. The paryaya of Kshuddra means Swalpa, Adama, Krura. Next, sir. According to Madhavanidhana, the disease which have less severity or more severity in the symptoms come with either pain or without pain, or small or big, etc. All can be considered as a Kshuddra Roga. These diseases are called Kshuddra as they are lesser in severity in comparison to Mahavadi or Vyadi, or it may be simply a nomenclature traditionally accepted by previous authors. But according to Dalada, the diseases of mild Hetu and mild Lakshana and mild treatment mostly comes under Kshuddra Roga. Coming to the number of Kshuddra Roga in various Samhitas, according to Acharya Sushruta, there are 44 Kshuddra Rogas, Ashtanga Sangraha 36, and Ashtanga Hridaya explained 36 Kshuddra Rogas, and coming to the Sharangara Samhita, they have explained 60 Kshuddra Rogas, and Madhavanina explained 42 Kshuddra Rogas. Next, sir. And Bhavaprakasha has mentioned 43 Kshuddra Rogas, and Yoga Ratnakara has mentioned 44 Kshuddra Rogas, and Vaishesha Ratnamali has explained Kshuddra Rogas in 16th chapter. Next, sir. Coming to the name of the Kshuddra Roga, names of Kshuddra Roga, Samasena Chattvariksha Kshuddra Roga Bhavanti Tadyata Ajagallika Yavaprakya Andalaji Kumrata Kachapika Valmikam Indravrutta Vanasika Vashana Gardava Jalagardavaha Kaksha Vispota Agni Rohini Chippam Punaka Anushayi Vidarika Sharkarabhuda Pama Vicharchika Rakasa Padadarika Gadara Alasendra Lupta Darunaka Arumshika Palitam Masurika Yavana Pedaka Padmini Kantaka Jatumani Mashaka Charmakila Tilakalaka Necha Benga Parivartika Amapatika Nirudha Prakasha Sanirudha Guda Ahiputana Kushana Kachra Buddha Brahmsus Devi. Next, coming to the one by one. Coming to the first one, Ajagalika. Ajagalika means Snigdha Savarna Gratita Nirujaha Mudga Sannimaha Kapa Vatotita Dheya Balanama Ajagalika means Ajagalika is nothing but it's a moist and skin color Mudga Bija Samana Pidaka with vitiation of mainly Kapha and Vata. Mainly it is seen in children. It can be correlated with or compared with the papilla. Coming to the treatment aspect, treatment can be classified Pakwa and Apakwa. Coming to the Pakwa Jagalika treatment, Apakwa Jagalika treatment, first we can do the Jalokachana followed by applying Shukti plus Evakshara Satakshana Lepa. In Pakwa Jagalika, same as Rona treatment. Next, Yavaprakya. Yavakara Katina means it's hard to touch, elevated skin growth, which is caused by the vitiation of mainly Kapha and Vata dosha. It can be compared with Nodule. Next, Andalaji. Coming to Andalaji, it's a hard pimple-like cystic growth beneath the skin, does not contain opening. Mainly involved doshas are Kapha and Vata. Treatment, coming to the treatment effect, Andalaji, first you can do the Svedana Chikitsa, then followed by Manashila, Harinala, Kushta Devada, Runepa application. If it is suppuration, incision and drainage should be done, then followed by the one Chikitsa should be done. Next one. Vivrita, it's a large boil like ripe udumbara fruit samana with a wide opening, having a severe burning sensation. Mainly it's a involved doshas with the pradana. It's a round pedaka. It can be compared with the pustule with opening. Next. Coming to the Kachapika, it's a hard swelling like a tortoise shell in the axilla. Because of the Kupita, Kapha and Vata, it can be compared with the benign tumor of the skin. Next one, sir. Coming to the treatment aspect, Andalaji, Yoprakya, Fanasi, Kachapika, these are the same treatment. Nothing but we can do the first Svedana Chikitsa, then apply Manashila plus Haritala, Kushta, Devadaru Lepa. Then on suppuration, it should be done incision and drainage and followed by one Chikitsa should be done. Next one, sir. Valmikam. Mainly involved doshas in Valmikam, Kapha, Pitta and Vata. These are the, because of these doshas, a gradual growing swelling like ant hill with a small ulcer Symptoms like pricking and burning, pain, also itching, and especially in palm, sole, neck, etc. It can be compared to actinomycosis. Coming to the treatment aspect, first we can do the Shastra Karma, Kshara Karma, Agni Karma, and then Ronarupana Chikitsa. Kshara Karma, first we can remove the Puti Mamsa, then we can Puti Mamsa help with the help of Pratikshana Kshara, then we can apply the Agni Karma, then we can do the Ronarupana Chikitsa. Next one. Coming to the Indra Rutta, the vitiated Vata and Pitta causes a boil with a numerous smaller boils within like a lotus seed. It can be compared with the circular pustular ulcers. Then Panasika, Kapha and Vata Prakopa will causes a boil located within the ear or back of the ear having severe pain. It can be compared with the painful cyst near the ear. Pashanagardha, the Vata and Kapha Prakopa causes a fixed hard, less painful swelling near the mandible. It can be compared with the mumps. Coming to the treatment effect, first we can do the Svedana Chikitsa, then apply Manashila, Haritala, Kushta Devala paper. On separation, incision and drainage should be done, followed by Rama Chikitsa. Next. Coming to the Jalagardhava, a non-separative swelling which spreads and associated with the fever and burning sensation. Next one, sir. Coming to the treatment, Pitta-janya Visarpa Chikitsa should be done. Chippa. The Pitta Vata Prakopa in the nail bed. It causes pain, burning sensation in the nail bed and suppuration. It can be compared with the Paranekya.
Dr. Patil,
Madam?
your time is up. Please speed up.
Okay. Paranekya is an infection of the tissues adjacent to the nail, most often fingernail. It's caused by the injury or irritation such as the hangnail, critical damage, or continuously wet. And symptoms are adjacent tissue is a painful, red, swollen. There is a maybe pus. Due to the trauma or nail become black, rough, and also called as purina. Coming to the Ushna Jala Sheka and vitiated Mamsa is exercised surgically. Application of the Chakra and Agni Karma should be performed, and such a Chuna Bandha Karma should be done. Because of the continuous trauma, soul hand, a stone and thrown prick will vitiate the Meda and Rakta Dhatu leads to the beds like heart swelling. Kola Bija Samana. Father Dare. Excessive walking leads to the Vata Kupapa causes cracks in the soul. Coming to the treatment aspects, then first we Snehana, Svedana, Siraveda Karma, then lap of Madhuchista applied. Coming Jatumani, rough, painless, reddish, congenital, round patches over the skin. Mashaka, painless, small, raised, round, fixed, blackish discoloration, black ground, called as Tilakalaka. Tilakalaka is a large, painless, blackish, discolored, non-elevated mole skin. Treatment Agni Karma should be followed by Kshara Karma. Avapatika, coitus with a less age or small vagina, Astabhigata masturbation, repeated rubbing, Shukravega Dharana. These are Lakshana. Treatment Svedana ghee applied the foreskin. Parivartika. Causes of Mardana, Pidana, Abhigata, Samprapti, Prakopita Vata takes Samshaya in the Metra Charma, makes Metra Charma hard shell and tear the proboscis. Lakshana, pain in the proboscis, burning sensation, proboscis, itching sensation, suppuration of the proboscis. Nirta Prakasha, constriction of the orifice of the proboscis due to the which cannot be drawn back over the glans penis. This is usually caused by the Vata. Prakopita Vata takes Stana Samshaya in the skin of Metra, proboscis of the penis. Coming to the treatment, narrow meatus of the dilated using gradually thicker nadi made of the metal. Sanirudogara. This is the deformity of the anal canal characterized by the narrowing of the anus resulting in the deformity of the defecation. Upon Vata, Vaigunata will cause the stitches in the anus difficult in the defecation. Treatment, Sanirudogara was the Valmika Rohini considered as the Asadya Rogas. Sanirudogara, excessive straining, diarrhea causes prolapse of the rectum. Ruksha Sharira generally debility may cause the rectal prolapse. Next. Treatment Snehana, Svedana over Buddha Pradesha reposition of the Buddha. Thank you. Sorry for leaving.
Thank you, doctor. Thank you for the presentation.
Thank you.
Next, I invite Dr. Mrinal Vadadkar.
Yes, ma'am.
Hello, Dr. Mrinal. Hello, Dr. Mrinal.
Yes, sir. I'm sharing my PPT.
Doctor, I will share for you, doctor. Please start the session.
Yes, sir. My topic is literary review on a role of diet and lifestyle in Mutrashmari. Introduction. Ayurveda is conventional Indian medicine. It describes various principles related to physical and mental health of body. The primary aim of Ayurveda is to preserve and promote the health of healthy individuals along with preventive management of disease. Mutrashmari is most common disease of urinary system. According to Ayurveda, the urinary system is known as a Mutravaha Strotasa. Acharya Shushruta described Mutrashmari as one of the Ashtamahagats. Acharya Charka mentioned Ashmari is one of the Basti Marmashrit Vadi. In modern science, it is known as urolithiasis. Yeah, urolithiasis means calculi or stone. A reasonable diet and lifestyle of living and unhealthy diet play important role in Mutrashmari. Unhealthy lifestyle can cause Mutrashmari. So it is important to know Pathya diet and lifestyle in Mutrashmari. Aim objective to understand, review diet and lifestyle in Mutrashmari. Material and methods, literature collected from the various Ayurvedic texts and research articles. Acharya Charka described when the Vata dries up semen or the urine or pitta kapha, it gradually give rise to development of calculi. Literature review. Ashmari as appearance of Mutrashmari is like a small stone. They got name Ashmari. Mutrashmari can manifest anywhere in renal, urinary bladder, urinary tract. Mutrashmari is one of the painful disorder of Mutravaha Strotasa. There are 4 types of Mutrashmari: Vataj, Pittaj, Kaphaj, Shukraj. Um, Samprapti of Ashmari due to improper purification of the body and by following improper diet and lifestyle. Kapha dosha get vitiated combined with urine release in the basti to form Ashmari. Pathya in Ashmari. The ahar vihar which is known as a pathya and those which cause annoyance to disease is called as apatya. It has come a very common disease in today's population due to change in lifestyle. People are not aware of pathya for diseases. A factor that is damaging or awful to physical and mental well-being. Apatya is influenced by the number of variants, including time, place, quality, and the person's physical condition. The ahar vihar that adds in curing the illness without spreading it to other are referenced as a patya, while those are make illness worse are referenced as a apatya. Patha, Kulatha, Horsegram, Mudga, Green Gram, Yava, Jirna Kushmanda, Adrak, Yavak, Shar, Chaulai, Shigru, Apatya, Brinjal, Spinach, Tomato, dry dates, Udit, other Viruddha Ahar, Guru, Vishabda Ahar, Veg Dharan, suppression of natural urge, Ati Vyayam, over exercise, discussion. Ashmari is very common and one of the major cause of abdominal pain due to disturbing lifestyle or not following Pathya Apatya. Mutrashmari is common disease and recurrent disease. Urolithiasis, often known as Ashmari, is highly prevalent and important cause of abdominal pain. Among the urinary disorder, it is the one of the most distressing disease. The development of Ashmari is directly correlated with dietary intake and routine. Asamyak Shodhan and unsuitable diets such as Adyashan and Vimashan are the cause of his induction. Kapha, it is major dosha in Ashmari. Therefore, a diet and lifestyle that promotes growth of Ashmari, which should be avoided. Example including excessive consumption of Guru Shita Stigdha Madhura Ahar, irregular eating habits, and Diva Swap. Conclusion. Preventive aspects play important role to cure disease along with medicine. Pathya apatya change the recurrence of disease. A disease cannot be managed slowly by medication. Prevention measures are also important. Thus, by alternative ones, diet and way of life, having a through understanding of Ayurveda's Pathya apatya can help one to recover their health. If a patha is followed, samprapti, vighataj, occurs along with the Nidan Parivarjan, then the treatment is successful. Thank you.
Thank you, doctor. Next, I invite Dr. Radhika Dattadraj Hadab for the paper presentation. Dr. Radhika, are you there?
Yes, sir, I'm there.
Please share the screen, doctor.
Yes, sir, I'm sharing it. Hello, sir, am I audible?
You are audible, doctor. Your screen is also visible. Please start the session, doctor.
Sir, my name is Dr. Radhika Hadab. I'm a PG final year student from Saptashungi Ayurveda Medical College, Nasik. I'm presenting a topic named An Observational Study to Assess the Effectiveness of Samyak Nidra in the Treatment of Staulya. And the main aim of my topic is, can taking sleep at right time for right time period in the right position will really help someone reduce his overweight and overcome the obesity. My abstract says Acharya Charaka has designated Ahara, Nidra, and Brahmacharya as the main three pillars of life, termed as Traya Upastambhas. This, when taken in adequate amount at right time, provides stability to the body and improve Bala, Varna, and Upachaya in the body. Among these, Nidra plays a major role in one's life. Adequate sleep leads to Arogya, means health, Bala Shukra Vriddhi, increase in physical and reproductive strength, and Dhatu Samyata, and healthy life, which is ultimate goal of Ayurveda. On the other hand, altered sleep leads to Balahani, that is loss of strength, Rugnavasta, disease state, or even death. So it can be said that abnormal and inadequate nidra can manifest in the form of dhatu vikara, making a person atura, means diseased. For better economic gains, people are neglecting their daily needs of having proper ahara, nidra, and other required vihara at proper time. Due to these reasons, people are becoming more prone towards disease state. And Staula is one of the greatest outcomes of Nidra Viparya. It is nothing but one more Dhatu Vikara, in which there is an abnormal and excessive accumulation of Medo Dhatu. Staula is burning issue for today's era. A person in whom excessive accumulation of Meda, that is fat or adipose tissue, and Mansa, that is muscle tissue, leading to the flabbiness of hips, abdomen, and breast, been categorized as Atistaulya. Obesity is the closest entity used for Staulya and Atistula person and is included under Ashtanindita Purusha. Ashtanindita Purusha are prone to many diseases. In Ayurvedic classics, the tripod of life depends on Ahara, Nidra, and Brahmacharya. For a person to live healthy life, the equilibrium of these three are mostly required. As time passes, people forget the basic principles of Ayurveda, which is the main reason of illness. Elevation of Vata, Pitta, and Kapha, along with depletion of Medodhatu by increasing Medodhatvagni, is the main aim of treatment of Medoroga. In Ayurveda, some herbal drugs, classical preparation, and Panchakarma procedures and Adravya Chikitsa are mentioned in the management of Staulya. But by adopting the simple lifestyle and healthy food habits, that is Pathya Apatya, and taking good amount of sleep, anyone can enjoy the life optimally without having a lifestyle diseases. So, adequate amount of sound and deep sleep ensures happiness, nourishment, power, virility, and acuity of knowledge. Similarly, lack of sleep is responsible for misery, wasting of body tissues, weakness, lack of libido, and lack of concentration. Normal night sleep is nourishing, replenishing, and the lost potential of body senses and mind. Adequate sleep taken at the proper time is responsible for vigor, knowledge, tolerance, valor, good digestive power, happiness, good physique, etc. And ultimately, an inadequate sleep makes one unhappy, timid, ignorant, weak, impotent, and emaciated. This study is all about to show effectiveness of proper and adequate sleep in the management of Sthaulya. And as expected, final conclusions showed that taking Samyak Nidra, that is proper and adequate sleep, is really proved effective in the management of Sthaulya up to some extent. Here are my some keywords: Sthaulya, Nidra, sleep, obesity, Medudhatu, Swapna, service study, Upastambha, tripod, Anidra and Atinidra. Introduction. In Ayurveda, Ahara, Nidra, Brahmacharya are a support system of life, as said before. Amongst them, sleep is one of the most essential for healthy life. Nidra provides nutrition to the living body, maintain health like Lord Vishnu who nourishes and protect the world. Nidra is one of the important pillars among them. It comes under Adharaniya Vega, that is unsuppressible urge. If it is suppressed, then it causes headache, body pain, heaviness of eye, etc. Getting enough sleep at right time supports well-being and good quality of life. Proper Nidra protects growth and development of body. It helps
Dr.
to get
Radhika?
proper learn. Yes, ma'am. Yes, ma'am.
Doctor, please speed up.
What? What, ma'am?
Doctor,
Hello.
please speed up.
Hello, doctor. You are exceeding the time limit, doctor. Can you speed up your presentation?
Yes, sir. Surely. Nidra provides effective in the treatment of Sthaulya. My hypothesis was taking Samyak Nidra did not prove to be much effective in the treatment of Sthaulya, and the alternative hypothesis was that taking Samyak Nidra had proven very much effective in the treatment of Sthaulya. I use the materials, that is subjects who are among the Ati-Stool category. I use the BMI as my main criteria, and the subjects who are willing to do this, I use measuring tape, weighing machine, proper case taking format, and daily Samyak Nidra follow-up charts. Methods. First, the conceptual study was there, where I do the literature study on Nidra and Sthaulya, and survey study I did on the urban area of Nasik, where I lived. Discussion of Samyak Nidra. So what is Samyak Nidra? It is stated here, peaceful and normal sleep. Nidra Kala is mentioned as stated stated before. 30 Muhurta period is divided by sun into day and night, and he described that the day activities for the night, described that day for activities and the night for the rest. Then Shayya is also mentioned in the Ayurvedic classics. Sleeping on a cot is Tridosha Shamak and is promoter of good health. Sleeping on a bed on the ground neutralizes Vata and Kapha. Sleeping on the ground results in the obesity and increases virility. Sleeping on a plank of wood increases Vata. Sleeping on a comfortable bed in general increases happiness, sexual desires and virility. Sleeping posture after taking the dinner. When a person goes to sleep, first he should lie down in the recumbent posture, taking 8 times breath. He should change the posture to the right lateral till taking 16 times breath. And then after to left lateral till taking 32 times breath, and then he can sleep at any posture according to his wish. Inclusive criteria was patients of 18 to 80 year of age group, irrespective of sex, caste, creed, religion. And then BMI, the persons I have selected was more than 25 kg per BMI will be included in the study. Exclusive criteria was patient below 18 was not selected and above 80 was not selected. Family history, obesity, patients having Kaphaji Prakriti, patients on sedative drugs, night shift work employment, pregnant and lactating women are not selected. Grishma Ritu. Study design was finding persons with Sthaulya by counting their BMI. These Sthaulya patients are selected for the study. Basic details and records were recorded. Repeated measurements are done after 6 months. Observations noted and conclusion is drawn after the statistical analysis. Observations showed us noticeable weight loss and reduction in BMI value. Conclusion. Thus, our study concludes with the conclusion that taking Samyak Nidra that is appropriate and adequate amount of sleep taken at proper time for right period of time proved to be very much effective in the treatment of Sawle. This was the references. Thank you so much.
Thank you,
Thank you,
Doctor.
Dr. Radhika.
And before going to the next, dear participants, still there are a lot of participants to present. So it's your responsibility to complete your presentation within your time limit. So next I invite Dr. Pallavi Sri Krishna Patil.
Yes, ma'am. Hello.
Hello, doctor. You are audible.
Hello.
You are audible.
Yes. Sir, can you please share the slide?
Okay, doctor. I'll share for you. Please start your session, doctor.
Okay, sir. Hello, I'm Pallavi Patil. Hello, so slide is not seen. Okay. Hello, I'm Pallavi Patil from LRP Ayurvedic Mahavidyalaya, Uran, Islampur, Department Shastra. I'm presenting the topic role of Panchakarma in a Shuddha Tantra. Next slide, sir. Introduction. So, according to WHO, Panchakarma is the essential process of the Ayurveda. So, Panchakarma is Vaman, Virechan, Dasya, Basti, and Raktamokshan. Raktamokshan is the key of the Shalya Tantra, which is done by various yantras, shastrat, anushastrat, and various conditions such as vrana, vidradhi, parikartika. This needs the Panchakarma procedure. Next, these are the 5 Panchakarmas, including the Snehan, Sveda, and Abhyanga. Then importance. So it is the Shalya that troubles the mana and Sharira. Hence, doshas which are involved in our body are leads to diseases. Hence, the relevance of this dosha is important. So, dosha which pacifies by Shodhan never reoccurs because they detached from the roots. Hence, the Panchakarma is used. And the chief objective of the Shalya Tantra is extraction. So, the malas and doshas are extracted by this Panchakarma. Next, sir. So, Panchakarma therapy in various diseases. First one is Vrana wounds. So, Sushruta explained the Shashti Upakramas in the management of the Vrana. So, Panchakarma is involved in this Shashti Upakrama. So, Vata doshas, Sneha Pan Seka, Snigdha Upnaha, Sneha Basti is indicated. Then Vidradhi means abscess. So, in the treatment of the Vidradhi, the Bhedan is suggested. Then Bhagandar, fistula in Anu. So different forms Vedana, then Vatahar drugs is indicated in the Bhagandara. Then Parikartika, fissure. Fissure, Pichabasti and Snehobasti is indicated, which has a soothing demolescent effect. Then Granthi, tumors. So in Granthi, the Shopa Chikissa, Snehan Chikissa, Raktamokshan Chikissa, Svedan Chikissa is indicated. So Acharya Sushruta has considered Ayurveda, that is venipuncture. And sneha, processed snehas with various drugs is indicated in the patients. Vata doshas are effective in this. Then local application of fermentation, that is Svedan, is indicated in the patients. So it is useful in the inflammatory swellings. Then Vaman, emesis, is indicated in the Kapha doshas. Virechana, that is purgation, is indicated in the Pitta doshas. Next, sir. Then Basti, that is enema. The enema, when the wound is situated in the lower part of the body, then Basti is indicated, which is act on the Vata doshas. Then Uttar Basti is indicated in the Mutra Ghata, Mutra doshas, Shukra doshas. Then Shirvirachan, it is indicated in the Urdhva Chatrugat Vyadhi. Raktamokshan. Rakta is a Chaturtha dosha explained by the Sushruta. In inflammatory swellings, Raktamokshan is helpful to relieve the pain. In conclusion, by using the Panchakarma procedures, the practice of the Shalya Tantra is sure to be beneficial with the improved outcomes. Successful pre-op management of the numerous surgical conditions require adjuvant therapies of the Panchakarma. To minimize the surgical surgeries, the Panchakarma procedures are very much effective. Thank you, sir.
Thank you, doctor. Thank you, Dr. Pallavi. Next, I invite Dr. Sonuben V. Patel for the paper presentation. Dr. Sonuben, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Yes, sir. Sir, can you share? I'm not able
Sure,
to.
sure, doctor. I will share for you. Please start the session, doctor.
Yes, sir. A conceptual study to improve the health-related quality of life with a special reference to diet, sleep, and yoga. Next slide. According to the WHO, outline 1 defines the quality of life and individual perception of their position in the life in the concept of cultural which they live in relation to their goal, expectation, standard, and concern. Health related quality of life is a multidimensional concept commonly used as an examine to impact of health status on quality of life. Next slide. There are 3 determinants of health include first social and economical environment, second physical environment, and third person's individual characteristics and behaviors. And there are 4 physical health, psychological state, social functioning, and economic situation. So on the basis of these 4 criteria, it is determined the health overall health. And nowadays, diet, sleep, and lifestyle pattern of whole population across the world has changed. So, and there are many responsible causes like diet, lifestyle, lack of exercise, irregular sleep patterns, and excess screen time of phone, which cause the metabolic disease, cardiovascular disease, and physical and mental health issues. Next slide. Aim is to improve the health-related quality of life index and well-being with a holistic approach of Ayurveda, yoga, and lifestyle modification. Next. Material. I have used Ayurvedic texts, Charak Samhita, Sushruta Samhita, and also some articles for reference in search engine like ResearchGate, PubMed, and Google. Next. The reason for average and poor quality of life, there are many causes. We all know that mithya ahar vihar, pragna parad, and other things. Imbalanced diet, junk food, social isolation, sedentary lifestyle, disturbed sleep patterns, severe and long-term stress, unemployment, and losing your job also cause the mental health issues. Next slide. The commonly seen illness and diseases like mental health issue like anxiety, depression, stress, and insomnia, and physical health issue like hypertension, MI, obesity, endocrine disease. Prevention and cure, how there are overall what can we do like rasayan therapy, panchkarma therapy, achar rasayan, sadrut palan, ahar vihar, meditation, panchkarma, chankraman, and yoga. Only diet aspect, so pathya and apathya. Pathya should be all type of vegetables, balanced diet which contain millets, pulses, fruits, carbohydrate, minerals, fats, and which should be cooked in less oil. And apathya are like saturated fats and reuse of oil. Avoid excess white sugar and salt and bakery items. Next. On physical activity aspect, it reduces the stress, improve our mood, lifts the self-esteem, and also lower the risk of depression. And also it strengthens our muscles and control the body weight and lungs. Strong immune system, reduce the risk of heart disease, and improve blood pressure and brain function. Next. On yoga and sleep aspect, yoga gives the protection against the cognitive decline, increases the flexibility, strength, and balance, improves sleep and mental well-being, and also they give the relaxation and meditation. So it ultimately result in greater awareness, less stress, and higher well-being and quality of life. Sleep treatment also have a positive impact not only on the sleep outcome but also on mental health and health related quality of life. Improve mood, healthy heart rate, regulated blood sugar, all are the benefits of good sound sleep. Next.
These are the well-being and healthy life chart. The wellness of it's include all criteria: social, physical, spiritual, occasional, emotional, environmental, and intellectual. And conclusion, in Ayurveda, Ahar, Vihar, Yoga, Sadhrut, all by holistic practicing, we can improve our quality of life and enhance people's well-being, happiness through the contentment and emotional stability, which can be acquired by yoga, asana, and sleep. These are all references of articles and samhitas. Thank you, sir.
Thank you, doctor. Thank you for the presentation. Next, I invite Dr. Purnima for the presentation. Dr. Purnima, are you there? Hello, Dr. Purnima, are you there? We can't hear your voice, doctor. Hello, Dr. Purnima, can you hear me? Hello, Dr. Purnima, we can't hear your voice, doctor. Can you hear me? Please unmute, doctor. Your audio is... Please unmute, doctor. We can't hear your voice, doctor. Please reconnect your headset, doctor. We can't hear your voice.
Sir, is it audible now?
Yes, yes, audible, doctor, audible.
Sir, is the screen available?
Yes, doctor, screen is visible, doctor. Please start the session.
Okay, sir, thank you. Greetings to all. Myself, Dr. Purnima, Assistant Professor, Department of Shalyatantra, JSAMC, Mysore, from Karnataka. My topic of presentation is an Ayurvedic approach to a case of second degree burn, a clinical case study. These are the contents of my presentation. Coming to the introduction part, as we all know, burn is defined as an injury to the skin or the organic tissues primarily caused due to heat, radiation, electricity, friction, or contact with any of the chemicals. The incidence and prevalence in India around is 7 million people suffer from burn injuries each year, with 1.4 lakh deaths and 2.4 lakh people suffer with disability. India has one of the highest incidence of burns in the world, where women and children are the victims, about 80%. The degree of burns is always depend upon the extent of burn involving the layers of the skin, either dermis, epidermis, dermis, and the adipose tissue, that is fat. It also matters on the contact of heat with the skin, and the highest most contacted area will present with the zone of coagulation, and the area between healthy and unhealthy tissues with the zone of stasis, and affected and not harmed area with the zone of hyperemia. And the degree of burn is understood depending upon the Wallace rule of 9, and the extent of burn is analyzed, or the fluids intake and the treatment is planned depending upon the percentage of burn. When it is involving head and neck, it is 9%, abdomen and thorax 18%, back 18, and upper limb 18, lower limb 18 each, and the genital area 1 in adult. And in children's, it is head and neck 15, front 20, back 20, and upper limb 20 or lower limb 20. And in infants, the newborns, it is head and neck 20, abdomen and thorax 20, back 20, upper limb is 20, and lower limb is 30. These are the few photos of first degree, second degree, and third degree burns. We have a direct reference of Dagdha Vranas from Sushruta Sutra 12th chapter Agni Karma Vidhi Adhyaya, wherein Acharyas has mentioned Tatra Plushta Dagda Durdagda Ati Dagda Samik Dagdam Chaturvida Agni Dagdam, wherein Plushta Dagda is correlated with the first degree burn, Durdagda with the second degree burn, Samik Dagda with second degree burn, either superficial or deep, depending upon the involvement of Vakmamsa, Siras, Snayu, and Asti. And Ati Dagda, it is third and fourth degree burn, and the Chikitsas as well, and the clinical symptoms are aptly correlated with the first degree, second degree, third and fourth degree burns. And the treatment plan mentioned is Ushna Kriya for first degree burns, Shita Chikitsa for second degree burns, Shita and Ushna Chikitsa. In case of Samyak Dagda, Ati Dagda, it is Pitta Visarpava Chikitsa. And as I told, the degree of burn is always graded depending upon the involvement of layers of skin. That is first degree only when it is involving the epidermis, and second degree involving and some part of dermis, and the third degree involving all the layers of the skin along with adipose tissue and some parts of muscle, and it is divided into superficial and deep third degree burns and fourth degree burns when it is involving the muscles and bone. Now I am going to present a case study of 61-year male carpenter with the history of hypertension and diabetes with the IPA-OP number, came with the multiple blisters in bilateral foot with severe pain and burning sensations since 2 days. A history of present illness. As per the statement of the patient, he was apparently normal 3 days before while working over the roof of the building. Accidentally, he kept his foot over the red hot cold, developed multiple blisters in the plantar aspect of bilateral foot, which is sudden in onset. On next day, he developed severe pain, burning sensation, and serous discharge from the foot, due to which the patient found difficulty in walking, hence approached to the Shalatantra department of our hospital. The history of present illness states medical history of known case of diabetes and hypertension since 10 years, and underwent phacoemulsification for intraocular lens implantation, and the drug history of Lozar H and glycomet GP2 was running, and family history all were said to be healthy. Personal history: diet, mixed diet, sleep 6 to 7 hours, ball 1 time per day, micturition 4 to 5 times by 1 to 2 times at night. Nothing significant like specific habits are not mentioned. Ashtasthana parikshas 90 beats per minute, nadi, murcha 1 time per day, mala 1 time per day, mutra 4 to 5 times per day, jihva lipta, shabda prakrita, sparsha, numbness in the plantar aspect of the bilateral foot, and corneal opacity in the right eye seen. Akriti is madhyama. On general examination, pallor absent, icterus absent, cyanosis absent, colinochia absent, lymphedema not palpable, edema, mild edema in both the foots was seen. Blood pressure was now 130 by 90, respiratory cycle 16 cycles per minute, heart rate 74 beats per minute, and BMI was normal. Coming to the systemic examination, everything was normal. Coming to the local examination in specific, on inspection, plantar aspect of the bilateral foot, the site is plantar aspect of the bilateral foot. Number of blisters was multiple. Number of the wounds were, major wounds were 2 in each foot, and all the 4 digits are involved. Size of the wound 7 into 6 centimeter, 2 into 1 and 2 into 1. Discoloration reddish to black. Serous discharge present. Zones of hyperemia, stasis and coagulation are evidently seen. On palpation, dorsalis artery pulse present. Margins regular margin. Edge undermined. Floor reddish pink. Base fixed. Shape is circular. Mild pitting edema on both the foot seen. These are the investigations and the reports. As you've seen, everything is normal, and the total count was bit raised with the CRP 9.2. The differential diagnosis goes as bullous pigmentosis, bullous diverticons, superficial second degree burns, deep second degree burns, durdagda and atidagda in case of Ayurvedic references. And the diagnosis, what we have done is deep second degree burns. Treatment protocol followed. Total hospital course was 8 days. First day, cleaned and opened all the blisters. Wound debridement done for 5 days for preventing the infection, as he is a diabetic. Topical application of Cutizol for 5 days. Oral antibiotic, antipyretic, antacids were planned. External therapy of wound wash with Panchavalkala Kashaya and application of Shatadauta Krita with Amrita Sattva was done, and wound was closed using Shatadauta Krita. For diabetes control, modern drugs were followed along with Nishamalaki BD and Vasanta Kusmakara Rasa BD, Megha Sawle 15 ml BD with equal quantity of water, and Nitya Virechana was planned. Capsule GH oil 2 with 20 ml of Triphala Kashaya at bedtime. Conditions at the time of discharge, all vitals were stable. Pain and burning sensation, bilateral foot has reduced. Wound was healthy and healing. I will show the pictures. Advice on discharge, all these previous medications along with the injectables as advised by the physician, human actropid and mixture 10 units and 15 units morning and night, and alternate dressings was followed and advised for Patya. The case report, as you see here, this is the first day, and on 7th day, on up to 5 days, we followed Cutizol and Silverex testing. After that, we followed only Shatadauta Krita with Amrita Sattva. On 14th day, this is the status of the wound, and 28th day, this is the status of the wound, and on 41st day, this is the status of the wound, which is completely healed with good control of diabetes. And these are the Patya followed. And the Shashti Upakramas are followed depending upon the yukti of an physician as usual. What I planned is depending upon the presentation of the wound, I planned the treatment. Dagdarvanas are mentioned in Sushruta Samhita in Agni Karma Vidya Adhyaya Sutra Sthana 12th chapter, and the correlation with degree of burns based on etiology, zones of burn, understood through Ayurveda as it is neatly explained the clinical features, and it is correlated with the degrees of burns. And role of diabetes in wound healing and its management is the key of treatment. As I always told, in case of uncontrolled diabetes, the wound worsens day by day, and one day it may be a Shuddha Vrana, and next day it may turn into a Shuddha Vrana. The stages of Shuddha, Ashuddha, Ruhyamana, and Rudha, which is very important to understand the status of the wound. That's why control of the diabetes also plays a very important role. And understanding the Rogi and Rogavastha, the state and stage of the disease, along with Agni, like Amavastha, Samavastha, Niramavastha, and Diptagni Avastha, and the Ruhyamana, Rudha, and Shuddha and Ashuddha Vrana Avastha of the wound. And stage of the wound healing, as I told, it defines the prognosis. And role of treatment modalities, if it is turning into a bad, and we are supposed to go for Rukshana, Deepana, Pachana, Anulomana. If it is Shuddha, we are supposed to go for Brahmana and Snehana. So role of treatment modalities are adopted depending upon the presentation of the wound. And role of Patyapatya is very important, as we are supposed to control the diabetes along with the good management of the wound. So hence role of Patyapatya is very important in managing the wounds. Thank you so much.
Thank you, doctor.
Thank you, doctor,
Thank you.
for this delivered presentation. So next I invite Dr. Harida Das.
Hello, Dr. Harida. Hello, Dr. Harida. Can you hear me? Hello, Dr. Harida. Can you please unmute, doctor? Hello, Dr. Harida. Can you hear me, doctor? Okay, next I invite Dr. Manju Yadav for the paper presentation. Dr. Manju Yadav, are you there?
Yes, sir. Sir,
Okay.
please share my slide screen.
Okay, sure, doctor, sure. Just a moment, doctor. Please start the session, Dr. Manju.
Yes. Good evening, all. Myself, Dr. Manju Yadav, Department of Prasuti Tantra and Istri Roga from Dr. NRS Government Ayurvedic College, PG third year. My topic of presentation is concept of Garbhadhana. Garbhadhana is made up of two words. Garbha means womb, Adhan means process of receiving. It literally means receiving of pregnancy. Growth and development of a healthy progeny depends upon the physiological and psychological adoption in a woman's life. Pregnancy stimulates every tissue and organ to function at a higher intensity. Next slide. Role of Sodhana in pre-conception care. अथा प्यतो स्त्री पुंसो स्नेह स्वेदाभ्याउपात्य उभमन विरेचनाभ्याम संशोध्य क्रमेण प्रकृतिम आपतयेत संशोधो च स्थापन अनुवासन अभ्याम उपचारेत मधुर औषध संस्कृताभ्याम घृत क्षीराभ्याम पुरुषम स्त्रियम तु तेल मांसाभ्याम संजात हर्षो मैथुने च अनुकूल विशिष्ट गंधम स्वास्थ्यम सुखम शैलम उपकल्पम मनोक्यम हितम शनन शित्वा न अत्यशीतो दक्षिणापदेन उमान रोहित वाम पादेन स्त्री चरकाचार्य शारीरिक स्थान mentioned. Next slide. Humans should say mantra and start the following karma. The couple has to undergo sneha sweda shodhana. After restoring to natural state, asthapan and anvashan vasti is given. The male is given madhura drug processed with milk, and the female is given tilamansh. The couple should be passionate and have Failing of carnal relationship. Avoid overeating but consume beneficial food. Go to comfortable bed. Spread with a soft mattress. Sprinkled with pleasant fragrant perfume. The male should step with the right foot forward and the female should step with her left foot forward and to bed. After quarters, they should irrigate with cold water. Next. Garbhadhan with the use of Garbhasthapan, just like in the Brahmi, Satvirya, Sahasvirya, and Punsva and Karma. Garbhadhana Purva Sanskara, Prakriti Pariksha, Rajaswala Paricharya in female, Sodhana in couple, Sharir Shuddhi, Ahar Shuddhi, Vihar Shuddhi, Nadi Shuddhi, Pranayama and Yogic Kriya. Next. Age of conception. Acharya Shushu says, Panchvinshati Varshaya, Shodas Dash Varsha Patni Mahavet. The eligible age of marriage for a male is 25 and female is 16. Acharya Bhel says, is Saman Gotra Base Rutusnata Striyam Prachit. Medhadi Namrogasa Putramem Prasuyate. Bhela clearly mentioned that the woman should be of different Gotra, only then an intelligent and healthy son is born. Next. Time of conception. Garbhadhan Sanskar is the 14 and 16 lunar days after menstruation. Besides these lunar days, the 6th, 8th, 10th, 12th and 14 days are favorable for Garbhadhan. Nakshatra, Uttar Phalguni, Uttar Bhadrapada, Rohini, Mrikshira, Anuradha, Hasta, Swati, Shaman, Dhanishta, Nakshatra are very auspicious. Next. Acharya Sharirasthan Vagbhat says, female should be 12 years old. She must belong to a different gotra. She must be same community. No history of hereditary disease. Endowed with beauty, chastity, auspicious qualities. All organ like teeth, lip, ear, nails, hair, breast, which are not be destructed and diseased. She must be gentle, soft, healthy, neither too fair nor too dark, neither be deficient nor have extra organ or body parts. Her name should be other than that of gods, serpents, river, so mountain, tree, birds, nakshatra, lokas, and slabs, and not be harsh. She must be sinless, of good character and reputation in society. Bhel and Bhagavata strictly advised the girl should be belong to the same community but of different gotra. It is very clear that consanguineous marriage were discouraged even that era. Next. There is 4 factors for responsible for Garbha Samagri. Sushruta Chakrapani commentary, Ritu Chetrambu Bijanam and Ashtang Hriday says, Shuddha Garbhashe Marge Rakta Shukra Anile Hriday. A healthy uterus, vagina or fallopian tube, ovum, sperm and apan vayu and hridaya, all in healthy state produces a healthy offspring. Next. Pura Sanyog Vidhi. Sodhana, it is 2 types, internal purification and external purification. External purification, Snehan followed by Svedana, and then undergo purification method like Vaman, Virechan and Vasti. Internal purification, Somanasya Garbha Karanam. Maintenance of Somanasya, just avoid the emotions like Krodha, Shoka, Bhaya, Dvesha, Dev and Brahman Pujan, hearing soft enthusiastic stories. Next. Method of conception. From the day of onset of menstruation, female should follow brahmacharya for 3 days, and 4th day she should take a bath with washing her head and also wear white garment. Then enter the place of God and should offer oblation with rice and ghee. To get male child, even days of Ritukala should be selected. For female child, odd days of Ritukala should be selected. Ahar and Vihar. Male should have food contain ghee and milk. In Charak Samhita mentioned Pitta Nilahar Sukh Ojasahitam. With these property, ghee increases the quality of shukra. All these having madhura rasa and shita vipati, which promote the production of shukra dhatu. Females should consume the food containing of tal and mash. Tal and mash are ushna virya, which increases the quality and quantity of artava. Next. Behavior, softness and kalyan kamna. She should remain of peaceful mind and positive thoughts. A relative and husband have tender behavior with her. Anyun and avikamta. Ritu Kala Riturangaya Rasasam Om are considered as period of ovulation. Ritu snata bhavati dushthartava adushthartava apeseke bhashante. After Artho Darshan, Ritu Kala is 12 days. Next. This Kala is considered after time for conception. 30 days or 1 month is required for completion of Ritu Chakra. It is divided in 3 phases. Rajasrav Kal, 3 to 5 days. Ritu
Hello,
Kal, 12
doctor.
or 16. Yes, ma'am.
Doctor, please speed up.
Yes, ma'am. Ritu Vyatit Kal, 9 to 13 days. It's appropriate period for Bijotsarga and also for Garbhadan. Next. Its clinical importance considered proliferative or peri-ovulatory period. By the end of peri-ovulatory phase, the mature follicle will develop and rupture, excrete the oocyte with some granular cell into oviduct. The oocyte is now combined under fertilization. Next, Kshetra Garbhashaya. Shukra enter into the female like a seed, hence it is called Kshetra. Kshetra indicates Garbhashaya. Garbhashaya is Kukshi. It is eligible for the Ashay, which is present especially in female. Next. Garbhashaya represents the interior of uterus, that is endometrium, with its digital changes which provide good nidus for implantation of blastocysts, supply nutrition to early growing zygote, but by it rich source of glycogen and fat. Reception ready phase of endometrium of the uterus is usually termed by implantation window. The implantation window follows around 6 days after the peak in luteinizing hormone level 20 to 23rd day after the last menstrual period. Ambu, next. Ambu punar ahar pakso vyapi rasdhatu. Ambu is the rasdhatu derived the end product of food digestion with reference to implanted zygote. Next. Nourishment of the fetus is described in 2 parts. First, when the fetal body parts are not percepted, gets nourished by upasneha and upsveda. Second, when the fetal body parts become observable, it's nutrition by permeation through the loam pupa of the body of Napi Nadi. The fetal Napi is attached to umbilical cord, and umbilical cord of the upper. The nutrition provides bala varna to the fetus is contained essential factors. Next.
Hello, doctor. You are exceeding the time limit.
Yes. Bija iti suprashonite. Bija means gametes, and Stri Bija is a Bhagavad explain the essential factor of concept in it. Stri Bija is Artava, and Purush Bija, Shukra is a vital for formation of Garbha. Harsh by Garbhotpalin Shukra. Thank you, ma'am.
Thank you, doctor. Thank you for the presentation.
So next I invite Dr. Steffi Joseph. I invite Dr. Steffi Joseph.
Dr. Steffi, are you there?
Hello.
Hello.
Can you hear me?
Yes, doctor, you're audible.
Okay.
Please share the screen, doctor.
Okay. Is it visible?
Yes, doctor, your screen is visible, doctor. Please start the session, doctor.
Good evening all. Today my topic of presentation is Ayurveda Seminar. Myself, Steffi Joseph, first year PG scholar, Department of Kayachikitsa, PNM Ayurveda Medical College, Gridhrasi, Kerala. These are my contents. Introduction. According to Acharya Charaka, while treating a disease, success can be achieved only when there is a proper combination of Desha, Kala, Pramana, Satmya, Satmya, Patya, and Apatya. Among these 7 important factors, Kala acquires second position, which reflects the importance of Kala in Chikitsa. Success in Chikitsa depends upon Pada Chatushtaya, Bishak Dravyani Vastada, Rogi Pada Chatushtaya. Here also, Dravya plays the second position. Success, according to Ashtanga Hridaya, Aushadha is said to be the best which doesn't aggravate a disease with suppressing the disease for which it is used. Aushadha is a synonym of Aushadha. Excuse me. Aushadha is a synonym of also known as said as a synonym of Chikitsa. According to Tarka Sangha, tells that everything is dependent on Kala. The same statement can be extended in the context of Vaishija Kala too. Kala is a nimitta karana of all types of karya. Hence, Aushadha given in proper Kala will result in expected karya. Proper administration of Aushadha is known as Aushadha Sevana. It is Aushadha Sevana Sesami. According to Ashtanga Sangraha, Kalo Vaishija Yoga. In different Samhitas, classifications are mentioned. According to Charaka, Susruta, and Ashtanga, there are 10 number of Aushadha Sevana Kala is mentioned. According to Sharanga, there are 5, and Ashtanga Sangraha mentions 11. The first one is Niranna Abhakta. According to Chakrapani, Pradhareva Niranna, Pragvachanam, and according to Susruta, Annahina Avastha is known as Niranna Kala, administration of medicine. According to Hindu, medicine given in one yama after sunrise is known as Niranna Kala. According to Hemadri, Kapha Udreka Gata Kala is known as Niranna Kala for administration of medicine. According to Gadara, Prabhada is known as Niranna Kala. The contraindications include Bala, Vriddha, Vamita, Sukumara, Stri, those who are thirsty, hungry, consumed cold water, Abhipaka, etc. According to Susruta, in these persons causes tiredness and weakness. Ashtanga Sangraha mentions thirsty, hungry, etc. should not take medicine at this time. The indications include Roga, Prabala, Vyadi in Balavan Purusha, and Dosha in Spyanavada. Example, Thaila or Vriddha Sevana. The mode of action is, Susruta says that Annahina Avastha, Viryadike of Aushadha will be no more and cures quickly the disease. Direct Agni-Veshada interaction occurs in this kala. Chronic pharmacologically, gastrointestinal mucosa are more absorptive in early morning. The next one is the Pragbhakta or Bhaktado. The medicine just before food is known as Pragbhakta. According to Susruta, Aushadhi undergoes Shikra Vibhaga. According to Ashtanga Sangraha, it strengthens the other kaya. According to Kashyapa, Amashekada dosha nirdharana occurs at this kala when medicine is administered. According to Sharanga, there are subdivision of Divisa Bodhana Kala is known as Pragbhakta. Indications include dosha, abana vikriti, and bala, vriddha, biru, krishangi can be given in this time. The mode of action includes medicine gets avrita by anna and extraction of drug is prevented. The medicine will get digested without affecting the strength of the person. Just before food, abana vaya is in active state. So, in abana vaya vikriti conditions, these medicines can be administered at this kala. Next one is the Madhya Bhakta. According to Chakrapani, first half of the food is consumed, then medicine is taken, the rest of the food is then consumed. According to Susruta, Avisari Bhava of Aushadha will be there, and Madhya Bhakta, Deha Roga in this kala can be administered. According to Kashyapa, Avarodha of Aushadha by food occurs, and Andarashya Roga can be given in this Madhya Bhakta kala. According to Sharagadara, under Divasa Bhojana subdivision, Madhyavakta Kala is included. The indications include Samanavada Vikriti, Agni Dipana in Mantakni Purusha. The mode of action include between meals, Samanavada and Pajakavikta is in active state. Example, Pinguajadi Chukra. Next one is the Pashchat Bhakta. Aushadhi administered after the food. According to Chakrapani, Pradhara Bhojanottara Kala and Sayam Bhojanottara Kala, 2 divisions are there. According to Susruta, it gives Bala. According to Ashtanga Sangraha, Kapha Prashamana and Suligarna occurs at this kala. According to Sharagadara, Bhojanade under Divisa Bhojana and Sayam Bhojana under Kala under Sayam Bhojana for Pranavada Drushti. Indications include Dosha, Vyanavada, Pradhara Bhojanottaram, and Udanavada, Sayam Bhojanottara. Rogas include Urakanda Shirogata Vyadi. The mode of action include after lunch, stimulation of Vyanavada occurs, and after dinner, stimulation of Udanavada occurs. Udanavada facilitates strengthening of the upper part of the body. Example, Masha Thaila. Next one is the Andhara Bhakta. The medicine given in between 2 Ahara Kala. According to Ashtanga Sangraha, after digestion of food, medicine is given
After complete digestion of Aushadha, next meal is given. According to Jejata, mentions under Madhya Bhakta. According to Hindu, first Andhara Bhakta is during day and next is 1 yama after evening food. 1 yama after evening food will be equivalent to Nishi. Indications include Dosha, Vyanavada Dushti, Hridya, Deepana, Manavalagara. The mode of action include Madhyana here, Pittakala. So Agni will be in the simulated state and Vaishya get properly metabolized. Next one is the Sabhakta, administering medicine mixed with food. According to Hindu, Vaishya is processed or cooked along with food or given with food. According to Kashyapa, Bala and Agni Rakshaka, when medicine given in this kala. According to Sharangadhara, Mishra and Divasa Bhojana is included. Indications include Ariji, Kshatakshina, Shishu, Stri, Vriddha. The mode of action include Vaishya gets circulated with rasa all over the body. Next one is the Samurka, medicine given before and after food. According to Sharangadhara, mentions as Purvam Ande under Divasa Bhojana. Ashtanga Sangraha and Charaga mentions that medicine to be given with Lagu Ahara and less quantity. The indications include Kamba, Aksheba, Hikka, Dvita Pravistrata Dosha. The mode of action include Gadi Vikruti of Vada Dosha by promoting Anlomana of Vada Dosha. It promotes Urdu and Adogadi of drug. Next one is the Muhurmu. Charaga and Sharangadhara mentions that medicine administered frequently during Bhojana or with or without food is in this kala. According to Shuddha, intake of Aushadha frequently is mentioned. In the indications include Hikka, Shwasa, Kasa, Chardi, Trishna, Vishnu. Example include Talisa Patradi Shula. The mode of action include Agni in Mandavastha in these dogas given in Alpamatra enhance Agni. Vegavastha can be succeeded and recurrence can be prevented when medicine given in this skala. Advised in emergency condition for effective control of the life-threatening condition. Next one is a grasa or sagrasa. The medicine given with each balls of the food. Indications include dosha, prana vayadushti, udana vayadushti, Agni Devana, Vajidana. Roga simply Kshina and Alpashukra, Swarabanga, Gala Roga. Example, Churna, Avaleha Vadi, Hingoshtakachurna. The mode of action include Annapravesha Karma function of prana vayu drug with each balls of food easily cure disease. Grasandhara, medicine taken between each balls of the food. Arunadatta mentions that between balls of the food. According to Hemadri, with balls of the food is mentioned. According to Sharangadhara, mentions under Sayam Bhojanatagaya. Indications include dosha, pranavada dushti type of drug, leha churna, rogas include hidroga, surabanga, vamaniya dhumpana, dhyanavada dushti. The mode of action include correct gadi vikruti of vada dosha by promoting anilomana. And next one is the Nishi, administering Aushadha at Sopna Kala. Sharangadhara mentions that medicine takes 1 yama after.
Hello, doctor.
Yes, ma'am. Yeah.
Doctor, you are exceeding the time limit.
Yeah, I've finished. And 1 yama after evening meals. The indications include dosha, kapha, disease, urda jatrudvigaras, purpose is legana brahmana. Mode of action include kala prabhava facilitate action of drug. Decision include Shuddha did not mention the Ausha Sevanakala as per the Vada Dushti. Vaishyajakala is described in relation to food. We can conclude that only Shamarachikitsa are mentioned by all acharyas in relation to food. Hence, to utilize the Aushadha to its optimal level, medicine administration methods with its specific direction action at a specific time is mentioned. These are my references. Thank you.
Thank you, Dr. Steffi Joseph.
Next, I would like to invite Dr. Harida Das.
Yes, am I audible, ma'am?
Yes, doctor. Audible, doctor.
Doctor.
So my screen is visible.
Doctor, I will share for you, doctor. Please start the session, doctor.
Okay. So I'm Dr. Harida Das. The topic is role of chanting Om Mantra in stress management, a literature review. These are the contents. Introduction. According to WHO, stress can be defined as a state of worry or mental tension caused by a difficult situation. Everyone experiences stress to some degree. Within reasonable bounds, people are able to cope with these demands, adjust to the circumstances, and heal once the crisis passes. Nowadays, stress becomes a common problem in day-to-day life. Prolonged stress can either be a triggering or aggravating factor for many diseases and pathological conditions. Coming into the prevalence, 36.5% is a prevalence rate for the stress and 24.1% for the post-traumatic stress symptoms. The act of chanting Om is a type of meditation in which the sound Om is repeated in a rhythmic pattern. So various cultures have been using these techniques for centuries to promote spiritual and mental well-being. In modern day lifestyle, human beings are vulnerable to a variety of psychological and physiological conditions that result in pressure or stress. So, Om chanting will become a helpful tool to relieve stress by altering the neurological physiology of emotions. So, this study examines the impact of Om chanting on the work stress management by conducting a thorough analysis of the relevant literature. And the aim of the study is to understand the concept of chanting Om mantra and its application in stress management. Objectives is to emphasize the role of chanting Om mantra in relieving stress and to highlight the attributes of the mantra chanting. These are the reviewed manuscripts. I used Yoga Sutras, academic journals, and databases like PubMed. And references of Om in ancient text. This reference is taken from the Mandukya Upanishad. The slogan goes like Hari Om, Om Ityat Tatakaramidam, Sarvatasyobam Vyakyan Bhutaha, Bhavat Bhavi Yat Iti, Sarvam Omkaram Eva, Yachanyat Trikala Teda, Tat Abhi Omkaram Eva. So all that is past, present, and future is verily Om, that which is beyond the triple conception of time. And coming to the Om, according to Patanjali Yoga Sutra, Yatasya Vachakaha Pranavaha. This literally means that Pranava is virtually Ishvara or Om, where Ishvara is a word denoting Om. And Patanjali also tells that through repetition and reflection of Om, its meaning become clear. So from this repetition, knowledge of inner self is developed and obstacles are eliminated. And coming to the stress stimulates or the hypothalamus pituitary axis, and the hypothalamus signals pituitary to produce adrenotropic hormone, which in turn signals the adrenal glands to increase the production of cortisol. So prolonged increase in cortisol can cause metabolic disorders, depression, and immune disorders. An effect of chanting Om mantra. Chanting Om and brain waves. The brain produces electrical impulses known as brain waves, which can be measured by EEG. Studies have demonstrated that Om chanting can alter brainwave activity, especially in the theta and alpha ranges. So here alpha and theta waves were significantly higher in participants who chanted Om in one study than in the control group. So these findings imply that deep relaxation and meditation can be induced by Om chanting. And chanting Om mantra and parasympathetic system. So when we chant this Om mantra, because of the vibratory sensation around vocal cords and the ear, this will transmit through the laryngeal and auricular branches of the vagus nerve. It will stimulate the vagal centers, causing limbic deactivation and ANS modulation towards parasympathetic dominance. It could alter the neurotransmitters and electric signals, modulating the activity of the autonomic centers in the brain associated with the classical 3F, freeze, flight, or fight response in favor of rest and digest. On neural connectivity, the term neural connectivity describes the connection between neurons where neurons send information via neurotransmitter. The Om chanting has been demonstrated in studies to improve the neural connectivity in a few specific brain regions, including the default mode network and the prefrontal cortex. In one study compared to a control group, participants who chanted Om showed a significant increase in the neural connectivity in the prefrontal cortex and default mode network. Om chanting on the blood pressure. Om chanting has greater benefit in systolic hypertension, which could be seen in subjects with higher sympathetic activity. This is lowered by the cortico-hypothalamo-medullary inhibition and parasympathetic dominance. In a study conducted, the immediate effect of 5 minutes of Om chanting in uncomplicated moderate hypertension showed statistically high significant reduction in systolic BP and just significant reduction in diastolic BP. In methodology, Om can be chanted slowly or quickly depending on the person's capacity. It can be made to last for several seconds after being chanted slowly, and each of these 3 syllables should be pronounced clearly with a gentle transition between them. And chanting aloud is the better option. The mind must be fixed on the spoken Om sound, free of all distractions and focused on a single idea. Methods of practicing Om chanting. Sit in a comfortable meditative posture. Close the eyes. Do inhalation and exhalation for 3 rounds. Inhale deeply and while exhalation, start chanting with the word Ah. Continue the stretch by bringing the lips together to say the next syllable. And finally, press the lips and front teeth gently together, bringing the vibration of the with the syllable word. Be aware completely of the sound of Om. Continue in this manner for as long as possible, at least 15 minutes. Slowly stop the practice and synchronize it with the mental sound of Om. Be aware of the internal sound of Om at the eyebrow center, vibrating in harmony with the pulse. And any meditative posture we can practice, and time and duration 15 to 30 minutes. Perfect time for practice are 108 times. Coming to the discussion, whenever there is some stressor, real or imagine, it activates ANS, stimulates HP axis by releasing corticotrophin releasing hormone and secrete adrenaline vasopressin. So chanting Om activate the cingulate cortex, dorsolateral, prefrontal and parietal cortices as well as hippocampus and temporal lobes, which are involved in the relaxation response. It also regulates the HP axis to balance ANS and reduce cortisol secretion, which in turn reduce stress. Coming to the conclusion, systematic review of literature shows that regular chanting of Om mantra has a positive impact on the stress management. Om chanting is a simple and accessible practice that can be easily incorporated in our daily life. With the practice of Om mantra chanting, one can achieve a state of mental peace. Further research is required to investigate the long-term effects of Om chanting on mental health and to comprehend the mechanism underlying Om chanting. These are the references. Thank you.
Thank you, Doctor. So next I invite Dr. Kausalya Anil Kumar Sahani.
Hello, Dr. Kausalya.
Hello, sir.
Yes, doctor.
I'm audible, sir.
You are audible, doctor. Please start the session.
थांब ना त्याला शेअर तर करू दे माझं नाव घेतील ते शेअर करेन तू कशा
Hello.
Hello.
So please share the slides.
Sure, doctor. Just a moment. I will share for you. Please start the session, doctor.
Yes, sir. Myself, Dr. Kaushalya Sahani. My topic is Ayurveda, purpose of sanskara and its importance. Next. Introduction. Sanskaro hi gudantar dhanu. Any process which brings continuous positive change in the body is known as sanskar. It is changes in the mind, sharir, man and atma is known as sanskar. Different types of sanskara stated by the Gautam, Grahya Sutra it is 40 and Maharshi Angira it is 25 and Dayanand Saraswati it is 16. 16 it is acceptable. Next. What is the purpose of sanskara? There is the two purpose, cultural and the spiritual. Cultural purpose is the variety of the rites and rituals related to the sanskara, which is help the variety sanskara. A person formed by the undergoing the sanskara, Hindu sages realize to need the concluding, guiding and molding the character of individual instead of letting grow the haphazard manner. Spiritual method. Spiritual help the impurity which is present in the material body are eradicated by the Shuddha. There are the following example like Upanayan Sanskara. There is a help in the twice born. Second is the realizing the Brahman which become Brahmin. The sanskara are in the form of the Shodhan. That's why it is spiritually important. Next. There are the 16 sanskaras. They are shown in the pictures. And they are divided according to the ages. Garbhastha Jivan. There are the 3 sanskaras. Garbhadan, Simottanayan and Punshavan. And Balyakal, it is Niskraman, Namkaran, Jat Karma, Annaprashan, Chuda Karma, Karnaved, Upanayan and Vedarambha. And at the Yuva and Vridha Avastha, it is Samyavartan, Vivaha, Vanya and Sanya Avastha and Anteshti Karma. Next. Following are given. First sanskar is the Garbhadan sanskar, which is mean of the before the conception. And according to Hindu parampara, it is divided into the 3 parts. There are the 4 sanskaras which are performed before the birth of the child, and 11 sanskara which is performed after the birth, and 1 sanskar after the death. The first one is the Garbhadan sanskar. Garbhadhan Sanskar, it is aimed to sanskara get high quality of progeny. It should be performed only after the marriage, and both parents should be completely Virvan and should be purified. Their body undergo the procedure. There is the female should be 16 years and male should be 25 years above. Significance of the Garbhadhan Sanskar. Next. It's okay. Second. Next. Punsuvan Sanskar. Punsuvan Sanskar is the physically and mentally development of the baby in the womb of the mother. Sanskar is performed chanting of the Vedic mantras. Due to the Sanskara, child born with the healthy and intelligent. The significance of this Sanskara is the involve the celestial and excellent quality of the child, and this strengthen the relation of the husband and wife and bond them together to common desire of the male offspring. Third, next. Third is the Simuttan Sanskar. This is performed into the 4th, 6th, and 8th month of the conceiving baby, as has been physical and mentally development of the baby in the mother womb. These are conducted by the diet regimen, which is followed by the mother in the baby, and the baby emulate the mother in letter and spirit. It is the way rituals of the mother being alert in her the achar and vichar shravan. Significance of this Simitton and Sanskar is the religious significance is bring prosperity to the mother and long life to the unborn child. Next. Fourth Sanskar is the Jat Karma Sanskar. After the birth, this Sanskar is performed. And this Sanskar, according to the various acharyas, it is different types should be stated. After, according to Gridhrasi Sutra, it is performed before cutting the umbilical cord, and according to Charak, it is stated after the cutting the umbilical cord. Jat Karma Sanskar should be performed on the first day of the birth, and child should be given first feeding of the honey and gruth. And Acharya Shushrut said on the first day performing the Nabhi Nala Chedan, the gruth and the honey mixed with the Ananta powder and minute qualities should be stated. And the second and third gruth indicated with the Lakshman, and fourth honey and gruth should be amount of the first palm of the neurone. According to Vagbhat, Jat Karma should be performed by the Prajapatya method. Next. Significance of Jat Karma. First, feed initiate gastrointestinal movement, activate the guts. Honey has the antimicrobial property. Use of the gold increases the intellect and digestive metallic power, strengthen the ayush, increases the complexion. By this ceremony, we should examine the baby and rule out the anomaly. Sorry. Next. Namkaran Sanskar. Namkaran Sanskar, rituals of Namkaran performed on the 11th day of the birth of the baby, according to the Brahmin. Charak has given the detailed description of the Namkaran Sanskar. It is performed on the 10th day, wearing mother and child should be take bath, water, purified drugs, and wear clothes. And this should be processed by chanting the mantra. The Namkaran Sanskar should be done. And the Charak detailed description is given. The first begin with the word with the Ghosha, and middle word will be Antastha, and the end word will be Ushma. And it is according to Shushrut and Vagbhat, this ceremony should be performed on the 10th day after the birth. And Ashtang Sangra state that this ceremony have to perform 10th and 12th day. 101 year. Next. Significance of Namkaran Sanskar. Name provide the identification as well as social and personal recognition. Baby regains the birth weight on the 10th day, and umbilical cord falls normally 5th to 10th day. Maybe longer. Next. Nishkraman, outing ceremony, Upaveshan, sitting ceremony. Nishkraman means go out, and the 4th month of the birth, child should be taken out from the home and should be darshanam of Panch Mahabhuta. This sanskar is performed when the child taking outside the home. According to Kashyap and Ashtang Sangra, it is the in 4th month. Baby who having giving the bath and adorn, wearing new clothes and possessing mustard, honey and grita, Gorochar along with Dhatri should be taken house and ready to enter the temple. Upaveshan sanskar is the sitting ceremony. According to Kashyap, it should be done on the 6th month. Significance of sanskar: by the 4th month of the child, holding, turn his head toward the sound. By exposed the sunlight, there is a synthesis of vitamin D accelerate. By seeing moon and sun, there is a macular fixation and pupillary adjustment. That's why these both are important. Next. As per the development of milestone, there is a 5th, 6 month child should be sit with the support, tries to hold the things put in the mouth. It is give opportunity to initiation of sitting and the physical and neurological, psychological growth of child. Next. 7th is the Phalaprashana and Annaprashan Sanskar. The 7th month of from the yes, ma'am.
Doctor, please speed up.
7th sanskar according to Kashyap, it is a Phalaprashan. Juice of the fruit should be and the anna should be given at the 6th month. Next. Significance of it, immunity booster, give the multivitamins and vitamin C which is deficient breast milk in mother cow and other. It provides essential nutrition adequate quantity which is deficient in the mother milk. Next. Chuda karma and mundan sanskar, shaving of the head. This is done in the 1, 3 and 5 years from the birth. And mundan sanskar has the intellect child develop and insect of pregnancy time are destroyed. These are in Kashyap, according to Griha Sutra Manusmriti, Chuda Karma Sanskar should be performed at the end of 1st year before expiry of 3rd year. There is a chapter named Chuda Karma in Kashyap Samhita, but there is no reference available regarding the Chuda Karma. Next. Karnavedan. Karnavedan is ear piercing. Ear pierce child at the help of the gold needle and convenience. And there is, it should be performed in 6 and 7 months. According to Walkbhat, it is performed in 6, 7 and 8 months. Ear pierce first in case of male right and in the female left. Next. Upnayan Sanskar, there is care thread ceremony. Is thread is tied according Yagnopavi, and according to Manusmriti, this ceremony carried out 5th, 6th, and 8th year of Brahmin, Kshatriya, and Vaishya respectively. Significance of Upnayan Sanskar, thread around the wrist assess the physical growth, rule out the malnutrition. It initiates the sense of responsibility toward the society. Next. Vedarambhana, beginning of the Vedic study through this sanskara. When there is formal education at the time of pujan, there is education of beginning of education is known as Vedarambha. Significance, this provide religious cult, humanity, self-control, accessibility for the society. Next. Keshani Sanskar, end of the studentship during the brahmacharyas prior starting education. Head is kept clean, shave, keshanta. Kesh mean hair, anta means end. Therefore, the brahmacharya, because of the brahmacharya, Kamadev is residing at the kesh. Therefore, the end of studentship, the Keshani Sanskar should be done. Next. Samvartan Sanskar, the Sanskar is performed upon the return of the child completing after his education. Next. Vivaha Sanskar. Vivaha Sanskar is known as, according to Manusmriti, Vivaha is the attend the Dharma, Artha, Kama and Moksha. That's why this is important. Vivaha Sanskar. Next. Next. Sannyas Vanaprastha Sanskar. Vana means foreign land and distance, and Prastha means going to the journey to the. That's why it's known as Vanaprastha Sanskar. Vanaprastha Sanskar.
Please speed up.
Next, 16. Next. Antesti Sanskar, it is that ceremony. After leaving human body, this Sanskar should be performed. Next. Next. Thank you. Benefit of Hindu Sanskara. References, these are all references. Thank you.
Thank you, doctor. Thank you for the presentation.
Thank you, doctor. So next I invite Dr. Aishwarya Ashok Surdas.
Hello.
Hello, Dr. Aishwarya.
Yes, doctor, you are audible.
Yes. Can you share the screen for me?
Just a moment, doctor. Please start the session, doctor.
Thank you, sir. I'm Dr. Aishwarya Surdas from Siddhakala Ayurved Mahavidyalay, Sangamner. My topic is to study the efficacy of Yavadi Lep as Daha and Vedna Shamak in postoperative fissure and nano cases. It's a single case study. Next slide, sir. Introduction. Fissure in ano is the second most common diseases in anorectal disorders. Because of its anatomical condition, posterior wall of anorectal junction is poorly supported by muscular on this aspect. Posterior rectal wall forms an angle with a posterior anal canal. Fissure covers overly stretching of the epithelial lining of the anal canal by pressing a hard fecal matter, which commonly present at 12 o'clock and 6 o'clock respectively, and do not crosses the dented loin. Modern surgical techniques like manual dilation was advocated at that, but permanently weakens the internal sphincter in association. Surgery suppresses the immune system, and inevitably all the patients who undergo the surgical procedure experience an acute postoperative pain. Poorly managed postoperative pain can lead to complications like prolonged rehabilitation. Pain management after anorectal surgeries become important as it could hamper day-to-day activities, disturb sleep and appetite, and bowel evacuation, adversely affect the effective quality of life of a patient. So next slide, please. In such situation, a drug which produces a soothing effect like Vata Pittahar, Vedna Sthapak, Daha Prashaman, Vedna Shodhan, Vrana Shodhan, Vrana Ropan, and influences reduction in inflammation, which is more suitable for the drug, which may act as best healer and ulcers on the other parts of the body. Yavadi Lep probably have these properties. So next slide, please. Thank you. Case report. A 55-year-old female patient with the complaints of severe pain and burning sensation at anal region. Pain increases defecation, PR bleeding on and off, and hard stool. Patient has above complaint. So next slide, please. Past history. Patient has a history of fissure in ano since last 3 months. Patient from last 1 month, she is suffering from above symptoms like pain and burning sensation at anal region and PR bleeding on and off, hard stool. So she came to Siddhakala Ayurved Mahavidyalaya for treatment. The next slide, please. Material used. These materials are used just as yava, madhu, tila, and sarpa. Yava, which has a ras of madhur, tikta, and kashay, and madhu, which is madhur and kashay. Til, which is madhur, kashay, and sarpa, which is madhur. Yava, which karma is rakta pittahar, and madhu, which is lekhan, ropan, and shodhan, and til, which is vranahar, krimigna, and vranakar, and sarpa, which is agnidipan, balya, and rasa. These are effective materials. Sir, next slide, please. Method. Patient will be followed for 5 days post-operatively. Yavadi Lep will be administered in BD. 3 days antibiotics, then seeds bath twice a day, syrup Crimafin plus 15 ml HS. Oral tablets like Enzoflam to release pain, and IV injectable. If there is more pain, we can use analgesic like injection Dynapur. So next slide, please. Method. This is observation. This is our observation based on which we can manage the patient. VSR, which is verbal scale and non-verbal scale. On observation, we use no pain, bearable pain relief, which is from hot seeds bath, and more severe, which needs analgesic. It needs verbal scales like 0 to 1, 0, 1 to 3, 4 to 6, and 7 to 10, which grades 0, 1 to 3. And Daha according to no burning sensation present but which is bearable, burning sensation present but relieved with hot seeds bath, and severe burning sensation needs local analgesic, which grades as 0, 1 to 3 respectively. So next slide, please. On this observation, we made like VSR, verbal scale and non-numerical scale, Vedna and Daha. On first day we had 0 grades. Second day we had 0 grades, but on third day we had 1. Third day, fourth day, and fifth day we had 1, 2, 3 respectively. As Daha, as it is helpful in Daha and Vedna Shamak. So next slide, please. Result: after 5 days continuous use of Yavadi lep, patient got relief from pain and burning sensation in post-operative management. So next slide, please. Conclusion: as this Yavadi lep is effective in post-operative fissure and ano cases. Thank you. Thank you, sir.
Thank you, doctor. Thank you for the presentation.
Thank you.
Next, I invite Dr. Sushil Rohidas Ranjane for the paper presentation. Dr. Sushil Rohidas Ranjane, are you there? Dr. Sushil Rohidas Ranjane, are you there? Next, I invite Dr. Amarda Suryakant Bakare for the paper presentation.
Good evening, everyone. Myself, Dr. Amruta Suryakant Bhakre, second year PG, Stree Rog Prasutantra Department, Yashwant Ayurved, Kodoli. Today, I am going to present the topic Role of Yoni Dhavan in Yonigat Rog. The diseases of genital tract of women and their treatment have been given a lot of importance in the ancient period. There are so many Kayachikitsa explained in Ayurveda for Stree Rog. These procedures basically deals with Travarta Yoni. Some of these local therapies shows amazing result in the management of Stree Rog. Different Kayachikitsas are explained by Acharya which are useful in Stree Roga. Yoni Dhavan is one of them. Cleaning of vagina with decoction or medicated oil to relieve the symptoms of vaginal itching, vaginal discharge, etc. Aim of the study is to highlight the uses of Yoni Dhavan in the management of Yonigat Roga. Resources: Bruhatrai, Lagutrai, Nighantu, articles. What is Yoni Dhavan? Yoni Dhavati Shuddhyati iti Dhavanam. Dhavan is to clean the wound and Yoni Dhavan means cleaning of vagina with decoction. Indications for Yoni Dhavan is Yoni Strava, Yoni Kandu, Yoni Shula, Yoni Daurgandhya, Yoni Shaithilya, Yoni Paichilya and Shvetapradar. Contraindications for Yoni Dhavan is a condition of pregnancy, unmarried women, postnatal period up to 6 weeks, patient suffering from cervicitis and a known case of invasive carcinoma. All above conditions are contraindicated for Yoni Dhavana. Case study: a 40 years old female patient, housewife by occupation, visited the OPD of SRPT department, Yashwant Ayurvedic Hospital, Kodoli, Kolhapur on 10th September 2023 with the complaints of curdy white discharge per vaginum with foul smelling, intense itching over vulval region since past 4 months, and burning micturition since 1 month. The patient was normal before 4 months. After that, she began getting foul smelling discharge per vaginum and burning micturition. So she visited nearby hospital and taken treatment with some antibiotics. Due to recurrence, she visited our OPD. History of patient: curdy white discharge per vaginum along with itching on and off since 4 months. No history of dyspareunia, no history of cold cough fever. Menstrual history: her LMP was 3rd September 2023 and duration was 4 to 5 days and cycle of 30 to 32 days. Nature of menstruation is regular, 2 to 3 pads per day, no clots present, no dysmenorrhea. Her obstetric history is P2L2A0D0, P1L1 is FCH, 18 years back, full-term normal delivery. P2L2 male child, 15 years back, full-term normal delivery. Personal history: no any medical conditions, no comorbidities present. Surgical history was lab TL done 15 years back, no allergies and no addictions present. General examination of patient: general condition is fair, temperature was 97 degree Fahrenheit, pulse rate was 18 per minute, BP was 130 by 80 mm of edge, and SpO2 was 99 on room air. Systemic examination reveals RS clear, CVS S1 S2 normal, CNS conscious and oriented. Per abdominal examination, soft and non-tender reveals. Per speculum examination findings are curdy white discharge present with foul smelling, cervix was healthy and no bleeding seen. Per vaginum examination findings are uterus normal in size, free for nisus mobile, no tenderness observed. Investigations which are done are given below: CBC within normal limit, urine routine within normal limits, pap smear examination, no any changes seen. Intervention done are of two types: Sthanik Chikitsa and Abhyantar Chikitsa. Sthanik Chikitsa, Yoni Dhavan with the quath of Triphala, Danti and Guduchi once daily for regular 7 days. Quath preparation: Triphala Churna 10 gram and Danti and Guduchi Churna each 5 grams. mixed in 2 liters of water and reduced till 500 ml remains. Kayachikitsa, Vati 250 mg twice daily after food for 15 days. Follow-up after 7 days. Patient's complaint was reduced by 40 to 50%. Discussion. Trifala, Danti and Guduchi Yog mentioned in text of Yogaratnakar Yonivyapachikitsa Adhyay has all ingredients having Kaphavatahar property, which is helpful in treating most of the Yoni Vapad like Yoni Kando, Yoni Kleda, Yoni Strava, Shvetapradar, etc. Vati mentioned in Sharangdhar Madhyam Khanda having ingredients useful for treatment of Yonigat Roga and Mutra Roga. Conclusion. All the drugs mentioned in this study has properties like Laghu Guna, Kashaya Rasa, Tikta Rasa, that is Kapha Hara Guna, and Vata Shaman property, which helps to reduce the discharge and itching per vaginum along with the burning micturition. So as a result of repeated cleaning of vagina, it prevents the recurrence of disease. Thank you.
Thank you, Dr. Amrita.
Thank you, doctor.
Next is a poster presentation of Dr. Amrita Suryakanthakkare.
Good evening, everyone. Myself, Dr. Amrita Suryakanthakkare from second year PG SRPT Department, Yashwant Ayurvedic College, Kodoli. Today, I am going to present a topic called Rajaswala Charya. In other words, what is to be done and to be avoided during menstrual period. Goals of today's topic are educating people about menstruation, awareness about menstrual hygiene, and improving women's health. What is menstruation? It is a normal, periodic vaginal bleeding, occurs as a part of women's monthly cycle almost every 28 to 32 days. It is the regular discharge of blood and mucosal tissues from the inner lining of uterus through the vagina. Menstrual cycle characterized by the rise and fall of hormones. Menstruation triggered by falling progesterone level and is a sign that pregnancy has not occurred. Let's see what are the things to be done during menstrual period. First, use of disposable pads, tampons, etc. Use clean and sterile sanitary napkins during menstruation. If someone is using menstrual cup, one should take care that it must be sterile and should be clean after every use. Next, clean private parts frequently. Maintaining hygiene of private parts during menstruation is very necessary. The chances of infection during menstrual period is very high. So after every act of urination or toilet, one must clean the genital area thoroughly with water. Next, take rest more than other days. As during menstruation, blood loss is also there, so women should take proper rest for maintaining her health. Next, drink adequate water. As hormonal levels are changing these days, women experience symptoms like dehydration, weakness, giddiness, mood swings, etc. To overcome these, adequate hydration is needed. Next, healthy food. To regain loss occurring during menstruation, women should take proper diet. In Ayurveda, Rajaswala Charya has mentioned. It includes Laghu Ahar because during menstruation, Jatragni and Dhatwagni Mandya is seen. Hence, women should take light and easily digestible food like sattu, dal khichdi, vegetable soups, fruits, etc. Next, light exercise or yoga. As during menstrual period, Vata predominance is seen, women sometimes experiences pain in abdomen, backache, cramps, etc. To overcome these, one should perform light exercise like asana, Vajrasan, Sukhasan, Padmasan, Shavasana. Next, Vata Shamak and Raktavardhak Aushadhi. To overcome Vata predominance and to regain the blood loss during menstruation, one should take Vata Shamak and Raktavardhak Aushadhi like Dashmul Kwat, Dadimadi Kalpa, Rasna Panchak Kwat, etc. Now we'll see things to avoid during menstruation. First, avoid reusable sanitary products. As chances of infection during menstruation are high, if women use reusable sanitary products, they are more prone to infection. Next, avoid wearing same sanitary product for more than 4 to 6 hours. As during menstruation, using sanitary product for longer time leads to contamination and ultimately leading to genital infections. So, avoid longer use of same sanitary product. Next, avoid use of douching. Nowadays, many women practices vaginal douching, but during menstruation, blood flows outside the body, and if we perform douching, it will carry infection inside the vagina, and it may sometime land up into severe infectious conditions. Next, avoid exercise and hard work during this period. Next, Avoid sexual contact. As during menstruation, blood flows outside the body. While performing sexual act, it may obstruct the flow of blood and can cause infection also. Next, avoid fasting. As menstruation is Vata predominant state, due to fasting, Vata Vruddhi occurs. It may cause pain in abdomen, bloating, indigestion, etc. Next, spicy, oily, fermented food should be avoided. Preserved food, fast food should also be avoided. As I mentioned above, during menstruation, Jataragni Mande occurs, and preserved food, fast food, fermented food are heavy for digestion. So it ultimately leads to arm formation. So, concluding the topic with a note, let's break menstrual stigma. Menstruation is a completely natural and universal process associated with female reproduction. Manifestation or lack of information about menstruation leads to misconception, discrimination, and period stigma, which hinder girls and women from treating it as a normal part of their life. For this, communication between mother and daughter, teacher and student is most important. Then educating people about menstruation is a need for safety and comfort purpose. Recognition of power of menstrual cycle and stop using code languages. Treat period as a normal. Thank you.
Thank you, Dr. Amrita Surikant Bakare, for the paper and poster presentation. Next, I invite Dr. Palash Vinod Pandey for the paper presentation.
Good evening, everyone. Myself, Dr. Palash Vinod Pandey, second LPG student, Tomal Bhutta Department, Yashwant Ayurveda College, Tuduli, Solapur. Today I am going to present in topic integrated approach in childhood migraine, a case study. Migraine is a primarily headache disorder seen in childhood and adolescent age group. It is primarily a complex neurovascular disorder caused due to vasodilatation of intracranial and extracerebral blood vessels, simultaneously stimulating trigeminal sensory nervous pain pathway, resulting into headache. About 18% of pediatric emergency is migraine related. The prevalence rate is 2.5% under the age of 7, 5% from age of 7 to puberty, 5% in post-pubertal boys and 10% in post-pubertal girls. It is a hereditary disorder. The common symptoms are vomiting, severe headache, abdominal pain, photophobia, phonophobia, with or without giddiness. In acute condition, paracetamol with caffeine, naproxen is generally used with or without antacid and antiemetic. Types of migraine. Migraine with aura. Aura is a sensation of warning sign followed by unilateral headache. This sign may include fatigue, blurred vision, and blind spot. Second, migraine without aura. This type of migraine is very common, which does not have any kid of warning sign. As per Ayurveda, migraine is correlated with Vata, Pitta, Shloloth, and Aldabhedat in Ayurveda. Vata dosh mainly pranvayu that vitiated with or without Pitta dosh along with Majja Dhatu. The common treatment plan for Shloloth is Nitya Vilachan along with Pratimarshanasya and Shilo Abhyanda with oral medication. Method. A case report. A single case study of 9-year-old female child diagnosed with a migraine. From 2 years, she comes with complaints like headache with photophobia, giddiness, anorexia, and sleep disturbance since 1 day. Previous history, known case of asthma. Present history of same complaint since 2 years. Lethal of 1 episode per week. After exposure to trigger factor like spicy food, sun exposure, and sleep disturbance. Bulk history is full term normal vaginal delivery. Try immediately after bulk and 3 kg weight. General examination. Weight is 23.5 kg. Height is 126 cm. On examination, temperature is favorable. Pulse is 82 per minute. Respiratory rate 24 per minute. Systemic examination. CVS is normal. CNS is conscious and alert. RS is air entry bilaterally clear. Ashtavid Palishan. Nadi. What Petit Nadi? Mal. History of constipation. Frequency in 1 to 2 days. Mutra. Platlu. Jiva. Ishat Sam. Shabda. Spashta. Sparsha. Anushna. Glut. Platlu. Atluti. Madhyam. Symptom before and after treatment. Before treatment. Headache with photophobia, giddiness, anorexia, and sleep disturbance since 1 day. After treatment, headache is subside. No photophobia, no vertigo. First follow-up after 3 days. Before treatment, oral intake, normal, motion pass, sleep not sound. After treatment, sleep increase, no further headache episode. Second follow after 7 days. No episode of headache, oral intake is normal, sleep is increase, energy level increase. After treatment, no episode of headache since 2 weeks. Third follow after 15 days. No episode of headache since 3 weeks. No any fresh complaint. Treatment given. First, Pratimarsanasya with Shirbala Tel, 2 drops in each nostril. Morning between 8 to 8:30 am. Jatamansi Tel, Shilo Abhyanta. औषध ताळ morning between 8 to 8:30. Glashadi Tot, 7.5 ml. Anupan same amount of water at night. Avibhatidal Churna, 3 gram with Anupan water at night. सुवर्ण सुशेतरलस 60 मिलीग्राम, दुरालभा चूर्ण 125 मिलीग्राम, दोदंती भस्म 60 मिलीग्राम and प्लवळ पिष्टी 125 milligram. Anupan with honey 3 times a day after food. Tablet naproxen D 250 milligram as per need. First follow Pratimarsanasya with Shirbala Tel 2 drops in each nostril. औषध ताळ in morning 8 to 8:30. Shiro Abhyanda on alternate day. Third, Glashadi Tasayam 7.5 ml. Anupan same amount of water twice a day before food. Motit Tam Dudalas Anupam honey plus dhi after food in afternoon. Sona Sushatarlas 100 milligram Anupan honey plus dhi twice a day after food. Avipachil Churna 3 gram with water at night. Second follow Lasha Auler 3 gram with milk morning. Pratimarsanasya 2 drop morning. Motir Tam Dudalas 1 tablet after food in afternoon. Dulalaba Jatamansi Fund 40 ml plus Tulutta Chunla. Anupan 30 shatal Anushat at night. Result. The treatment was aimed by using herbal mineral preparation with some modern medicine as an integrated approach. Modern medicine only relieves temporary episode of migraine, whereas Ayurvedic medicine works on pathophysiology and dietary changes and lifestyle changes stored in Ayurveda. Improve the quality of life. Herbal mineral formulation like Glashadi Athwat, Motir Tamdudalas, Avipatito Churna, Sona Sushatarlas, Dulalaba Churna plus Dudanti Bhasma plus Pravar Pista is used to treat episode of migraine along with modern NSAID plus naproxen show significant improvement in short time span. Discussion and conclusion. Significant improvement was noticed after giving Ayurvedic preparation along with the Panchadharma like Nasya, Shilolep, Shilobhendra. The headache episode reduced gradually along with improved quality of sleep, increased appetite and energy. Shilwala Chel contain Bala which contain main portion of the alkaloid which identified to ephedrine by virtue of which it possesses cytostimulant properties on CNS. Dulalaba Churna is Vat Pitta Shamat and useful in Brahm and Mulsha. Jatamansi has made the effect along with Nidlajanan property. I told him to Bhav Pratash. Thank you.
Thank you, Dr. Palash. Next is a poster presentation. I would like to Dr. Palash Vinod Pandey for the poster presentation.
Dr. Palash Vinod Pandey, second year PG student of Tomal Bhatta Department, Yashwan Ayurveda College, Tudoli. Today I am going to present the poster on topic named Asthma Shield in Ayurveda style. What is asthma? Asthma is a chronic inflammatory disorder of the lower respiratory tract, characterized by the recurrent episode of variable, reversible airflow obstruction, airway hyperresponsiveness, and manifest recurrent wheeze and cough. Asthma is one of the common chronic disease of childhood. Nearly 14% of the world children experience asthma symptom. Symptoms are as follow. First, cough. It may be wet or dry. Second, wheeze on auscultation. Third, breathlessness. Fourth, chest tightness. Fifth, sleep issue. Sixth, white sputum. Seventh, exhale prolong. Pathology. Airway obstruction due to bronchospasm means difficulty in bleeding out due to bronchospasm, edema, and mucus plug. Risk factor: genetic, family history, atopic dermatitis, hygiene hypothesis, precipitating factor like clear zone means allergens to food, fragrance, flower, preservative, coloring agent, flavor, chemical industry, weather change, exercise, air pollution, all are considered as allergens and non-modifiable or modifiable factor. Treatment as per modern science, levers, short-acting beta-2 agonist, anticholinergic controller, long-acting beta-2 agonist, prevention, inhale, light, livolin and budesonide, corticosteroid, luteinizing receptor antagonist. Treatment as per Ayurveda, वेदावस्था अनुलोमन विरेचन सेंदो तेलनस्य ड्यूरिंग अवेदावस्था दोषोळादी दुद्धोळ मधुमालिनी वसन प्लस प्लेंटिव मेजर्स बाल चतुल बदल च्यवनप्राश सुवर्णप्राशन लाइफस्टाइल मॉडिफिकेशन प्रैक्टिसिंग प्राणायाम लघु मात्रावत आहार फॉलोइंग दिनचर्या आणि ऋतुचर्या. Thank you.
Thank you, Dr. Palash Vinod Pandey, for the paper and poster presentation. Next, I invite Dr. Jayashree Todaram Vakmare. Dr. Jayashree, are you there? Dr. Jayashree, are you there? Next, I invite Dr. C.T. Rishi Andrawade for the paper presentation. Dr. C.T. Rishi, are you there? Dr. C.T. Rishi, are you there? Next, I invite Dr. Priyanshi Saxena for the poster presentation. Dr. Priyanshi Saxena, are you there? Dr. Priyanshi Saxena, are you there? Next, I invite Dr. Vidya Ramchandra Pandikot for the paper presentation. Dr. Vidya Ramchandra, are you there? Dr. Vidya Ramchandra, are you there? Okay, finally, I invite Dr. Sushil Rohidas Ranjane for the paper presentation. Dr. Sushil Rohidas Ranjane, are you there? Dr. Sushil Rohidas Ranjane, are you there? We are come up to the end of the session. I would like to invite Dr. Aishwarya Aras to conclude the session.
Thank you, Dr. Sabin. So before winding up, I extend my heartfelt gratitude to all the participants for their active involvement and dedication. Your contribution have made this event a success, and one more days are there. And we appreciate your commitment for learning. And also special thanks to our esteemed faculties for their guidance and expertise. So on behalf of Team Ayurveda, once again, I thank all the participants and our respected faculties. Thank you all. We'll meet you today